So I have a saying, sir, in my. You will eat bread from your degree, but you will eat jam, butter, cheese, sandwich from Ozone. Okay.
Yeah.
So that is what our motto is. Like we empower our doctors more.
Dr. Mamta Somaya, practicing in again Mulund, Mumbai. And yes, Millie and me, we have been knowing each other since our graduation days. We were practically room partners in So she is my inspiration in Ozone. I've been practicing Ozone since 10 years, active Ozone since 10 years. And homeopathy, of course, 25 years.
Sounds great. Okay.
Hi, this is Dr. Rekha Yadav. I'm a trichologist and a functional medicine practitioner. I've been practicing in Mumbai for the past 25 years.
25 years.
Yeah, not into Ozone yet.
Okay.
No, she's learned Ozone, but maybe not practicing.
Not practicing, yes.
Okay.
So a motivation for you to practice.
Yes, of course. Dr. Kalini Prajapati, practicing Ozone since a year.
Okay.
Naturopath, got inspired about Ozone from NIN Institute in Pune. And working towards de-drugging people right now.
Okay.
And implementing naturopathy and Ozone on myself and family first.
Okay, great.
Dr. Geeta Jayaprakash from Mumbai. I'm basically a homeopath, doing homeopathy for past 25 years, into Ozone since 8 years. I'm also into integrative oncology, managing patients with homeopathy, Ozone, medical cannabis, and mistletoe.
Oh, great.
And vitamin C.
Vitamin C. Okay, sounds great.
Dr. Umash, I'm practicing in Mumbai since last 25 years. I'm MBBS and I'm practicing integrated medicine and Ozone since last 3 years.
Last 3 years. Okay, so.
Myself, Dr. Bisleri. I'm practicing in Jogeshwari now. I'm an MBA graduate. And this is my first interaction in Ozone.
Okay, so you must come for Ozone training.
You already registered.
Okay.
We don't leave any.
Hello, I'm Dr. Falguni Kaitonde. Dr. Millie and I were classmates from our homeopathy days.
Okay.
And I'm practicing homeopathy for 25 years and Ozone for 13 years now.
Mm-hmm.
And integrative medicine for about 10 years now.
Okay.
Good morning, I'm Dr. Deva Yarshindela, naturopathy practitioner from Hyderabad.
Hyderabad, okay.
I'm practicing Ozone since 5 years.
5 years, okay, sounds great.
Along with
Naturopathy, okay, sir.
Hello everyone, this is Dr. Nikhil and I'm oral oncologist. With Ozone I'm attaching since 10 years.
Okay.
2015 I just came here for Ozone continuing education.
Okay.
And I am in integrative medicine and Ozone since 10 years.
10 years, sorry.
Hello everybody, my name is Dr. Sami Dodia, classmate of Dr. Billy and Paul. I'm a general practicing, doing practice since 28 years.
Okay.
And Ozone since last 6 years.
6 years, okay.
Myself, Dr. Rajendra Berji from Karnataka. I'm practicing Ozone since 15 years, along with
Okay, great.
So in Belgaum.
Belgavi, okay.
So sir is from Karnataka.
Karnataka. Sirsi, I'm from Kerala, settled down in Karnataka from past few years.
Good morning. Myself, Dr. Haridwar Patil. I am ECP chelation and Ozone practitioner.
Okay.
I'm practicing Ozone since last 10 or 12 years.
Okay.
And special interest in preventive cardiology.
Preventive cardiology.
And applicate the Ozone in the circulatory system.
Okay, great.
He's an Ayurvedic doctor.
Ayurvedic doctor.
Yeah.
Okay.
Thank you.
Okay, sounds great.
Yeah. So who doesn't know?
My name is Anjali Mukherjee. I've been in the business of wellness since 40 years. I started my practice in 1984. I'm a nutritionist by qualification. Then I went on to study ozone therapy almost twice. I've done that.
Yes.
I have a PhD in nutrition and I'm also alternative medicine. I have an MD in alternative medicine. These are my qualifications. But right now we are into the business of nutrition because you can't be everywhere. We have 60 clinics all over the
currently she's doing internship with us.
Internship, okay. Ozone. Okay, okay.
Yes, sir.
I'm Dr. Vinay Kumar, practicing homeopath, and now very soon I will start Ozone.
Okay.
Very soon, he keeps sending so many patients for Ozone.
Mm-hmm.
It's amazing, you know, and amazing to see what kind of patients he treats.
Okay.
I think this can be the bridge between a lot of things.
Okay, yes, sounds good.
Hi, I'm Dr. Nidhi Gupta. I'm homeopath and ozone therapist and practicing since last 10 years. I do practice at VT Mumbai and Science.
Science, okay, great.
So good morning, I'm Dr. Tamil Arasi. So I'm practicing ozone since 2021. So I proudly say that I'm the first batch of NIN.
Of NIN.
Yes.
Okay.
And
Yes.
I'm also practicing Praveen Jacobs's protocol. It was really, really helpful. I'm looking forward. So I came from Chennai to attend sir's session. This is the very first time attending his session offline. I never missed a session online since 5 years.
Okay,
Wonderful.
thanks.
Okay.
Hi, I'm Kiran Patel and we have a wellness clinic in Mumbai, very close to Bisleri actually. And we are learners of how we can improve a person's well-being, wellness, general life, small steps. And learning is something that I think it should be on a regular basis because we all forget what we have done in the basics. And that's the reason why thank you, Dr. Dilip,
Welcome,
for
welcome.
organizing this.
Thank you. Thank you, Dr.
Thank
Praveen.
you, thank you.
And over to you.
Yes,
I
yes,
think
madam.
this is looking a little down to the valley. I'll give you a slide change.
Slide change, okay, perfect.
एक बार इस पे क्लिक हो जाएगा ना? क्लिक हो जाएगा तो आ जाएगा.
Please announce the slide you will provide.
Okay. So we can provide all the slides, no?
Yes, yes, definitely.
Okay, so you will be getting all the slides which are going to be, talked here. And of course there is, we are covering it online. So it will, you can always go back and view the whole session if you wish to. Pardon? Pardon? It's there online, you can go anytime and see it.
Okay.
So that is the link. Okay? And PPT you will get.
Okay, I'll share.
Thank you.
Okay. Good morning to everyone. Thank you, Millie ma'am, for connecting your family members to this training program. Thank you so much. And I'm appreciating.
Oh, hello. Introduce.
Introduce.
She needs no introduction, but.
Yeah, okay.
Yeah, I'm Dr. Chignasha Captain. I'm a director of Ozone Forum of India.
Okay.
And I'm practicing ozone since last 18 years.
18 years, sounds good.
And she's the main person of that clinic next door.
Oh, okay.
Thank you, sir.
And also I'm thanking Sachdev sir, my mentor, for coordinating to arrange this program. And thank you, sir. Thank you, ma'am. Dr. Praveen Jacob, currently we run a naturopathy hospital in Karnataka, in a small taluk. So it's gone from 5 beds to 200 bed in a span of 15 years.
Wow.
And we have occupancy 5 months to 6 month advance booking is going on. Now government of Karnataka allotted me 100 bedded hospital to operate for 25 years. Another hospital is coming up, yeah. So mainly we practice from two perspectives. Metabolic disease such as diabetes, PCOD, obesity, insulin type 2 diabetes, fatty liver, dyslipidemia, not the hypercholesteremia, dyslipidemia, which means the cholesterol is in normal range, but triglycerides are elevated. LDL. Okay. Yeah. So that's called as dyslipidemia. So these all are manifestation of insulin resistance, and only one cause for insulin resistance, which is visceral fat. I'm going to explain the mechanism how visceral fat is associated with the metabolic syndrome. So, so-called lifestyle related disorders are consequence of visceral fat. Okay. Next one, gut. Gut is most likely related to autoimmune disorder, allergy disorder, digestive disorder. Today there is a trend that everyone says all diseases are connected to gut. No, not all disease. So visceral fat is contributed to metabolic syndrome, gut is related to digestive disorder and autoimmune disorder. So these two disorders I would like to elaborate it. So the fundamental cause of most of the chronic disease human being encountered today can be attributed to 5 fundamental causes. First is mitochondrial inflammation, second is gut inflammation, third is visceral fat inflammation, fourth is cellular inflammation, endothelial inflammation. We know that in modern medicine has one strategy to reduce cellular inflammation. May know anyone can tell me what is the way allopathy, modern medicine, conventional medicine target inflammation? Steroids and non-steroidal, non-steroidal anti-inflammatory, that's all. Only using like NSAIDs and steroids, which target cellular inflammation. The cellular inflammation in all living organisms, regardless of the species, are mediated by a fatty acids. Anyone can say which fatty acids mediate inflammation? Yeah, arachidonic, it's called as arachidonic acid, convert into prostaglandin. This pathway is blocked by non-steroidal anti-inflammatory drugs. That's all. So modern medicine can address only one inflammation, that is cellular inflammation, using steroids. So I'm not going to give the brief, it's a very longer topic. In fact, this is my 5-hour topics on cellular inflammation. And next is endothelial inflammation. We know that it's not from high number of LDL. The root cause is endothelial dysfunction. Endothelial dysfunction. It is similar to a coating, like the wheel, coating on the inner surface of the cell membrane get damaged, the cholesterol. So uncontrolled diabetes, uncontrolled hypertension. This both the factors damage endothelium, cholesterol get penetrated to second layer. So 85 to 90% of cardiovascular disease found for this particular group. Uncontrolled diabetes and uncontrolled hypertension, 90%. It's not from hypercholesteremia. This is a fundamental cause. And the first one, mitochondrial inflammation. For instance, what do you mean by mitochondrial inflammation? That determine our aging process. It is neither non-vegetarian diet or vegetarian diet influence the aging process. It's called as mitochondrial inflammation. For instance, we are second longest living mammal.
Just 2 minutes. Put your phone on silence. I don't want this TT doing your. Sorry, sir.
So there are about 7,000 mammalian species are found in today. Okay, 7,000 mammalian species. Longest living mammal is blue whale. Second longest mammal is human being. So the monkey, they have same genes like me and yours, but lifespan is 30 years. They do lots of exercise on the branches of trees. They eat fresh food, organic food, raw food, but lifespan is only 30 years. Rats and mice, lifespan is only, rats and my genes are 90% similar, but lifespan is 2 years. So the major factor influence the aging process called as mitochondrial inflammation. It is something like the flame in mitochondria. So animal which breathe faster die sooner. When you breathe faster, the metabolic rate goes up. That creates lots of free radical and aging process. So today I wish to focus on 2 major inflammation, that is gut inflammation and visceral fat inflammation. Visceral fat inflammation associated with insulin resistance, diabetes, PCOD, NAFLD, dyslipidemia, obesity, gut inflammation, digestive disease, allergy, anxiety, depression, and autoimmune disorders. Yeah, for instance, these are the 5 long living mammals in the planet. The longest living is blue whale. The lifespan 200 years. Second longest living mammal, human being, 80 to 100 years. Third one is elephant. Fourth is hippos. Fifth is camels. So one unique pattern, one pattern can be observed here. The body size is directly related to, the bigger the body size, better the lifespan, except human. Despite having small body size, we live longer. And another mystery of human being, human is the only one mammal survive after menopause. You know, we are the only one species survive after the post-menopausal life expectancy. That is a major distinctive character of human being. So we have many distinctive characters like post-menopausal longevity. The second, walking in 2 legs. The third is having a larger brain, no hair on the skin. No hair on the skin. So we have another, the important feature of human being is the fat percentage. So there is a 2 distinguished characteristics of long-living mammals. The first is body size. The second feature is fat percentage. More the fat percentage, better the life expectancy. Best example, human female. Lifespan is 6 years longer than men is more muscular, female is more fatter. So it's not the, so all the fit animal with the more strong muscles, lifespan is shorter, like tiger, lion, lifespan is, because muscles increase the oxidative stress. That's the one reason. And another, you can just Google it, the life expectancy of professional gym trainers, 15 years shorter than rest. You can just Google it, okay, whenever you get time. Yeah, just you can. It's a well, there are so many studies that have been published about the professional gym trainers, average life expectancy 50. The volleyball players, 55. Football players, 55. Marathon runners, lifespan is shorter. Just there are so many studies that have been published. I'm not exaggerating. When you get free time, please study about this fact. So it's a major factor. The stronger muscles increase oxidative stress. It's a very long topic. I mean, maybe another occasion I can deliver about this one. So second, that's why muscle has less mitochondria. Okay, muscle has, sorry, the fat cells has less number of mitochondria compared with the muscles. Like a muscle has around 2000 mitochondria, fat cell has less than 50. So the oxidative stress are very lower in fat cells. So survival of the fattest, not the survival of fittest. So this is the very important fact to notice here, that the 2 characteristics of long living animals, one is body size. Bigger the body, better the life expectancy. Second, fat percentage are strongly related to longevity. Our cousins, human cousins, there are 400 types of monkey species found in the planet today. 400 types of, including human being, chimpanzee, gorillas, different type of monkeys. They share 99% of similar genetical makeup, okay, 99%. Despite of having same genes, the monkey's lifespan is 20 years. We live. The important fact is monkey has only 1% of fat in body. We have 20 to 30%. Why I'm stressing on the fat distribution? But the site of distribution is very important. Where it is located. That's what the most crucial factor here. Determine the life expectancy. 3 type of fat distribution. Fat in buttocks, under the skin, is called as subcutaneous. It's called as subcutaneous fat, okay. Whereas ectopic fat, the fat in liver, fat in visceral region is called as ectopic fat and visceral fat. Very dangerous type of fat distribution. Very dangerous type of fat distribution. So subcutaneous fat, the short name is SAT, subcutaneous adipose tissue, directly related to longevity, and visceral fat is inversely related to longevity. So I'm going to explain how the visceral fat and ectopic fat drive insulin resistance. Yeah, so for instance, the French diet and Indian diet, protein 20, fat 40, carb is 40, total cholesterol 250, and Indian population 200, HDL above. Yeah, so you can notice here the cardiovascular death, 150 death in 1 lakh population, India 400. Despite having low cholesterol, low fat percentage in diet, the diet mainly consists of carbohydrate in Indian pattern, you know. So, but you see the diabetic prevalence is unusual here. And we have a, exceptional number of cardiovascular disease as well. So the major culprit here, excess carbohydrate, and excess carbs convert into visceral fat, and visceral fat drive inflammation. That's what I'm going to explain here. The insulin resistance, we know that type 2 diabetes, fatty liver, hyper PCOD. And for instance, this slide will showcase you how visceral fat are very dangerous type of fat distribution. Body mass index of a typical Indian 20 to 25, diabetic prevalence 20, body mass index of sumo fighters above 45, diabetic prevalence is below 2%. What's the major difference here? Despite having more body weight, morbid obesity, they don't develop diabetes and insulin resistance. Scientists were astonished. The ultrasound scanning exhibited that although they have obesity, they don't have visceral obesity. It's a clear example that the culprit is visceral fat. Okay. And you see the human female, the fat, survival of fattest, visceral adipose tissue, the hidden culprit of type 2 diabetes. Increased visceral adipose tissue, an independent predictor of future development of atherogenic dyslipidemia. That's what happens in India. There is a studies conducted in Calicut Medical College. The cardiac, the 100 study involving 100, cardiovascular disease patient. They had first heart attack, and 96% of them had the total cholesterol within normal range. Despite having the perfectly normal cholesterol, they developed cardiovascular disease. The major problem here is called as dyslipidemia. There is a distinction between dyslipidemia and hypercholesteremia. What is hypercholesteremia? What do you mean by hypercholesteremia? The LDL cholesterol is above 150. It's called as hypercholesteremia. In dyslipidemia, the LDL is below 100, but triglycerides are elevated. HDL goes down, triglyceride goes up, LDL is within normal range. Total cholesterol most likely between 100 to 160. And this pattern is called as dyslipidemia. Dyslipidemia is the consequence of visceral fat inflammation. Hypercholesteremia may not contribute to cardiovascular disease. Yeah. So I'm going to highlight here the major difference between visceral adipose tissue and subcutaneous adipose tissue. And scientists have identified over 500 hormones secreted from adipocyte, okay, or over 500 hormones secreted from adipocytes, and the hormone from subcutaneous adipose tissues are anti-inflammatory, but the hormone from visceral fat is pro-inflammatory. So SAT to VAT ratio is the most crucial determinant factor, influence the the marker of metabolic syndrome. And additionally, so insulin resistance, dyslipidemia, visceral fat secretion is associated with the systemic inflammation in obese humans. So I'm quickly going through. So what's the major difference between visceral fat and subcutaneous fat? Visceral fat, the main difference, the visceral fat connected to liver, hepatic cells through portal circulation. Okay, so it's like express highway connecting visceral fat to hepatic, portal circulation. So all the hormone and toxins generated in visceral fat quickly delivered to hepatic cells and leads to hepatic insulin resistance. The fundamental initial steps of development of metabolic syndrome. And second one, the subcutaneous fat is connected to liver cells through systemic circulation, like lymphatic circulation. So it takes very long time to reach. And second one, the visceral fat is very small in size. Visceral fat is very small in size, but subcutaneous fat is larger in size. And another, the characteristics of visceral fat is less number of pre-adipocyte. Here there is lots of pre-adipocyte. What is pre-adipocyte? Which can differentiate into adipocytes. For example, when the main problem of lipids cannot mix with the water fluid, because they are hydrophobic. They are hydrophobic in nature. They cannot mix with the water. So the cytoplasm is fluid. How the fat can store in cytoplasm? Have you ever thought it? How the lipid, a hydrophobic material, can store inside a fluid medium? There is a smart mechanism, something called as endoplasmic reticulum. So the fat is stored in the leaflet of endoplasmic reticulum. Okay. So when you have so much of fat, that push the nucleus to the corner. Okay, so too much of fat push the nucleus to corner, and it leads to endoplasmic reticular stress, and that is a trigger for apoptosis, cell death. And there are lots of macrophages surrounding the adipocyte. So the visceral fat is small in size. So a small amount of fat causes more pressure, more stress, like a physical pressure, mechanical pressure. That's why there is so much macrophages found in visceral. And there is another property of visceral fat. Visceral fat is more likely to go for hypertrophy, but subcutaneous fat, hyperplasia. Got the difference here? Hypertrophy. So conjunction. Hyperplasia means when the one cell is filled with the fat, next cell is generated. So it spill over to. So there is not congestion. Okay. That's why these are the two major characteristics of visceral adipose tissue. The first is the small in size. There is a large number of macrophages found in visceral fat, minimum number of immune cells. Small adipocyte with the subcutaneous fat is like a huge go down. So very small size, you know. Next one, lots of androgen receptors. That's why male are more prone to develop belly fat. There is a substantial number of androgen receptors on. So testosterone bind to the visceral fat and the multiplication, or you know, that facilitate accumulation of fat. And next one, large adipocyte, less androgen receptor, manifest more insulin resistance, more de novo lipogenesis. This is my 5 hour topics. Okay, that's what I'm going very quickly. Connected through portal circulation, connected through systemic circulation, increase lipolysis. There is a breakdown of triglyceride to free fatty acids. And here, decrease lipolysis, presence of M1, this is pro-inflammatory macrophage, presence of hypertrophy, hyperplasia. That's why there is all these hormones, pro-inflammatory hormone, over 500 has been identified so far, are secreted to portal circulation, quickly delivered to hepatic cells, leading to hepatic cell inflammation. And I'm going to explain how the visceral fat hormone associated with the insulin resistance. That's a molecular mechanism. So visceral fat. So you can notice here, lots of macrophages. For one adipocyte in visceral adipose tissue, 10 macrophage. In subcutaneous adipose tissue, the macrophage density is like 10 subcutaneous cells, 1 macrophage. So the ratio of macrophages are so high in visceral fat. They drive the, so with the macrophage accumulation in adipose tissue, increase adipose tissue expression of tumor necrosing factor alpha in human obesity. Yeah, so visceral fat produce one cytokine called as tumor necrosing factor alpha, and that is responsible for progression of insulin resistance. Macrophage secreted factors induce adipocyte inflammation and insulin. The major factor is tumor necrosing factor alpha. Oh, okay. Yeah, so this is, I'll quickly finish these topics and I will step into next one, gut inflammation. It's very important to understand how the tumor necrosing factor alpha secreted from visceral fat associated with the insulin resistance. You see, the insulin belongs to a family of enzymes called as kinase family. What is the main function of kinase family of enzymes? Adding phosphate group. Okay, so there is a 2 families. The kinase group add phosphate to amino acids. The phosphatase groups remove. So very important cellular functions. Many enzymes and proteins and receptors activated and deactivated by adding phosphate or removing phosphate group, which is mediated by 2 enzymes, kinase and phosphatase. How many amino acids are found in totally? How many amino acids? 22. Of 22, 3 amino acid has the ability to accept phosphate. Okay, only 3 amino acids has the ability to accept phosphate group. Which are those? Tyrosine, threonine, and serine. Only 3 amino acids. Okay. So insulin is a tyrosine kinase. What it means? What it means? Insulin is a tyrosine. What it means? It add phosphate group to tyrosine, not to threonine and serine. One simple, what to tell, disruption happens in insulin resistant. Instead of tyrosine, serine get phosphorylated. That's all. Instead of tyrosine, serine get phosphorylated. That is the underlying cause of insulin resistance. Okay. So I'm going to explain the next mechanism. And there are IRS1. This is the total mechanism of insulin. You can notice here. This is a receptor. Insulin binds to the receptor. And in cytoplasm, there is a protein floating called as IRS1. And what happens? Once the insulin signal to IRS1 by the insulin is a tyrosine kinase, insulin add phosphate to the tyrosine residue of IRS1. Subsequently, IRS1 stick to the receptor. Okay, it sticks to the receptor. So the major criteria for this mobilization is phosphorylation of IRS1. Okay, phosphorylation of. Is it clear? Very, very important too. Crucial mechanism to understand about insulin resistance. What is the mechanism? Insulin receptor, insulin bind to the receptor, and subsequently the IRS1 stick to the receptor by phosphorylation of IRS1. Okay. So in insulin resistance, what happens? This phosphorylation is impaired. There is a defect in this phosphorylation. So the IRS1 cannot stick to the receptor. So the major responsible factor here, there is a hormone secreted from, this one you can understand. So IRS1, the protein, consists of 1242 amino acids. Of 1242, 21 amino acids are tyrosine, and 67 residues are threonine, and 180 residues are, So insulin is supposed to phosphorylate 21 tyrosine residue of IRS1. But in insulin resistance, this process is impaired. This process is, there is a defect in this process. Instead of tyrosine, 180 serine residues are getting phosphorylated. How it happens? What is the cause here? The mechanism here I'll explain. The TNF alpha I mentioned initially from the visceral fat, which has receptor on the cell surface, TNF alpha receptor, enter to the cytoplasm, activate one enzyme called as serine kinase. TNF alpha activate serine kinase, add phosphate group to the serine amino acid residues. So the phosphorylation of insulin, tyrosine is reduced. The serine phosphorylation is increased. So what happens? IRS1 cannot stick into receptor. Instead of sticking to receptor, that is pushed to the lysosome where it is degraded. So the signal cannot be passed down to the downstream target. This is a mechanism of insulin resistance. Hope you understood. Instead of tyrosine phosphorylation, serine phosphorylation is facilitated. That is, facilitated by TNF alpha secreted from visceral fat. Activate serine kinase. Serine kinase donate the phosphate group to serine residues instead of tyrosine residue. This is what happens with the insulin resistance. If any doubts, please you can. Molecular mechanism of insulin resistance. Serine phosphorylation of insulin receptor substrate 1 and increased expression of P85. The two sides of coin. Serine phosphorylation of insulin receptor substrate, a novel target for revert insulin resistance. So this adipose tissue, like visceral fat produce all the cytokine anti-interleukin 4, 10, adiponectin, omentin, apin, the icosanoids and adipokine in breast cancer. the cytokine from visceral fat even can contribute to breast cancer, 13 types of cancers. Many people say, I'm eating organic food, I'm a teetotaler, I don't take alcohol. Despite of this, why I'm suffering from cancer? The missing link is visceral fat. If you test a vegetable, maximum you can detect 5 to 10 chemicals, but visceral fat produce over 500 types of, this is a real missing link. One of the mysterious cause for many incurable diseases, the toxin from visceral fat. And I was a diabetic patient when I turned 27-year-old. My father, I'm 47 today, my father damaged both kidneys when he turned 47. My grandma's sisters, all of them passed away before crossing 50th. This is very premature onset of diabetes in my family. Everyone developed by 20 to 25 and maximum life expectancy 50 to 55. That's what happened in my family. And I was not exceptional. Then I developed diabetes and understood the mechanism of visceral fat. My dietary protocol, exercise, and I eat extremely low carb diet. The main culprit is high carbohydrate density. That's why despite having low cholesterol for Indian population, we develop dyslipidemia, fatty liver, because of insulin resistance. Insulin resistance is a consequence of the toxins from visceral fat. Vaspin promote insulin sensitivity in elderly muscles and is upregulated. Vaspin is secreted from subcutaneous fat. This emerging role of adipocytokine in type 2 diabetes and pro-inflammatory hormones are secreted from visceral fat and subcutaneous fat. Adipokines emerging depression biomarkers, systemic review and meta-analysis. So cytokine and toxins from the visceral fat even associated with the depression and anxiety, hypertension, blood pressure. Chimerin connect fat to arterial contraction. Chimerin is a hormone secreted from visceral fat which contract the blood vessels, leading to hypertension. So this is where all the problem starts, visceral fat. So next I'm going to stepping into the protocol to reduce the visceral fat. The main culprits are excess carbs. I'm not saying carbs, excess carbs. Second is refined oil rich in omega-6 fatty acids. The third one is, the most dangerous one is third one, fructose, sugar. So these are the foodstuffs contribute to progression of visceral fat. And so I wish to start with the third one, the fructose. The major problem of fructose, mitigating factors and metabolic mechanism in fructose-induced non-alcoholic fatty liver disease. The chronic liver disease was almost always due to alcohol intake or viral infection, but today over 90% of the hepatic injury is related to non-alcoholic fatty liver disorder. The fundamental cause is insulin resistance. So as I told you, pointed out earlier, 3 types of fat distribution: ectopic fat in liver, visceral fat in surrounding the organs, and subcutaneous fat. Even ectopic fat is not as dangerous as visceral fat. Okay, but ectopic fatty liver also can connected to inflammation, but not as dangerous as visceral fat. The fat surrounding. So few individuals, they look very slim. Even they don't have much belly fat. They might be having visceral, which you cannot notice from outside. May not pose. Yeah. Why fructose is most dangerous? Because we know that glucose and fructose, the structure is C6, H12, or 6. Similar structure for glucose and fructose, but both metabolize in a distinctive pathway. For instance, the glucose, there is a two pathway, glucose convert into acetylcholine, which can convert into ATP or lipids. Okay, glucose has two destinations. Either it goes to ATP in mitochondria, or it converts into, it's called as de novo lipogenesis. Glucose split into acetylcholine, acetylcholine convert into ATP, or it is pushed outside the mitochondria to cytoplasm, where it goes for de novo lipogenesis, like here, glucose to triglyceride fat, acetylcholine to fat, or acetylcholine to cholesterol. Or it can convert into amino acid, glycogen. There are different pathways. But the problem with the fructose, it cannot process in mitochondria to generate ATP. Only one destination, it convert into triglyceride. Fructose convert into triglyceride. It cannot convert into energy, ATP. That's where the major problem lies. So what happens? Quickly all the fructose convert into fat and start depositing in visceral fat. Actually, this was a mechanism for our ancestral survival, because during summer season, our hunter-gatherers, there is a period of abundance and scarcity for 6 months. And when you have abundance of food, that should be stored. To store the fat, only one mechanism should be helpful. What is that? Insulin. Without insulin resistance, we cannot put on the weight. So insulin resistant was our survival mechanism for ancestors to store fat and survive period of fasting or starvation, followed by, So what happened? The main benefit of summer, there is so much of fruits and honey is available. What is the major content of honey and fruits? Fructose. They consume like 5,000 calories. They gain 5 to 10 kg of weight because of the fructose increase their visceral fat, which induce the inflammation. They start gaining, and that extra fat what they gained helped them to survive during the period of feast. So this was a survival mechanism. But today we are surrounded by food always 24 hours into the. That's why the same mechanism is eating us today. So people who had tendency to put on weight faster, they survived the period of starvation. So actually, the individual with the tendency of gaining the weight, they have survival gene, like a better longevity gene, because of. But today it is cheating. When it persists for a longer time, it converts into diabetes or NAFLD. Okay. Yeah. One more. Delivered a talk in Baba Ambedkar University on 2000, like November 1st was my talk. I was invited to deliver a talk, and we had around good gatherings over there. Next day, I fixed for my consult because I got connecting flight on next day. So half day I had a consultation next day on 2nd of November. So there are lots of Afghani scholars pursuing the PhD in the campus. Okay, very huge campus. Entry to exit is almost 3 kilometers. So one Afghani, Malik, his name, PhD scholar, came to my clinic and he asked me a question. Doctor, after joined the course, I'm not eating as much food as in but I gained 20 kg weight, and what is the reason? And even along with my friends, I'm walking daily. Even in, I have only one habit, eating and sleeping. I don't even take 10 steps in Afghanistan. All my friends and relatives, but they are not obese. You will see all the students and the faculties in university, they are walking 8 to 10 kilometers, but they have obesity. What is the reason? And I really, I was intrigued by his query to me, asking what is the type of stuff. They told we eat mountains of basmati rice. Second, then I suspicious about omega-6 content. So they are consuming mustard oil, which is lacking omega-6. So I ruled out that it is omega-6 inflammation. Then $1 million question asked them about fruits sugar consumption. They told the bakery consumption is literally 0 in Afghanistan. After he joined here, the main problem, everyday celebration, birthday celebration, Lucknow, city of sweets, everyone carry everyday sweets. He got addiction to sweets here. And when I tested his insulin, fasting insulin, it went up to 56. That was the culprit here. So that helped me to understand the most of the lifestyle related disorder. The starting point, I was confused whether hen or egg came first. Hen or egg came first. This was the question. I was really. Then later I understood that during our, childhood, the parents feed us with the baby food. Baby food. You see, when child drinks the breast milk of mother, rich in fat, low in fructose, the child is lean. The moment you switch over to baby food, consists of 40% of fructose. Sugar is added, lots of sugar. The child get plumpness. Parents are extremely happy for that, So same mechanism is cheating. So we started depositing the fat in the visceral adipocyte from the childhood because of the rusk to biscuit, number anything, everything is contain not carbs, added with the fructose. Fructose. So my patients ask me, doctor, I stopped drinking tea with the sugar. In a cup of tea, maximum you will add 5 grams of sugar, okay. But 5 biscuits contain 2 teaspoons of sugar, which is not invisible to our eyes, that's all. So most of the foodstuffs what we consume today adulterated with the fructose, and fructose is quickly converted into visceral fat. Visceral fat drive inflammation, insulin resistance. Once you develop insulin resistance, the cells lose the ability to press carbohydrate also. The rice, okay, when you consume rice or high carbs, because of insulin, it cannot enter into cells. But it was comfortably entering into cells during your childhood. So the main culprit here, visceral fat, and all type of sugar has to be eliminated from the menu plate. That is the main steps to reduce the visceral fat inflammation, including jaggery, honey. Jaggery contains 376 calories, sugar contains 376 calories, that's all. Nothing, essentially both are fructose. Nothing, no different between.
So
yeah.
people say, oh, I eat jaggery and all.
Yeah, okay.
How many calories in jaggery?
Same. Both are same. Yeah, so the excess carbs intake. Next one, non-alcoholic fatty liver, consumption of vegetable oil containing omega-6 fatty acids such as linoleic acid is most effective way to induce fatty liver disease. And this is a list of omega-6, sunflower, corn oil, cottonseed, soya bean, coconut oil, and ghee and butter. The omega-6 is, so the better oil to reduce visceral fat is coconut and ghee, because they're extremely low in omega-6 fatty acids. So this balance is also very crucial. Yeah. Next is, you see the fat in the dietary pattern of human with the primates. The cooked food, only one primate consume cooked food, that is human being. We live longer. Okay, we live so longer than any other primates here. So fat is very important for human. So when you reduce the carbs, like there's 3 steps. The first step, you can reduce the carbs content or the fructose, the carbs content of grains by a simple technique, a simple trick called as cooling of the starch. The cooked rice, the boiled rice or cooked rice, quickly transfer to refrigerator. Let it rest in the refrigerator for 24 hours, and after 24 hours, you reheat it in the oven or whichever method you can reheat it. So when the hot rice cool down very quickly, a process is undertaken inside the starch called as retrogression of starch. The starch became resistant starch. So the digestive enzymes cannot access into resistant starch. So 40% of the glucose, rather than entering to bloodstream, goes to the colon, where it became a fuel for gut bacteria. Prebiotic. It became a prebiotic fiber. It's an amazing way to control blood glucose or the rapid spike of the main problem. First chapati goes to mitochondria. Second chapati goes to visceral fat. Okay, because excess glucose. But the fructose, the problem of fructose, 100% of fructose is converted into visceral fat. When it comes to carbohydrate, like grain, starch, not all carbs. And if you do exercise, like 1 hour of exercise, and consume the chapati, 3 chapati, it goes to your mitochondria. Without exercise, when you consume carbs, it goes to, because there is some more pathway called as exercise-induced glucose uptake. So that's what the major problem. Reduce the so 3 steps to reduce the glycemic load. The first is reduce the carbohydrate content. Like instead of 3 chapati, comes down to, don't pair carbs with the carbs. Like we pair carbs with the carb always. Like rice, then chapati, rice, sweets, fruits. This is a common pattern. So we are pairing carbs with don't ever pair the carbs with the carbs. You try to pair with the carbs with the fat and protein. Okay. So reduce, either you choose rice or one solution. Reduce the quantity of, instead of stopping.
1 grain at a time.
Yeah, 1 grain at a time. Don't choose 2 grains.
But then you said you pair, we usually eat roti with
sabji.
Roti with dal. Now,
No, that's fine.
That's okay.
That's fine, because it's a resistant starch. There is a different type of starch, like some starch absorb very quickly. An example I'll tell you. The pepper. Imagine that 1 kg of paper, 1 kg of wood. If you set the fire to paper pieces, it converts into ashes in seconds. But although the weight is same, it stays for longer time. So resistant starch converts into glucose very quickly. Got the point? So it's not the main problem, because of our modern sophisticated machineries, like we are powdering grains into small tiny particles, so it enters to bloodstream quickly. That's what the problem happens, you know. That's also one significant factor for metabolic syndrome. So when the glucose enters quickly to bloodstream, it cannot process in mitochondria, it converts into triglyceride. That's what. Same glucose, suppose if you imagine that rice contains 100 gram of glucose, if it enters in 1 hour, it converts into 30 to 40% convert into triglyceride. The same glucose, if I enter in 2 hours, it cannot convert into triglycerides. You know. So the trick is that we should make the glucose to enter very steadily and slowly into bloodstream. So for that, 3 mechanisms are available. First one, reduce the carbohydrate content. Second one, cool the rice. I've seen with my patient, we did a small trial also, 30 to 40% reduction in second day. They can eat same amount of rice, but the rice should be cooled down, or even wheat or any type of grains or tubers, boil it, cool down in refrigerator, rest in refrigerator for 24 hours. That reduce, is the glucose convert into resistant starch, complex carbohydrate. So the post-meal absorption rate is down by 40%, and this 40% of resistant starch goes to colon, where it tends to be the fuel for gut bacteria. It's become a probiotic fiber. That's the second mechanism, okay. The third mechanism, you can try with your patient, a very powerful mechanism. 100 gram of rice, for instance, 100 gram of rice contain approximately 360 calories, okay. So just try with the 100 gram of rice. Test the blood glucose after 2 hours. Next day morning, after 24 hours, you give 2 teaspoons of ghee. Mix with the same rice, the sugar will spike only to 30% lesser. Because fat in the rice, the fat slow down the gastric emptying time. Okay, fat inhibit the gastric emptying time. The motility of the gastric emptying time is significantly reduced by fat. That's what very, very simple trick you can use here. Before rice, one salad with a fat dressing. Ask them to take 10 to 20 pieces of nuts or paneer or eggs. Later they can eat as much rice as possible. This will prevent 30% of reduction of glucose spike. So the first one, reduce the carb density. Second time, cool down. Third technique is add fat and protein. Both has the ability to reduce the gastro emptying times. Okay. So
this is the key to reduce
visceral fat. Key to, or you can walk for after meal. Don't sit ideally. Go for a morning walking. Or another fifth mechanism, muscle contraction. It's an amazing mechanism. It's called as, there is a 2-door for entry of glucose. Usually glucose enters to cells through insulin. And visualize that there is a 2 types of door in our cell membrane. The first one is gliding door. Second is lock and key mechanism. The fat and protein enter through gliding door. Glucose and starch, fructose enter through lock and key mechanisms. Okay. The third door is found now. It is called as exercise induced. When scientists they removed pancreas, necrotized pancreas of 100 rats. Rats don't have pancreas anymore. Pancreas, okay. So when they fed glucose, sugar, high starch diet, the hyperglycemia, the glucose went to 500. No insulin in the plasma. Literally, no insulin in the plasma. How the glucose can enter? So they thrown this 100 rats to swimming pool, and 5 hours, it was forced to run in the swimming pool. After 5 hours, they collected the plasma. Astonished to see the glucose became normal. Then they realized that there is some alternative pathway for entry of glucose into mitochondria. That's called as exercise-induced glucose uptake. I don't have time to explain this pathway. So to be put into simple terms, just take some small weight, like not the heavy weight. You can start with the half kg of the weight. Like do 100 times, 100 times, 100 times. So this will activate a pathway called as GLUT4 induced uptake of glucose. Okay. So and this sensitivity persists for 24 hours. Which means if you do this 1 hour exercise or half an hour exercise, 1000 repetition, the insulin sensitivity improve for 24 hours. So this exercise is also highly beneficial for controlling the blood glucose.
So there used to be this one person.
Immediately after food?
Not immediately after food also, morning you can do. So that will reduce your blood glucose for another 3 meals. Not immediately, because the door is open for, the alternative door is open for 24. Alternative, that door is called as exercise induced GLUT4 uptake. The door is open for 24. It's a temporary, not permanent result. Okay, 24 hours. You can try with your patient. Ask them to repeat for 1000 times. And the previous day you give them some 5 ladoos, 5 chapati and bowl of rice and check the blood glucose. And next day after this exercise, same diet you provide to them, you'll be astonished to see 50% reduction of blood glucose in just in 1 hour by activating second pathway called as exercise induced glucose uptake. All you have to do is repeated contraction of muscles, not the heavy weight or running or walking, repeated contraction of. As long as they follow, the glucose will be controlled. It's the benefit available for 24 hours. No, that's what. Start with the 10 minute. 10 minute. And you see another important, the calf muscle raising. Because it is called as peripheral heart. You know, this contraction take up lots of glucose from the bloodstream. So you can train them, not immediately one day to 1000 repetition. Start with the 5 times, not 5 minute, increase to 10 minute. Repeated multiple times per day. Not a single time, they can repeat for multiple times per day. Yeah. Now the another, so the best, so the all I've okay, ask me.
Yeah, so about this rice, you said hot rice you keep in the fridge.
Refrigerator, yeah.
If we don't keep it in the fridge, we just keep it outside and allow it to ferment.
No. You know, this should cool down faster. So the starch became like cement, concrete. You know,
Complex.
that's yeah. It's very complex starch.
And any kind of rice, what about part?
Rice, any type of starch item. It's not only rice. This is called as retrogression of starch. The starch retrogression. So the amylase, the digestive enzyme, which break down the glucose and starch, cannot enter into the. It became very complex structure. That's what it happens. So the starch goes to colon, where it became prebiotic fiber. The gut microbial bacteria can flourish over there. Yeah.
So one more question from my side. What about the nowadays there are more fruit sugars and.
It's all just hypes up. Don't trust on this reels and YouTube videos. You know, so there the main aim is to get a views and popularity. That's all. They will manipulate everything. There is no.
One clarity. You cook the rice.
Okay.
Once it comes to room temperature, you fridge it.
Not room temperature. Hot rice you transfer to refrigerator. Yeah. Yeah. Anything. Yeah.
So like you strain the rice.
Rice and you.
Rice only you put
little maybe if you know.
Fridge cannot.
Fridge cannot handle. No. So after 10 minutes you can. After 10 or 15 minutes you can transfer to refrigerator.
And then use it next day.
Next day you can reheat as many times as possible.
So similar mechanism of parboiling or something.
No. Parboiling is different. This is you are you are activating a process called as retrogression of starch retrogression.
In Ayurveda, it says it causes
Vayu.
Stale food.
But you can heat,
okay.
Ayurvedic is
Okay, reheat the. No, that's the myth in our country from long time, you know. So eat fresh food, and there is no myth, because even if you eat a fresh rice, that produces visceral fat, result of 500 toxins, resulting 500. This is a evidence based and no side effects. You know, there is no chemicals are generated from just cooling down. It's a myth actually. There is. Pardon?
What temperature we have to keep that rice? Freezer or just normal?
Fridge, you know. Not in normal temperature. If cool down, the conversion of resistant, you know. Yeah, maybe cooler temperature, but below 10 degree temperature. So the cooling rate is very important. That activates this process of conversion of this one into, yeah. Any form of carbohydrate, yeah. It's called as retrogression of starch. That's to prevent the spike of the
Will convert into prebiotic fiber.
resistant starch. Yeah.
What is the time duration like? So you cook it immediately? Like what is the
Maybe
window?
you see that maybe you wait for little bit of time, you know, because the fridge cannot. If you put
10 minutes.
after 20 minutes, 25 minutes.
What happens if you allow it to cool normally and then refrigerate?
No. Then this process will not happen, no? Yeah. It's all about conversion of starch into retrograded starch. That's what.
There is a window for that.
Window period, you know.
For
Yeah.
20 to
20 to 25 minutes. Yeah.
So, sir,
Pardon? Millets, you see, millets are the carb density of millets are same like rice and wheat, not too much difference, but there is little bit of more amine, like resistant starch in. So the glucose spike might not happen as like, that's all different here. You know.
So the next day we have to heat it and then eat, or just
Next day, boil it again.
boil it, properly boil it.
Oven, you can reheat it, not boiling, just reheat it, heating. Preheat it, yeah, that's all.
So you said that add ghee into rice.
Rice, yeah.
So fresh rice also we can eat.
Fresh rice also, that's one. Yeah, it's not only ghee I'm talking, any type, any form of fat. Any form of fat, you know, like rice. Before rice, make sure that they're eating one salads. Salads provide them a fiber barrier that reduce glucose absorption. Second, you give a barrier of fat and protein. Fat and protein like eggs and nuts. So first salads with the fat dressings. Second, nuts and protein like paneer or eggs. Third, rice, carbohydrate. You know, that reduce 30 to 40% of blood glucose within short span of time. Very short span of time. Yeah.
Just one concept. It is said that every food contains is bioenergy.
Bioenergy. Okay.
If we are degrading the fat, starch, what about that bioenergy? So which food can be eaten fresh?
Okay.
And which food? So I understand you are saying rice and roti you can.
Yes.
You know,
Okay.
But the other things about dals and sabzi and all, you know, all that needs to be. It also contains some amount of carbs.
Yeah, but that's resistant starch predominantly. Break down very slowly and mix with lots of fiber. But the grains is the problem that grains are very extremely low in fiber, rich in like a sugar powder. You can say grains are boiled sugar.
Okay.
Got my point. Grains are boiled sugar. That's all different. Okay, you can say. It's a simple, same thing. It eventually convert into glucose. So the grains absorb very rapidly. The main problem, this rapid absorption, is not the glucose or starch contribute the problem. The main problem is rapid absorption. So when you have glucose spike, that leads to insulin spike. And there are so many lipogenic enzymes are activated. So the glucose which is absorbed rapidly convert into fat. Same glucose if it absorbs slowly, convert into energy. That's where the major trick lies, you know. So this you have to manipulate. And fifth way, so when you reduce the carbs or the total carbohydrate density, we need to substitute with the category of foods, that is the fat. Fat is the best fuel for substitution. Reduce the carb density. I think better we'll continue. Questions can be asked later, no? So
no, we should break in between, otherwise those questions fly up.
Yes, sir.
After 5 minutes we have break, then
yes, sir.
another 1 hour.
No, so many questions. That's what I stuck here, sir. Yeah. So what is important fuel for human being? The important fuel for Homo sapien, human being, is fat. And yeah, madam, I'll finish this section now, so it's getting dragged off, you know. Yeah. So see, these slides give you lots of insights about dietary choice of human being. In human brain accounts 20% of total energy budget, GDP. 20% of total energy utilized by human brain, despite having total 1.5% of body size. So this disparity is a disproportional allotment to the brain. And in human being, muscle receive 10 to 15% of energy budget. 20% goes to brain. All other mammalian species, the major share of energy goes to muscles, and brain receive only 5% of total. So that's why the human being required a distinct dietary pattern. Unlike other animals, the fat is 20 to 30% of human body consists of 20 to 30% of fat. In other mammals, less than 1%. And human is the only one mammal consume cooked food, so raw salad. Lifespan is remarkably, it exceed all other mammalian species. So this indicates that, demonstrates that we have unique features. We cannot eat like any other animal. The major answer is our human brain, which utilizes 20% of total energy, and brain is composed of two vital nutrients, fat and cholesterol. That's why the human breast milk, you see the pattern of human breast milk. Fat is 60, carb is 30, protein is extremely low in human breast milk. And you take the other 6,000 mammalian species, the protein content is high for like in a cow milk, fat is 40, carb is 33, protein is, because all the animals survive by muscles, we survive by our brain. That's why the human breast milk contain extremely low amount of protein. It's very rich in fat and protein. So this shows that human is the fatty vorous. The best fuel fitting for human physiology is fat. So fat never contribute to any problem. One of the main benefit of fat reduce visceral fat, because its property on insulin. When you consume high fat diet, the plasma insulin drop. Once you have low plasma insulin, the fat mobilizes from visceral fat to liver cells for energy metabolism. That's why the fat help you to lose the weight by one single mechanism, two mechanism. The first mechanism, fat reduce plasma insulin. Second mechanism, have you heard about a very famous weight loss drug, Ozempic? Ozempic and Mounjaro. How it reduce the weight? GLP-1, which is appetite suppressor, secreted from, so 6 hormones from the digestive tract and 1 hormone from adipocyte, 1 hormone from pancreas control our metabolic rate. The metabolic homeostasis is controlled by 7 hormones, 5 from digestive tract, 1 from adipocyte called as leptin, 1 is from pancreas called as insulin. So this 7 hormone control the, so it is the game with the hormone, not the game with the calories. For example, in one family, one sibling is obese, one is, despite eating same food, same calories. Okay. So what's the fact? This contradiction. How we can answer this contradiction? It's called as metabolic rate and hormone balance. So the hormone control the fat metabolism, the energy homeostasis. When you have disruption of this mechanism, that leads to obesity. So 5 hormone from intestine. One is GLP-1, which is the appetite suppressing hormone. Second is ghrelin, which induce appetite. Third is cholecystokinin. I forgot the name of those hormones. But when you consume high fat diet, GLP-1 and cholecystokinin is secreted. So we get satiety for very longer period of time. Unlike eating carbs, when you consume carbs, quickly absorbed to bloodstream, convert into fuel, the plasma glucose drops down. That's a trigger for appetite. That's why the fat is amazingly great molecule to reduce obesity by triggering intestinal appetite hormones. So second one and third mechanism of the fatty acids. Have you heard about mTOR mechanism? mTOR, the Nobel Prize winning pathway of 2016. We know that mTOR activation leads to faster aging and faster cell division. So the insulin activate mTOR, protein activate mTOR, fat inhibit mTOR activity. So the aging pathway, the aging mechanism, the cell proliferation is controlled by 2 switches in our cells, called as mTOR switch and AMPK switch. AMPK switch deactivate cell division, mTOR switch, activate cell division. So we have to turn off mTOR switch and turn on AMPK kinase switch. So fatty acid turn on AMPK switches. So slower aging also. From all this perspective, human is a fatty virus. That's why the 6 ice ages, our ancestors undergone 6 ice ages. Literally no fruits and leaf, everything disappeared. Still we survived, our ancestors survived because of our fatty virus nature. Okay, so fat is not our enemy. Fat is the best molecule to reduce visceral fat inflammation. Okay, last slide. Yeah, so all the carbs are similar. They convert into visceral fat. The typical Indian diet consists of 80% of carbs, 5% of protein, and 15% of fat. Yeah, so good fat should be added to the diet. This is a typical Indian diet. 80% carb, 15% of fat, and 5% of protein. Reversal diet, fat should be, this is not for lifelong, okay? Not lifelong diet. I recommend for 2 or 3 months to reverse a disease, like reverse diabetes, type 2 diabetes, reverse PCOD, fatty liver. Just adopt 3 months of extremely zero carbohydrate diet. Later, switch over to, this is the breast milk nutritional profile. You can say breast milk diet. The human breast milk consists of 60% fat, 30% of carbs, and 10% of protein. This is a proportion of human breast milk. That's why definitely this will be beneficial for the mother nature. Never give a wrong pattern for us. This is a composition I found after studying, evaluating the macronutrient profile of human breast milk. Extremely helpful to reduce HbA1c, 60, 30, 10. This is for long-term diet protocol.
When you say 3 months, we have to go zero carb.
Yeah, 1 to 3 months.
So when we start introducing the carbs again, is there a pattern?
Switch over to 60, this pattern. Don't go to old pattern. So currently we follow this pattern. This pattern is the major culprit, okay? So this is follow for 2 or 3 months maximum, or 1 month, minimum 1 month. Later, adopt a pattern of 60, 30, 10, which is similar to human breast milk nutritional profile.
One slide.
Pardon?
One slide behind that fatty acid, which one? No, the next one.
Yeah. I'll tell you, that's what very easy. It's not for a lifelong, ma'am. Only short period of time.
But we are pure vegetarian.
No, okay.
How can you?
No, at least that's why when a vegetarian comes to our hospital, I developed a soup diet. Soup diet, for 10 days of soup diet, like soup with the butter, soup with the ghee. Yeah?
Sir, and it needs to have a sweet.
Sweet.
Which mechanism will work better in it?
Sweet mechanism. Even I do eat sweets, okay. Even though.
What is that 80% composition in fat? Like what kind of foods will you
Soup diet.
So fat, 60% of, or 80%. Okay, I'll tell you. Like around 100 gram of paneer, 25 gram fat. Half coconut in Kerala I recommend because it's 40 gram of fat in half coconut. So I will encourage my, that patients to cook in coconut milk. Not tender coconut milk. Half coconut milk contains 40 gram of fat, which is for about 400 calories, Yeah, so the coconut, half coconut, 100 gram of paneer, 50 gram of nuts give you additional 20 gram of fat. So how many gram of fat? So 40, 20 plus 20, 80. So 125 gram is fat is required to reach this criteria of 80%. Okay, 125 gram. Next 2 tablespoons of ghee, 30 gram of fat. So how much it reached? Around 110 to 110. So 15 gram additional fat can be obtained from like seeds and powders, like seeds, avocados or seeds, So additionally, you get a little bit of fat from all other fats. So it's a 125 gram fat. If you reach, that's what you required here to reach 80% of fat. Protein is naturally come from this pattern. You don't, because paneer 20 gram of fat, 100 gram of 50 gram of nuts give you additional 10 gram of protein. Maybe for vegetarian, 1 scoop of protein can be added extra. 1 spoon.
Suppose if like there is dal or something, so usually we give the tadka, right?
Yes.
So can that
No, you see, this 80% not for everyone. Those who are intending to lose the weight, the first category. Second, young diabetic patient develop diabetes recently, like around 2 or 3 years of history. If you put on this dietary pattern with some supplements, like there are some herbs to trim the visceral fat, like cinnamon, Salacia reticulata. So if you combine this pattern for young diabetic patients or those who recently diagnosed with or fatty liver stage 1 or 2, definitely this pattern trim the visceral fat or fatty liver stage 2 to normal stage in 2 months. Yeah. Okay, diabetic patient, they have a longer history of diabetes. Their kidneys are already in the damage. Don't go for this pattern, go for 20. Even 60% fat is difficult. Adopt one more trick, 45, 45, 10. 45% of fat, 45% of carbs. No, protein is not very. 45, 45, 10. So in 45, you try to choose resistant starch or reduce the glycemic load. Example, rice, 1 cup of, I have made one more trips of ours to reaching this criteria, 45, 45, 10. All you have to do is buy 50 paisa, 1 cup can reduce their blood glucose. Can you believe it? The teacup of that 50 gram. If you train them, I trained extensively a couple of my diabetic patients to use this teacup. All you have to do is collect 30 gram of grains, regardless of its sources. It could be rice, wheat or ragi, and 1 teacup contain 30 gram of carbs, that's all. So 3 times how much it is? 100 gram. Today currently in conventional diet we consume 400 gram of grains. It reduced to, so 1 cup of rice, 3 cup to 4 cup of vegetable, half cup of ghee, half cup of nuts, 1 cup of paneer, mix it and make vegetable biryani or palav. Okay, got my point. But the recipe, that's we have lots of recipes we have created. Okay.
So please repeat.
You know, it's a teacup, 1 cup of teacup. How many gram? 30 gram of glucose, carbs. Or maybe if the density is more thicker, it goes to 40 gram. That's all maximum. So 32. So you can choose any of the grains. There is no particular like white or red rice. It's not the criteria. You can choose any type of. So 3 to 4 cup of vegetable. Like you can add pulses also. Green peas, boiled green peas, or green peas, 1 cup. Yes. Then half cup of nuts, half cup of ghee, 1 cup of paneer. So you mix it together. So this comes naturally 60-30-10 pattern. 60-30 pattern. And your stomach, it's amazing recipes. You get fullness, you get a fullness, and satiety for very longer time. Blood glucose drop very fast. So there are multiple. You don't have to stop the grains, but you learn how to eat in a smart way. That's all you required here. Okay, that's what. I hope you understood this insulin resistance, and now we will step into visceral fat the gut inflammation and autoimmune disorder and digestive disorders. Okay, thank you.
One question.
Tea break, yes.
Any questions you can ask?
Yeah. So we had mentioned mustard oil containing less of omega-6. So is mustard oil better?
No, madam, that's 3 categories of fatty acids. Yeah. Poly, mono, and saturated fatty acids. Yeah. So mono unsaturated fatty acids are found in olive oil, mustard oil. All the nuts are rich sources of mono unsaturated fatty acids. Animal fats like mutton fat, the yellow of the eggs, which all are rich in mono unsaturated fatty acids. Saturated fatty acids are found in coconut. Coconut and ghee. Coconut and ghee. That's the richest. See, animal fat is a misconception. Animal fat is preferably structure is similar to olive oil. Lard was the major fat. Lard is the fat from pork. That is a staple fat in Europe for 2000 years. They had been using. The structure is similar to rich in mono unsaturated fatty acids like pork fat and mutton fat. Then fish fat is polyunsaturated fatty acids like omega-3 fatty acids. In polyunsaturated fatty acids, short chain omega-3 and long chain omega-3. So very complex topic. Again, this is my 5-hour topics on structure of lipids, But to saturated fat, I favor saturated fatty acids because Two benefit, highly stable. Because what do you mean by saturated? Mono means what do you mean by mono? Single double bond. Poly? Multiple. EPA, icosapentaenoic acid, omega 3. Icosa, 5 double bond. That's why the name come icosapentaenoic. Pentanoic means 5. DHA, docosahexaenoic means 6. As you have more double bonds, they are more prone for damage, oxidation. Okay, so choose the fat low in bonds, double bonds. The main the issue with the lipids are integral part of our cell membrane. Okay, the mitochondrial membrane also composed of. Now study says that when you have double bonds in mitochondrial membrane, the waste generated in mitochondria, free radical, bind with the double bond in cell membrane and they convert into a potent toxin called as aldehyde. There are 6 types of aldehydes are generated from omega 6 in cell membrane. Neon aldehyde, one of the main contributing factor for simple lipids like omega 6. Okay, omega 6 is linoleic acid is in mitochondrial membrane. So the reactive oxygen species convert into aldehyde. The problem with aldehyde is water soluble. So they dissolve in cytoplasm, migrate to DNA, bind to DNA and induce mutation. So it's one main mechanism of cancer. So omega 6 fatty acids and sugar. So maybe pesticides contribute 1% of cancer. This contribute 30 to 40% of cancer. So actually I'm expert in lipids. This is one of the very, very long topics, like neon aldehyde, melanoldehyde, omega 6, long chain omega 3 mechanisms. Okay. But the stable fat is saturated fat. They are very stable in cell membrane. The problem, when you have cell membrane with a damaged fat, so immune system thinks that there are foreign body. And immune response, inflammation. That's why you have a low grade inflammation in cell membrane if you have too much of omega 6 fatty acid in human. So studies found that the breast cancer, they have evaluated lipid constitution of lipids of cell membrane in breast cancer victims. They found that they have 3 times more omega 6 in the breast cells than normal breast, So they're highly inflammatory. And we are composed of fat and cholesterol. Okay, the cell membrane is made up of fat and cholesterol. Imagine that a damaged fat sitting in the cell membrane. Okay, your cell wall is damaged by stains. What you'll do? You try to resolve the issue. Same thing happened for our cell membrane also.
Simply says that omega 3 is essentially we need and 6 is and 9 is not that much important.
No, 9 is non-essential. See, omega 3, 6, 9. 9 is mono unsaturated. So the double bond on 9th position. That's what omega 6 means, the double bond from end of the carbon chain on 6th position. That's called as omega 6. In omega 3, from the 18 carbon chain, the first double bond is located on 3rd position. So it's called as omega 3 fatty acid. So omega 9 and saturated fat, both are non-essential. What is non-essential? So the glucose you can convert, like a starch you consume, convert into naturally in your liver. You don't have to take from external source. Omega 6 is essential fatty acids, which means you cannot produce it. But currently the problem that the RDA for omega 6 is 1 gram. Because of refined oil, we consume 50 gram per day. So our intake is 50x higher than normal intake. That's all. Linoleic acid is it's contaminated everything. Yeah. Even this biscuit, I'll tell you.
Just serve.
Okay. Okay. This biscuit, okay, I'll tell you the combination of this biscuit, okay. I will evaluate here, so we'll clearly understand. It's made up of 40% of grains. Grains are, that's a carbohydrate. Then added sugar could be 30%. Added fat is 30%. So this, this could be weighing around 30 gram.
No, 15.
Not 15.
20
20 gram, 20 gram, surely 20 gram. 20 gram. So in 20 gram you have around 40%, 8 gram of carb and 30% of omega-6 like. So you have 6 gram of omega-6. That is 6000 mg. It's essential fatty acid. Requirement is 1000 mg. Hope you understood the 5000 mg extra. And you see one single. So we are adulterated with the breast milk, human breast tissue, human cells, human brain. Everywhere is not like this is a omega-6 toxicity. You can say omega-6 toxicity. Yeah. And additionally, this contains 1 teaspoon of sugar, 1 teaspoon of fructose. Hope you understood the composition of this pattern. Okay. Yeah. Okay.
So the question online is ghee means cow ghee only?
Cow ghee. Yes, sir. Sir, I'll have one tea, sir. I'm getting little.
Yeah, he's bringing. Chai leke aao.
One of the comments on YouTube, no?
Okay.
They are coming that not able to see a sir is standing in front of the camera. So you just move, we consciously move little.
Okay. Sorry, sir. Okay, sir. Okay.
So you are either this way or this way.
Okay,
then
sir.
you can see.
Yes, sir. Sir, I'll have a
move to next topic.
Next topic, sir. So they are not leaving me, no?
Yeah. This is good, no, sir.
Hundreds of questions, sir.
We want people to ask questions.
I'm unable to step into just a topic now, sir.
Yeah.
This was half an hour section. Question is 1 hour. If I'm getting what I should do, sir.
It's very good.
1 coffee with sugar, without sugar. 1 coffee.
Black coffee?
Black coffee also, okay. No, black coffee, mild, not very strong.
Milk, little bit.
Little bit of milk and without sugar.
For a very long time we are practicing lemon honey fasting in naturopathy.
Okay.
Is that causing
That's
more
what, no. That's no problem because you are not using any other source of, so you're not using any other type of energy, So that can be converted into fuel, like the fructose to fat to energy.
Sir, also about the protein combination in breast milk, sir. I have done breastfeeding counseling certification. There we have thought that all the preterm babies, they have their mothers who breastfeed, their milk contain 30% of protein. So for that child, if we come to maintain those, is this the 30%?
No. See, human breast milk is only 10%.
So for the preterm babies, protein percentage in the breast milk was higher, sir. It was 30% for preterm babies.
Preterm babies.
Yes, sir.
Okay.
So if we are treating someone who has born as a preterm, can we stick to this 10%?
So, yeah. Fat is important.
Okay.
Because the human breast milk is extremely rich in fatty acids. Okay.
Thank you, sir.
So, coming to the same question again. So, is mustard oil good to cook with?
Yes, that's good. Yeah, good.
Yes.
Yeah. MCT oil not required, like a coconut, mustard, groundnut oil.
It doesn't interfere with the liver.
But only, it's not about mustard or groundnut oil. 90% of these oils are adulterated with cotton seed oil.
So if you get pure cold press oil, it's fine.
Yeah, it's fine.
Even peanut is fine.
Peanut is also relatively better. But for reversal program, you choose ghee.
That is fine.
The first 2 or 3 months, strictly go for saturated fat during that reversal program. So later you can introduce butter of all sorts. Of amazing.
And what is the replacement of paneer? The recipe that you were saying.
For vegetarians, vegetarian. That's what when vegetarian comes to vegan diet, very soya bean is soya protein absorption rate is not good.
Soya is too just vitamin C.
No. Soya bean. Vegans.
Also cannot be the replacement of the regular paneer.
But milk is amazing.
So you provide recipes online also?
Online, madam. Before I used to conduct programs, I'm extremely busy nowadays, because I have a lots. But I will speak to ma'am and we can arrange a cooking classes in future. So I have some junior doctors. I can ask them to come down and. No, yes.
We can arrange something, no?
Yeah. So
We
surely.
don't conduct online classes now.
No. Online classes. The sweet potato, great combination. Huh?
Yam. Sweet potato.
Yams contain more resistant starch.
So yam is also
Yeah,
good
yam also good, but make sure that you are adding the fat and protein prior to starch. That's what simple.
So in a way, roots are a better option as per compared to potato.
Yeah.
Other roots are a better option.
The sweet potato main advantage, it's a great taste. If you delicious taste, if you add butter. I used to split the sweet potato, fill it with the. You can try amazing recipe, amazing recipes.
So you make batata vada.
Yeah. That's
We would like to have few recipes from you.
okay. I'll try to. Yeah. Okay. Pardon? Fruits, yeah. So fruits can be consumed in but don't pair with a carbohydrate. 4 o'clock you can have snacks. But you see the fruits contain carbs, rice contain carbs. After consuming the one type of carbs, again top of that if you consume second option, that add up to your total carb density. Yeah.
So is this your diet like 80% fat, fruits are included?
Yeah, see, this pattern, 80 pattern, not for lifelong, just for maintenance, go for 45, 45, 10 or 60, 30, 10. Pardon? Yeah, food can be taken. Carbs can be added on the 45, 45, 45, 10 pattern.
How much fruit is expected to be taken per day?
Fruits.
How much is allowed?
Fruits.
How many grams or?
See, the main benefit of fruits, it can give you.
Because watermelon, it
Yeah,
rises the sugar.
yeah. So see, the main benefit of fruits provide you fiber. Rest of the things are not very nutritious as we presume. That's why I shown you the the comparison of Yeah, for visceral fat, the low carb diet, the combination low carb diet combined with the omega-3 fatty acids. Second, there are some herbs like salacia and cinnamon. The prebiotic fiber, something called as short chain fatty acids. These all are beneficial for trimming visceral fat for a short span of time. Next, we are berberine. The best action is for cinnamon. Cinnamon on better than berberine. Yeah, because I made so many combinations, so many formulations, and steadily I removed berberine from my combination. Yeah.
Dr. Praveen, I think some slides. But berberine improves the AMPK and all that, so it's much.
Which one?
Berberine improves the AMPK pathway.
Yeah, AMPK. Yes. No, berberine is, I'm not saying, but it is for visceral fat. The better action is for salacia and cinnamon. Cinnamon both has a, because I made a combination of cinnamon and green tea extracts. Amazing result. One of my packing staff in my packing unit, she was overweight, like about 80 plus, and she lost her husband also. She couldn't work by sitting on the floor. So she was my first patient that received this combination. She lost 20 kg weight with the 45, and they cannot adopt a keto diet because of their economical status, So I recommended a low carb diet, and dinner was zero grain diet. That's all. She lost 20 kg after 3 months, and I could not recognize her.
Yeah.
Total stature was changed. Yeah. So
in what percentage of people you need to use this 80% fat diet versus?
Not for everyone.
Not for everyone.
Yeah, few like youngsters with obesity. There before some. Before marriage, some couples like females, they say I want to lose the weight, and if they are willing to maintain the, so see now everyone is adopting GLP, that Manjaro, and it's a shortcut. That does not reduce because of
but even low carb diet,
potential.
70-80 kgs you can reduce very easily.
Yes. Low carb diet definitely. If you adopt for it, that's better. And you lose muscle mass with the Manjaro.
Yeah.
That's Manjaro. You are losing long run. Gut paralysis, muscle mass, muscle waste.
This long-term berberine, does it disturb the gut microbiome?
We need to study into safe duration, like ashwagandha. Ashwagandha, I suggest a safe duration could be 3 months, because ashwagandha is generally used to reduce the cortisol. But if the cortisol range is above, if it goes to below 5, that has a, the peristaltic movement gets sluggish. There are so many consequences of low cortisol. So there are so many individuals who took berberine 1000 mg the ashwagandha over 6 months, their cortisol dropped. It took 6 months to improve their. So I think we have to establish a safe, how long we can consume, a safe period and safe duration and safe dosage. Both are very crucial for every herbs. That's what we never focus on that aspect, So berberine, I don't think so. We can do liver LFT. If any fluctuations in the enzymes, stop it. That's all.
Okay, can we?
Yeah.
No personal questions. We will ask him.
Okay, next is gut inflammation correlated with digestive disease, allergy, anxiety, depression, autoimmune disorder. The Yanomami tribe, isolated community in South America, and the army of Venezuela, they detected this population just 2 decades ago. They never had any exposure to modern civilization. The American scientists rushed to their location to collect their stools. They evaluated. They astonished to identify over 2,000 strains of unique bacteria. In comparison, a modern American, like urban American, harbor only 400 species of bacteria. In contrast, this population has over 2,000 strains of bacteria. And they isolated a unique strain called as Oxalobacter formimincense. This has capability to smash the kidney stones. Oxalobacter. Now scientists identified a bacteria which produce testosterone from the stool of this population. Bacteria which produce testosterone. So this signify the, the importance of the crucial role of gut microbes in mediating our wellness and illness. When scientists transplanted gut bacteria of schizophrenia to rats, most of the rats started exhibiting symptoms similar to schizophrenia. Yeah. And similarly, the autistic kids, when they receive the human gut microbiota, autism spectrum disorder, autistic kids who receive the stool of feces of autistic kids were transplanted to rats, mice, and most of the rats started exhibiting symptoms of autism. So again, this highlight the, the crucial role, the vital role of gut microbes of regulating various aspects of our health. Obesity. So it's an amazing study. We know that the Ayurveda proclaimed and called rheumatoid arthritis as Amavada, which is, that means this root lies in your gut. The name is Ama. I will tell you, this studies, this evidences substantiating the claim of Ayurveda, which is told 4,000 years ago. Like, one bacteria called as Porphyromonas gingivalis, and this bacteria is found in most of the individual, ordinary individual, but this is related to one phenomena called as anti-cyclic citrullinated peptide. Rheumatoid arthritis falls into two categories, Ra positive and Ra negative. What do we mean by Ra positive? How to distinguish Ra positive from Ra negative? A simple test, anti-CCCP. What is anti-CCP? Anti-citrullinated, cyclic citrullinated peptide is called as anti-CCCP. If anti-CCCP is positive, which demonstrate it is seropositive. Anti-CCCP negative, seronegative. Okay, this is the, so how this bacteria in oral cavity related to anti-CCCP, I'm going to explain on the next slide. So this bacteria called as P. gingivalis, this found abundance for people with the gingivitis, oral cavity inflammations. Okay, so this particular bacteria produces an enzyme called as peptidyloarginine deaminase, the enzyme produced by oral bacteria. And this particular enzyme enters to bloodstream, finally reaching to synovial fluid. And synovial fluid is rich in different categories of proteins. There are lots of different type of proteins found in synovial fluid. Among one protein, which is consists of L-arginine, one amino acid residues. So these enzymes modify L-arginine to L-citrulline. So protein which carries the L-citrulline turns like a antigen, because citrullinated protein, immune system presume that it is an antigen and produce antibodies, and these antibodies accumulate in joint place, leads to rheumatoid arthritis. Got the connection? And this science is told by Ayurveda 5,000 years ago, that rheumatoid arthritis, not all rheumatoid are positive. Maybe from my experience we can say 10% of seropositive arthritis originate from that's where coconut oil gargling helps to reduce the symptoms, oil pulling, not for, if it is related to, there are multiple trigger, okay. So this antibody, the trigger can come from oral cavity, trigger can come from respiratory mucous membrane of respiratory tract, or the trigger can come from the mucous membrane of colon. So from three sides the trigger may come. So if it is related to oral cavity, coconut oil pulling, because coconut oil is rich in medium chain triglycerides, which can neutralize this oral bacteria called as P. gingivalis. But this studies or this slide signify the importance of gut bacteria on chronic disease progression. And we know that serotonin, the main brain hormone, 95% of serotonin synthesized in gut, sorry, not in brain, okay, and it is exported to brain, okay. So, and similarly, the precursor of serotonin is called as tryptophan, which is a dietary amino acids, a bacteria in your colon convert tryptophan into 5-hydroxytryptophan. 5-hydroxytryptophan is nothing but serotonin, and this process is catalyzed by a bacteria. Okay, so if you don't have this particular bacteria which facilitate conversion of tryptophan to 5, that same tryptophan transform into kynuurine, which is a neurotoxic agent. You get the depression. So absence of this bacteria, you may experience depression. You see how important, what is the significant role of gut bacteria, you know, like. So tryptophan supposed to convert into serotonin. For certain people, it converts into kynurenine. And you see the kynurenine metabolism pathway activation in major depressive disorders. Yeah, it consists of 25,000 human gene and 5 million bacterial gene. 40 trillion bacterial cells and 30 trillion human cells. So we are 50% microbe and 50% human. So of late they identified 100 trillion cells, not the 30 trillion, 100 trillion bacterial cells and 30 trillion human cells. So the microbes outnumber human cells. Microbial cells outnumber human cells by 1:3. And there are different strains of bacteria are found in, so what is dysbiosis? Or let me explain the pattern of gut bacteria in your gut, like stomach, small quantity of, out of 100 trillion bacterial microbial cells, 99 trillions are found in colon, which are predominantly anaerobic bacteria. And ileum harbors small quantity of bacteria, they are facultative anaerobic bacteria. Jejunum consists of aerobic and anaerobic bacteria. Duodenum consists of aerobic bacteria. So in gut dysbiosis, we all think that gut dysbiosis means excess number of harmful bacteria. It's a misconception. It's not a. So supposed to have 85 to 15. 85% of healthy microbes and 15% of, even if all the 100% microbes are good bacteria, that also leads to gut dysbiosis. There should be a harmony of good and bad. When harmful bacteria exceeds, that is a one factor, as a minor factor contributing to gut dysbiosis. Similarly, anaerobic bacteria are supposed to stay in colon. For certain people, this anaerobic bacteria move to duodenum and displace aerobic bacteria. And this condition is called as small intestinal bacterial overgrowth. So the cybobacteria are not harmful bacteria. They sit in a wrong places, wrong location. So this disrupts the mechanism for homeostasis of digestive tract. If the microbes move to another direction, even if the anaerobic, facultative anaerobic means they're strict anaerobic bacteria. They use glucose and fructose as the major fuel. They cannot survive in the presence of oxygen. That's why to treat SIBO, I use fructose glucose-free diet. Because SIBOs are predominantly strict anaerobic bacteria. That's called as facultative anaerobic and one more quality I forgot, So then ileum microbes are facultative, which means partially they can survive oxygen or partially with in both environment. And duodenal microbes are strict aerobic bacteria. They are more sensitive to antibiotics. When when patient prescribe or on antibiotic for 1 or 2 months of periods, the aerobic microbes are eliminated. So there is a potential opportunity for anaerobic bacteria to mobilize to, and they make a settlement there. That leads to small intestinal bacterial overgrowth. So this is a structure and location of bacterial colonies. So major cause of gut dysbiosis, pH variation, lack of proper chewing. And you see, we gulp down the food today. Don't spend time to chew. Ayurveda told to chew multiple times. Okay, so what is the benefit? When you chew the food, it makes sure that the food is digested and absorbed from intestine. If undigested food may reach to colon, where harmful bacteria, it can feed harmful bacteria and leads to gut dysbiosis. Okay, so chewing is important. Low stomach acids. Another the most significant factor for gut dysbiosis is low stomach acids. I've seen hundreds of autoimmune cases when they were on proton pump inhibitor for longer period of time, maybe 5 to 6 months, and later on they developed autoimmunity because of lack of stomach acid. What is the main function of acid? Very simple example. This analogy can help you to understand. The pH of water is 7. Okay, if you store the vegetables, after 2-3 days it gets rotten. Instead, on other hand, if you same water, add a drop of vinegar, 1 teaspoon of vinegar, preserve the vegetable. It preserves the vegetable for what happened when you added vinegar? Acid. It became. So acidity is very important for thriving of good microbes, reproduction of good microbes in low pH, not in alkaline pH. Okay. This is how the issue starts. When you take the proton pump inhibitor, antacids for longer time, stomach acid became more alkaline. That permit all harmful bacteria to pass down through stomach barrier to intestine, where it breed and it multiply. So the pH variation is very important factor. Alkaline water is dangerous. I hope you understood the mechanism, because it's a myth actually. There is no science. It's a most unscientific claim that it can. Pardon? 3 lakh rupees. Because of it's no benefit of, because why we have stomach acid here? It's for a purpose, and there are, as I told you, there are 7,000 animal species in the planet, herbivorous, omnivorous, and carnivorous. The pH of herbivorous are alkaline, like 4 to 5. The pH of omnivorous are 3. Carnivorous 2, very acidic. Human stomach is 1.5. Human stomach is 1.5, because this stomach acid contribute to human longevity. Because I told you, the major challenge of evolution was to deliver the energy to brain. Small size, but stealing 25% of total energy. So have to supply the energy to the brain, rapidly growing brain, to rain metabolism. There was only one way. The nutrient should break down very faster and it should deliver too. That's why the human stomach pH reduce, and parallel to that our lifespan increased. So today proton pump inhibitor reduce the stomach pH, and that can contribute to So excess bile salt secretion, lack of bile salt, overgrowth of good bacteria, reduced microbial diversity, overdominance of single bacteria species, deficiency of beneficial bacteria, lack of fermenting microbe, low fiber intake. So some of the major contributing factor for gut dysbiosis. So
when you say overgrowth of good bacteria, that
yes,
can be caused because of taking too much of.
You've seen the oral cavity. Have you seen the Picoprey? So good bacteria found for everyone. But when it is grown uncontrolled, reproduce uncontrollably, that induce autoimmunity.
So when we are supplementing probiotics, for example.
No, probiotics are like a drop of water in an ocean. That's we have trillions of bacteria, and hardly we are supplementing with a 1 or 2 billion. That's all, So it's not a significant one. You cannot have a major impact on. And the probiotics are relatively perform better for upper digestive tract issue. Colon you cannot handle by probiotic fiber. There are trillions of microbes, so this is insignificant. But in digestive tract, upper digestive tract, bacterial count is, so the probiotic can have an impact on upper digestive tract, not for lower digestive tract.
But if we come to the lactobacillus,
okay.
It is good for the gut, but simultaneously it is causing cavities and caries in the oral cavity. So how do you justify this?
No. See, this is you are not in a you're taking powder form. It is encapsulated by soft gelatin, so that it does not break in.
Generally, I'm just it's my question. It is there.
Lactic acid. It produces lactic acid.
Yeah.
So in oral cavity, it's anaerobic bacteria. I'm appreciating that word. But you see, this bacteria overgrowth is because of grain consumption.
Okay.
and it's a very important question. And I studied the pattern of bonds, the bond mineral density of pre-agriculturist and post-agriculturist. There are so many studies conducted about the teeth, density of the structure of teeth of pre-agriculturist and the pre-agriculture never consumed grain consumption. So they found that all the bonds before agriculture had 100% bone mineral density. Not even a single teeth had a teeth cavity, single teeth before pre-agriculture. Because you see the simple sugar, when we started cooking grains, that had a multiple benefit. Our civilization developed, we became modern society because of grains at the expense of, at the cost of some side effects. One was when grains starch deposit in the teeth cavity, the microbial colonies multiplies that produce lactic acid. Grains are converted into lactic acid, and that still your damage, erase your teeth enamel and leading to, So that's a different story. Yeah.
But then in pre-agricultural time, they would have also consumed a lot of fruits and honey.
No, the fruits, simple sugar. Fruits will not cause the problem. Which is sticking here, the fruits will not never stick to your teeth, The grains are starchy, like a glue, it get accumulated in your cavity. Honey also not likely to, yeah. I don't think so fructose can be converted by this particular bacteria. The glucose is converted into lactic, acid. Yeah, so the stomach issues, most of the stomach issues, underlying cause of the stomach issues attributed to two fundamental causes. One is variation of stomach acid, second is variation of peristaltic movement. If the peristaltic movement is excess, hyper, is called as diarrhea. The lack of peristaltic movement is called as constipation. And in stomach acid, so 95% of digestive issues are related to these two fundamental causes: variation of peristaltic movement, variation of stomach acids.
Like this, it is varied then.
Yeah, that's what I'm coming to that point. Hope you understood. So I'm going to, and these two factors like hypoacidity and hyperacidity, both are influenced by a bacteria called as H. pylori, Helicobacter pylori. And peristalsis is regulated by a hormone called as serotonin. Intestinal peristaltic movement is controlled by serotonin. Colonic peristaltic movement is controlled by secondary bile acid. Secondary bile acids control colonic peristaltic movement. Intestinal peristaltic movement regulated by serotonin, which is the brain hormone. So serotonin is 5-hydroxytryptophan. So the tryptophan to 5-hydroxytryptophan is catalyzed by bacteria. So when you have SIBO, small intestinal bacterial overgrowth, this conversion is reduced, or maybe there is the transport of serotonin. There is a two mission of serotonin. The primary task of serotonin to induct peristaltic movement. The serotonin that is produced in digestive tract bind to the smooth muscles around the intestinal tract, and smooth muscles contract. That leads to peristaltic movement. Okay, hope you understood the mechanism. So what happened? The SIBO reduced the transport of serotonin to brain. Guess what happened then? It accumulates in so much serotonin. The movement is, so two functions of serotonin. One is peristaltic movement. Second is, it's became the, after delivering to brain, it turns out to be brain hormone. So two primary functions of serotonin. So what happens if the transport is reduced? It accumulates in digestive tract. So peristaltic movement is faster, and you get depression. That is the main mechanism of SIBOs. Not leaky gut, it's IBS. Diarrhea dominant IBS patients are more prone to get depression and loose motion. Hope you understood the mechanism. Yeah, that's where the SIBO plays a crucial role. This is how the IBS related to diarrhea dominant IBS patterns. Okay, so again, there is a bacteria is responsible for
Hold on.
Okay.
To sum it up, if you have SIBO, sum it up in the sense just to understand. If you have SIBO, the serotonin which is prepared will not reach the brain.
The transport protein or the SIBO reduce the synthesis of transport protein.
Okay.
So you don't have any carrier to take the serotonin to brain. Then you have so much of serotonin here.
Okay.
Same time you are not getting enough serotonin. So the peristaltic movement faster and you get depression. This is the pattern related to SIBO and IBS. This is how the SIBO leads to IBS. Next one, when you move to colon, the lack of serotonin production, again responsible one more organism called as methanogenic bacteria. Methanogenic bacteria produce methyl gas. Okay, methanogenic bacteria produce methyl gas, and methyl gas has better affinity to smooth muscles than serotonin. Hope you understood. So, IMO, methanogenic bacteria. Methanogenic bacteria. SIBO, small intestinal bacteria. SIMO, small intestinal methanogenic overgrowth is called. So this methanogenic bacteria produce a methyl gas. Methyl gas bind to the serotonin receptor. So what happens if you block the keyhole with the paper pieces? The original key cannot enter into. Same thing. This methyl gas is like a paper piece or wooden piece you are sticking to. The keyhole. Yeah, so the methyl. So 80% of constipations are result of, that's what is curable. So methanogenic mediated constipation is curable because if you wipe out this bacteria from your colon. Okay. So I hope you understood. So 3 microbes are responsible for most of the digestive disorder. Stomach cavity, H. pylori. Intestine, 70% of the issues are related to small intestinal bacterial overgrowth, then fungal overgrowth, small intestinal parasite overgrowth also, minor factors contributing to. But the major factor is small intestinal bacterial overgrowth, colon. Now I'm going to elaborate this 3 segments. It's very, very crucial too because it's a common patient. Our major patients basis consists of digestive tract patient where our success rate is close to 95%. The success rate of this protocol. This is where we get highest number of patient basis and the better prognosis for our patient. Okay, so let me elaborate H. pylori. It's a very contradicting phenomenon, isn't it? Same bacteria manifest as hypo and hyperacidity. It's a very, so let me explain the mechanism of hypo and hyperacidity, result of H. pylori infection in stomach cavity. And stomach consists of upper and lower portion. The upper portion of the stomach, generally called as corpus region, are rich in parietal cells, P cells, that produce HCl, hydrochloric acids. Okay, and 2 hormones regulate the HCl production. The one hormone secreted from antral called as gastrin catalyze the HCl production, and D cells from upper region of stomach produce somatostatin that inhibit HCl production. Okay, so HCl production from parietal cells and 2 hormones regulate that production. One is gastrin from antral region. Second, somatostatin from. Hope it's clear. Yeah. So what happens when H. pylori infect antral region? That leads to excess production of gastrin, leading to hyperacidity. So antral gastritis associated with the hyperacidity. When H. pylori infect on the upper portion, corpus gastritis, the somatostatin production is inhibited. And one more issue with the H. pylori infection is called as intestinal metaplasia. What is that? Intestinal metaplasia. The cells of the epithelial cells of the stomach assume the shape of intestinal epithelial cells. So it stops producing the acid. It's called as intestinal metaplasia, So these all are the major underlying causes of the pathogenesis of H. pylori infection. So what happens? The corpus gastritis manifests as hypoacidity. Antral gastritis exhibit as hyperacidity. Is it clear? Is it clear? Both are facilitated by, but the location matters a lot, you know. Yeah. And H. pylori bacteria, they use it's a major virulent factor of H. pylori. And I think I conducted a conference on molecular mechanism of H. pylori, which was 3-hour conference, a delivered talk exclusively about the different aspect of H. pylori pathogenesis. So this is a very long topic. Maybe I can deliver an online talk on this topic in future. And this can leads to linked with stomach ulcer, duodenal ulcer, cancer, gastric atrophy, reflexive duodenitis, top of that, migraine. And 95% of gastric carcinoma are result of H. pylori infection. 95% of adenocarcinoma of gastric origin are strongly related to H. pylori infection. So it is a bacteria which make a life as a hell. An individual life became like hell. I'm sending a patient from my, I have a land in a village in Kerala. So about 8 years ago, I visited a neighbor house. One boy from 2009, he got gastric issues. And later he cannot eat any sorts of foods. And last month once again I met him. I never known about H. pylori mechanism. I was helpless. He contacted me. He's sitting inside home, very poor family. And I got a call a week ago. And I asked him to go for an endoscopy tomorrow. Now I'm sure that it is H. pylori mediated. And he can tolerate only one food, ganji, rice ganji. Nothing else can be accepted by his, So he's on ganji from past 16 years now. 16 years. All the teeth fell down. He's 39-year-old boy. The complete teeth fell down because of lack of nutrients. And he cannot step outside home. The life is like a hell, no? So I asked him to, again he contacted me, I'm sending him to endoscopy. And I started with then first I prescribed him, I have a probiotic combination. He told it's stuck in his throat. He cannot talk. And then I told to mix in water and the powder. Remove the, the capsule, and still he's getting irritation. Then I gave him a homemade aloe vera probiotic. After 10 days, after I think around he watched my video, preparation of that aloe vera. That's why he contacted me again. After I kept a Malayalam video. So he was saying he tried that one, but it takes around 2 weeks to get adjusted to, he was getting irritation initially. Then third one, to increase the mucus thickness, I kept him on a leaky gut formula, which is we are displayed here. So main content is, that's where we get lots of patient. They says burning sensation. Burning sensation after spicy food, or burning sensation while defecation. Even mild, moderate spicy food also cause. What it means? Some people says that they cannot digest any herbs. It irritates them. They have a thinner mucous membrane. H. pylori eroded. So that's why we cannot start with any probiotic or. So I started with L-glutamine and L-carnosine. Both are amazing to increase the thickness of. So I had a patient 6 months ago and able to digest single food, again ganji. After introducing this leaky gut formula, within 6 months, he is able to tolerate 4 foods now. Got it? From 1 food to 4 food. Then after 6 months, I introduced the herbal formulation to him. So it's very rare patient, not everyone, okay. Maybe 2 to 3% of patients, they cannot tolerate any form of herb or for probiotics. And particularly, they have a symptoms like spice intolerance. Even a little bit of spice in the food that trigger their flare up, leads to flare up of the symptoms. Okay. So this H. pylori infection are notorious. H. pylori affect the antral, G cells get inflamed, gastrin get induced, HCl production is increased, leads to hyperacidity. Then HCl affect fundus, stomatostatin get induced, parietal cell is damaged, HCl production is inhibited, leads to hypoacidity. So this is the so this is the combination I developed. The conventional treatment consists of triple. What do you mean by triple therapy? The combination of 2 antibiotic and 1 antacid in a single pill, called as triple. Ever since the discovery of H. pylori, Barry Marshall, 2002, awarded with a Nobel Prize for isolating this bacteria called as H. pylori, is credited with associating this bacteria for stomach irritation. And this is a parallel triple therapy has been developed by my research team. It consists of probiotic, natural, herbs. We made a formulation of herbs as well, and nickel-free diet. Nickel-free diet, very powerful. And I found over 95% of success rate to H. pylori infection. Today, what is success rate of H. pylori with a conventional treatment? Approximately 20 to 25. 2 decades ago, the success rate was 95%. Because of antibiotic resistance, the efficacy of the conventional triple therapy is reducing over the years. Okay. Nickel-free diet.
What is this probiotic?
Sir, aloe vera probiotic recipe, please.
Yes, aloe vera probiotic, and we have a probiotic formula typically for H. pylori infection. We have displayed here. Yes, I'll explain to you that way. No? So this is a nickel-free.
So which medicines you have read from there, Dr. Sanjay?
Yeah. So I'm going to explain, madam. Yeah. This is a nickel-free. Nickel-free diet. Nickel. What is nickel-free diet? Because the major virulent factor of H. pylori. H. pylori has one smart strategy to survive in the harsh stomach environment. The pH of stomach is 1.5. H. pylori is neutrophilic bacteria. What it means?
Either survive in
No.
alkaline.
5 to 7. Above 7 is alkaline. Below 5 is acidic. So there the favorite ideal environment is 5 to 7. And stomach acid is 1.5. So how H. pylori can survive in a low pH? It is a question from decades. So now they found the mechanism. H. pylori produce one enzyme called as urease. The urease split urea into ammonia. Dietary urea transform into ammonia by the action of urease, and the surrounding environment transform to alkaline nature because of ammonia, and H. pylori reproduce over there. So without this manipulation, H. pylori cannot. And nickel is the enzyme, the urease enzyme, the protein produced by H. pylori. This urease enzyme consists of 2 segments, fractions, ural A and ural B. And both the fractions are combined by one cofactor called as nickel. Nickel is the metal activate. Ural A and ural B, once they both combine together, it turns on the activity. The activity gets turns on, So this is the most crucial, indispensable, invariable process to activate urease enzyme. So nickel is a dietary. H. pylori use nickel from our food, So you stop the nickel. Amazing result. So many studies are published about efficacy of nickel-free diet on H. pylori eradication. So the pulses, nuts, the whole grains, like the bran of the grains are rich in nickel. So I recommend white rice or maida for few days, like 1 month during course, So we have to remove the bran. Bran is rich source of nickel. Just you can Google it about. There are so many studies are published about nickel-free diet. This is a triple therapy, most successful formula ever we have developed by natural way. It's called as natural triple therapy. So we have a huge online, my friend Dr. Venkatamana Hegde runs a hospital, and additionally we do get about close to 500 online patients every day. And out of 500, I think overwhelming number of patients, about 90% of patients, either they have hyper or hypoacidity, and this protocol brings us lots of patients. And particularly, our doctors are well trained to distinguish hyperacidity from hypoacidity. We are friends of the 100% of, if suppose 100 patients who complained about gastric irritation, 60% to 70% belongs to hyperacidity. And they are misguided from longer time. No one diagnosed so far. That's why they were on proton pump inhibitors from longer. The moment a patient complained about gastric issues, the doctors tends to put on proton pump inhibiting. Forgetting an important fact that they are suffering from lack of stomach acid. So these questionnaires we have developed to distinguish hypo from hyperacidity. The major question, the main question, appetite. Patients says they have a sufficient good appetite and less gas bloating, likely to be hyper, because excess acid, the food digests very rapidly, so gas may not generate. So patients complain that lack of appetite with the gas bloating, no doubt it is hyperacidity. So hypo and hyperacidity. Okay. So next question, protein indigestion. So 3 macronutrients, which are those? Fat, protein, carbs. The fat digestion is facilitated by bile acid. So indispensable requirement, okay, for fat digestion. What about carb? You don't require bile or acid for fat digestion. That's why the herbivorous pH is, their diet is predominantly rich in carbohydrate. The pH is above 4, you don't require acid. The carnivorous, what is the main food of carnivorous? Protein. The pH is, so the acid is, main purpose of acid is protein digestion, breaking long peptide amino acid chain into smaller peptides, okay, chopping into, yeah, that's where the major duty of acids comes here. This very crucial mechanism. And second, the killing the microbes in the food we consume, so, okay, filtering the foods. So this is the 2 main function of stomach acids. So okay, so that's why.
Everybody should do ACV test.
Yeah, no, not everyone. If patient says that they have, no. If they says that they have a pain and burning under sternum, don't give ACV. They complain that lack of appetite and gas and bloating, just try with the ACV. You know, so if it aggravates the symptoms if you give the ACV for hyperacidity patient.
To give you an example, 80-year-old patient, difficult in protein digestion, and after eating protein there is hives.
Okay.
And they also have pain and burning under the sternum. What to do?
Pain and
burning under the sternum is there.
Okay,
and
but
also have
what about gas bloating?
It's there.
Gas and bloating is mostly hypoacidity. You can try with 1 teaspoon of apple cider vinegar.
Okay.
So if tolerable, 2 teaspoons, which will figure out.
And what about our medicines?
That's what I'm teaching. Next slide, I'm teaching. Before food. It's for it's investigation. It's a testing to figure out. So.
2 teaspoons of ACV before food.
Before food to figure it out. Now pressure, bloating, and heaviness under sternum, suggesting hypoacidity. Pain and burning under sternum, mild burping, hyperacidity. The food bounce back to the throat with a bitter taste, likely to be. So even GRD, 2 category of GRD, hypoacidity mediated GRD, hyperacidity mediated GRD. Okay. So regurgitation of acid test in the mouth, not relieved by antacid, relieved by ACV, aggravated by ACV. Skipping meals or fasting is tolerable. So hyperacidity patient, they complain they cannot skip, they get nervous if they skip a single meal or breakfast or lunch or dinner. No, they get nervous, they get angry, they get anxiety if they skip a meal. That's most likely be hyperacidity. And brain fog, headache is the major characteristics of hyperacidity, headache and migraine. This is the questionnaire and brought us hundreds of patients to our clinic. We are the first doctors ever diagnosed it is hypoacidity. They were on proton pump inhibitors from very longer period of time. I got so many gifts from my patient when I able to, tell them that this was your real problem. Yeah. Now the protocol for hyperacidity and hypoacidity. Hypoacidity, gas bloating, lack of appetite, indigestion, heaviness, stomach cancer. The hyperacidity, migraine also. I'll explain how the migraine is related to hyperacidity. GRD, gastritis, acidity, chest burning, pain under sternum. So this is the protocol I have prepared for a short time, 15 to 30 days, gastric walks, which is the herbal formulation, Hypocare. This is for hyperacidity. Okay, hypocare is the boost the stomach acid, not the to boost the stomach. This is a combination, traditional herbal combination made up of spices. All the spices has property to increase. So the ginger, pepper, tipali. There are so many herbs which is, can stimulate the stomach acne. So this made a formulation called as Hypocare. Optiflora is a probiotic. Acnify, that is again milder version of Hypocare in a capsule form. It's not it's a powder form. Okay. So long-term protocol Acnify. Acnify means increase the acne. That's what the name applies. Acnify. Acnify. And Muco-Revive. Muco-Revive is mainly made up of it's a milder version of leaky gut formula, where the main content is L-glutamine. L-glutamine, aloe vera. This increase the thickness of mucous membrane to repair the gut inflammation. So the gut inflammation is addressed by Muco-Revive, and the stomach inflammation, H. pylori is controlled by the herbal formulation. That's called as Charitable. And when you combine triple tree diet, 100% successful rate. So this is for hypoacidity, hyperacidity. This is a protocol, short-term protocol, Gastribox. This is a herbal formulation, very simple, like you don't require so many formulation to control the Optiflora, which is a probiotic. And subsequently, you can put on, reduce the stomach inflammation by Muco. When I stepping into leaky gut, you will understand how significant the thickness of mucous membrane. So this is a protocol with a 95% success rate. But the important thing, we should be able to distinguish whether it is hyper or hypoacidity.
But there are patients who has the symptoms will be changing.
That is I'm coming to that point. It is called as Vishamakni. That is called as Vishamakni, fluctuation of hyper and hypo. This is mentioned in Ayurveda long time. I'm going to mention about Vishamakni also. So good question about Vishamakni. So this protocol works very good for migraine also, 90%. And migraine, we need to understand the root cause of migraine. Migraine can be 5 triggers. One is stomach. Second is light. Food, not food, light, sound. Yeah, so there are so many triggers. I will explain the pathway also. So we need to figure out whether it is a gut-related migraine. And there are so many studies are published about abdominal migraine. You can refer, when you get a free time, please study about abdominal migraine. The abdominal epilepsy or abdominal migraine. The root cause is H. pylori bacteria. So this protocol has 100, if it is gut-related, 100% improvement for those cases.
GRD-induced migraine, it's come under
hyper. That comes under not hypo category. Hypo manifests as gas bloating. Hyper is result of So hyperacidity, further 4 classification. Chronic, one I forgot to mention. Okay, so if it is acute is result of lifestyle, alcoholism main cause, or spicy food, 2 main factor for acute, where proton pump inhibitors are helpful. If the acidity persists for less than 2 weeks, likely to hypo, so you can give a proton pump inhibitor, a fluorosol, to reduce the side effect of this proton pump inhibitor. You can combine a Muco-Revive, like So next one, H. pylori. If it is chronic, 70 to 80% of category belongs to chronic one. Only one reason, that is H. pylori mediated. So in chronic can manifest as chronic gastritis. Gastribox and Optiflora works here. This is a herb. Optiflora and nickel-free diet. Vishamakni means fluctuation. Few weeks hyper, few weeks hypo. There one herb. This is amazing. Like Yashtimadu Kashaya. This Kashaya works great for this condition, which is that Gulichiyadi Kashaya, 30 ml twice daily before food. That's called as Gulichiyadi Kashaya. Optiflora and Gastribox and Optiflora, duodenal ulcer, and even all the ulcer patients complained. Simple, very easy to identify. If you give a herbal formulations, they get irritation and trigger. That could be related to ulcer. Ulcer patient cannot tolerate any form of herbs and spicy foods. Pardon?
For irritation, like aloe vera or
Which one?
simple aloe vera can
That's what this protocol, ulcer or gastric ulcer, the Mucor Revive. Mucor Revive is rich in zinc carnosine.
So there is a one formulation in Ayurveda called as Kumarya Asam.
Okay,
You
okay.
gave it?
Yeah, I don't, yeah, maybe you say I can try. Yeah. Yeah, so this is a classification of hyperacidity. So Vishamagni, duodenal ulcer, the major medicine is probiotic and Mucor Revive. Mucor Revive is rich in L-glutamine and zinc carnosine. Both increase the thickness of mucous membrane. Even the fourth one is called as lack of snigdham. Snigdham means mucous membrane. The patient who complained about food intolerance particularly, they be highly sensitive to spicy foods or that irritate them, you know. So the same protocol can be applied, the leaky gut formula for these patients. Okay. So this is a classification of hyperacidity. So the proton pump inhibitors are beneficial only for acute gastritis cases. If the symptom persists beyond 2 weeks, you have to suspect H. pylori infection. And stool antigen or the blood antibody cannot tell you the best way is to detect endoscopy. And my daughter, almost 3 months, she's into 10th standard now, 3 months she lost because of gastric irritation. And my wife was saying tension and stress, and even when I took to doctor, is giving to give sleeping tablet, okay. Then I told don't take anything. Finally, she started profuse vomiting. I took her to gastro. Even doctor was reluctant. He's telling 15-year-old how we can give the endoscopy. I have insisted and it came out because first I given stool and blood samples, okay. Both came out negative. But it turns out that it was a H. pylori mediated, you know. She was suffering from 1 year. And my best friend wife, she collapsed 2 months ago. Took immediately to hospital. Intestinal perforation was identified, and my friend was so much worried. Maybe it might be cancer or something, you know, like the endoscopy and culture, they ruled out that it is H. pylori. Okay. There was no symptoms of gas or bloating, nothing. So it's a notorious bacterial, you know, we have to suspect H. pylori as a major culprit for most of the digestive disorder. That's what, the breath analyzer is the best one. It's a non-invasive form of a breath analyzer. I'm trying to get in masses, you know, like we can keep in our clinic. Just a breathe. It's a 95% success rate. And I delivered a talk in Mauritius last month, February 25th. I had an opportunity to train 200 doctors from Mauritius, which was a one-day program. And one surgeon, what is called recto, something like, you know, surgeon actually related to gastric surgeon, a colorectal surgeon. He trained in China. Even he took Chinese language as the major language. Okay, so he was, and he's returning to, he came to renew his license here to Mauritius, basically Indian. And he told that they're doing lots of studies about H. pylori, and he suggested that almost all stomach cancers are related to H. pylori. There is different strains of H. pylori. For Indian strains is vacuolated strain, and Northeast like China, Korea, Japan, and Northeastern states, they have CAG strain of H. pylori, CAG. That is more aggressive form and leads to cancer. Vacuolating strain of H. pylori leads to acidity. So that's why the highest death rate in Northeast, the major mortality, cancer-related mortality is result of stomach cancer. In rest of the India, it's breast cancer. Oral cavity. Or Northeast people don't take so much of tobacco like the rest of the India, you know. So their major cause for stomach cancer is H. pylori, the high prevalence of stomach cancer. And so there are different strains of H. pylori and extremely dangerous type of bacteria. We are trying to install in a cheaper, so we can by breath analyzer, no, just breathe it and it comes out as a negative or positive. Like nickel-free diet enhances H. pylori eradication rate. Treatment of migraine attacks based on interaction with the trigeminal cerebrum.
How long
It's all about 1 or 2 months. 2 months, yes, yes. If it is very chronic, you try to adopt a diet for 6 months. If you want complete remission of this. Treatment of migraine attacks based on interaction with the trigeminocerebrovascular system. So I'll explain this mechanism. It's very well established theory of vasodilation. The fundamental cause of migraine, uncontrolled vasodilation, unlimited vasodilation of the blood vessels of brain. That leads to, that's how the migraine develop, vasodilation. And the vasodilation is related to trigeminal ganglion, which innervate the blood vessels of brain. The trigeminal ganglion innervate the blood vessels of brain, and similarly the supply to the nerves of nostrils, eye, the mouth, face, muscles are innervated from trigeminal ganglion. Additionally, the trigeminal ganglion also connected to vagus nerve in stomach. So the trigger can come from sound. What happens when you get a trigger from sound trigger? That activates the trigeminal ganglion. Activation of trigeminal ganglion leads to blood vessel dilation of blood vessels in the brain and migraines. Okay. So the trigger come from smell, trigger come from sound, signal come from light, and the important signal come from gut. The stomach linings are connected by vagus nerve to trigeminal ganglion. H. pylori infection leads to production of a neuropeptide, neurotransmitter in the brain called as vasoactive peptide, which is a neurotransmitter which irritate the trigeminal ganglion, and eventually activating the trigeminal ganglion causes abnormal vasodilation of blood vessels in brain. Trigeminal ganglion secrete calcitonin gene receptor peptide cause vasodilation. So most of the migraine drugs are targeting inhibitors of CGRP. Yeah. So the trigger comes from. So I think from my experience, I have observed 80% of, as high as 80% of migraine patients has digestations, predominantly H. pylori. So if you treat gut, but we need to figure it out whether it is.
Ulcerative colitis?
That's a different pathway. Yeah. So effect of vasoactive intestinal polypeptide on development of migraine headache. Calcitol gene related peptide, role of migraine pathophysiology and therapeutical targeting. So yeah, like even so rheumatoid arthritis, seropositive RA ESR, anti-CCCP elevated, CRP elevated, seronegative ESR elevated, anti-CCP negative, CRP negative, gut mediated, oral bacteria contribute 10%, and rest of the gut mediated P. copri bacteria in colon. That explain later section. No? I'll be explaining about this mechanism.
2 slides before the paper about migraine, the paper before. Yes.
So vasoactive, it's a neurotransmitter secreted from gut, intestine, vasoactive peptides. Yes. Viral origin. So this is where glutathione perform better if it is a seronegative. In seropositive, gut protocol works better. Glutathione never has any role on eczema, even the lack of stomach acids. So I pointed out earlier, the main purpose of stomach acid, the main function of stomach acid to chop the protein into smaller peptides. Okay. So what happens if the longer peptides, proteins, unprocessed protein reaches to colon, and it is immunogenic in action. What is immunogenic? It activates immune system. Immune system thinks that it is a foreign body. That never known about long proteins. Okay, they know only about peptides. Longer peptides are immunogenic. It behaves like a antigen. It behaves like a antigen. Immune system get activated. That's why when you have low stomach acid, undigested protein reaches to stomach. Ig antibodies are generated, leads to eczema. That's where couple of our patients, like not everyone, when we increase the stomach acid, their eczema got a remarkable control when we control, you know. So there are other triggers as well, parasite, heavy metals, low stomach acid. So see the pepsinogen. Pepsinogen is the inactive form of pepsin, and the pH below 2, it converts into pepsin active form. So the
It's the same molecule, but
this is how it converts, you know, in the pH below 2. The conversion is facilitated, catalyzed by pH. So when you have lack of stomach acid because of H. pylori or antacid, the pepsin production is inadequate. Inadequate proportion leads to the protein indigestion. So the peptides, this is the normal mechanism. You know, the pepsinogen in pH below 2, it converts into pepsin. Pepsin chop the protein into small peptide. Small peptide reach to the duodenum, where it converts into single amino acids, and finally, in many autoimmune disorders, because of leaky gut, peptides are directly enter to bloodstream, activate immune systems. Yeah, that's why when patients, you stop the protein diet, few people get improvement for eczema, but that's, you are not addressing the root cause. Protein is not the culprit here. The underlying cause is, it might be leaky gut of lack of stomach acid. So, in long run you don't get in. When you restrict the protein, long run they develop some other issues like immune deficiency.
in cases of high uric acid?
No, that's a different pathway. Uric acid is different pathway. I'm talking about. So undigested protein reaches LI, immune system comes into action, produce IgE antibody, leads to eczema. Protein.
If we reintroduce, we have increased the
acidic, yes.
things, and once the problem is solved.
Yes, yes.
After that, do we reduce?
We need to maintain the stomach acids in a long run, no? Yes, yes.
ACV should be taken.
Not ACV. If you take that protocol of mucorevive, naturally stomach start producing the stomach. You don't have to take for, it's all 1 month. We are actually, you see, what I'm talking is a permanent solution. I'm not talking about temporary solution, you know. Once your gut linings are stronger, the barriers are better, you get lifelong, the problem gets resolved for lifelong. It's not a,
So we can cut.
And you see that one doctor, MBBS student, got admitted in my hospital. She was into 3rd year and anorexia, severe anorexia. I diagnosed it is a hypoacidity, and once we increased her stomach acid, she gained 20 kg weight over a period of 1 year. You know, so anorexias are strongly related to lack of stomach acid. It's the most undermined, underestimated diagnosis in the medical field. You know, but it can make your life as a hell. And I remember the first patient of my hypoacidity patient. One patient during COVID time got admitted in, we taken only limited patient. He was a clerk in a engineering college in Bangalore from Haveri, North. So first time he got admitted, and we kept on a soup diet. He got some improvement. But after discharge and being to home, there is a flare up of symptoms. Second, he told, this is my first chance, I'll commit suicide. I was worried, and that's when I started reading about hypoacidity. I improved his stomach acids by vinegar. Okay. After 3rd day, without paying bill, he escaped from our hospital. He did not make the payment, and he ran away from hospital without making the payment. That was my first patient. I treated IBS. Even IBS also related to, some cases of IBS can be related to hypoacidity. That's when I told it's very, very crucial to distinguish hyper from hypo. Multiple disorders are related to hypo. It may not kill you soon, hypoacidity. But many chronic disorder, incurable, mysterious disease are related to lack of stomach acids. And
lack of acidity you mean is majorly due to H. pylori?
H. pylori, H. pylori, chronic H. pylori infection only. Yes, yes.
And then
acute means, hope you understood the classifications.
And
No?
by doing these protocols, when you increase the acid, when you give the nickel-free diet, you don't need to give any antibiotics. The bacteria get killed.
You see, this all depends on. So in some circumstances, H. pylori from mucous membrane, they use it's like a very longer mechanism. They enter to epithelial cells, where this protocol might not be effective. You require an antibiotic and subsequently you start this protocol. Because the main problem of antibiotic is, the relapse. There is a high rate of relapse just in 1 or 2 months of brief period of time. Okay, so they can prevent the remission of this one by adding this protocol later. It's a mild cases, not very severe. Like I told one patient, being in home from past 16 years, I don't think so my protocol alone can. So I use antibiotics also, and simultaneously I keep him on planning to keep on. Yeah, I informed some of my scientists from the University of Nite to take this case history, so I can document, and tomorrow.
I would like to add, I had very similar symptoms some 6-7 years ago. I didn't know what was happening. Okay, and then I took aloe vera gel and L-glutamine.
Yes. Yeah, okay, yeah. That's what This is actually zinc carnosine. Zinc carnosine also helps to improve the immunity of the gut. So it's like it's a very strong enemy. Air Force, Army alone cannot remove it. Okay, that's where we are using. Air Force. That's all I'm using. Probiotic, some specific probiotic, using herbal combination, nickel-free diet, and when you combine all this together, you get a faster, very fast. Like in just less than 1 month, you get complete recovery. Permanent recovery. Yes.
Sir, how to take ACV? There is any precaution for ACV?
So this I'm skipping.
What we will do is let the slides.
Now, yes. Yeah. Now gas.
Let's finish.
This I will finish it, and last slide, ma'am. Now protocol for gas bloating. In gas bloating, 3 factors contribute to gas bloating. The major factor is hypoacidity. Okay, major factor for gas bloating. So the same protocol that this hypocare 2 anti-agnify improves the stomach acids, and so then minor cases like you can say approximately 30% could be related to small intestinal bacterial overgrowth. Also leads to, so there is a probiotics are preferred, prebiotics are not recommended for. So the upper tract digestive disorders like intestinal mediated and stomach mediated, prebiotics should not be used here, because the cybobacteria feeds on fiber, they multiply. So we should restrict prebiotics for, but colon probiotics are not beneficial. Prebiotics are beneficial for colon mediated issues. Okay, so deworming is like a deworming. This is the 3 protocol for. So from this perspective, you need to evaluate gas bloating. The major cause is hypoacidity, and in rare cases I seen hyperacidity patient also sometimes develop gas and bloating. So it's very complex. See, diabetes, fatty liver, obesity, only one reason, visceral fat, one protocol. You don't have to think twice. Okay, but this is challenging. Even diarrhea, loose motion, you see the main cause is SIBO. Second is hypoacidity. Third is parasite, parasite dysentery, like amoebic dysentery. Fourth is fructose intolerance. Fifth is lactose intolerance. Bile acid deficiency, bile acid IBD. There are 16 reasons for diarrhea. So how to distinguish? If you cannot write antibiotic for everyone, that's where the major problem lies here, because so many factors, multiple factors can contribute to digestive disorder and gut problem. But in metabolic syndrome, only one cause. Excess carbs, sugar, refined oil leads to visceral fat, leads to insulin resistance. Insulin resistance manifests as, so same pattern can be applicable for every patient. This is very much challenging. You require an ability to distinguish one causes from another one. Okay, so I'm stopping now.
Talk about these products. Should I get those from the table?
Yes, we can. Yeah.
Sir, ACV, when we take, it damage our enamel of the
ACV. Yeah. No.
How to take it?
Yeah. So ACV are not recommended for more than 2 weeks. That's what that is the Agnify. That's in the tablet form.
Okay.
That consists of ACV powder and herbs boost the acid. It's in combination form, not a liquid form. I don't use liquids for Yeah. So this hypocare also, the powder form improves the, but we need to choose very carefully. Got my point, you know. If it is hyper, it will trigger, flare up. So first you give a small, like a 2 teaspoons of apple cider vinegar and rule out that it is indeed related to hypoacidity. Then you proceed with the other protocol. Yeah. So that's where the education is very, extensive training is important too. And your clinical exposure. You start documenting the cases. I think over a period of 1 or 2 months, you get accustomed to diagnose the cases very rapidly. Yes, yes.
Sir, AC, we are taking it in a fluid form or the powder?
No, that Actify is the medicines. I have prepared with a combination of apple cider vinegar powder plus and one herb I used from Kerala, very stronger and very stronger type of, you know, see when I, pardon?
Then how do we take 2 teaspoons?
No, that's I'm talking about this capsule form. This is to increase the stomach acid. Okay, hypocare is temporarily, Actify is for longer period of time. And this two consist of one Ayurvedic combination herbs, Hemistemus indicus, one type of increase the stomach acids, which is locally grown. And I need to transfer from Kerala to Karnataka. It's around 500 kilometers. Okay, so we sent by courier, and within 2 weeks it came back to my home. And they scolded me very badly. They are saying they got a blister in the hand, handling that herb. That's the original herb. Eh? They got blister in the hand, and my staffs were cleaning. So I have processed it in lime water for 10 days. Keep in lime water, discard the water, like Plumbago Cyranica, but original one. That's where the Ayurveda says that Chitraga. So one form of Chitrag. But what I was getting from Karnataka local shops, then I'm growing myself, because I know this is the most important issues to address. So I have a 25-acre land in Kerala, but that's the power of that herb. Even with the gloves, my staffs were cleaning the water, they got a blister in the hand. So it's very powerful to increase the stomach, and it's all not for lifelong like a proton pump inhibitor. Maximum 1 or 2 months of period you get complete remission and release of the. Chitragar Vadi in a extract form. So it became very powerful too. Very powerful too. Yes.
There is a authentic churna also.
Yes, sir. Panchakola churna also hypoacidity. It's also good for. See, the main problem not the today. What I realized that the quality of herbs. So you can take a tender leaf and matured leaf will have 10 times more. Because of over harvesting, today we are getting the quality of that herb, sir. Yeah, that's where the major problem lies. So I will ensure that the quality is, particularly for digestive disorder, I procure from Kerala. The ginger, like ginger in Wayanad district has highest, strongest ingredients. So I combine similar way. Yeah, okay. Panchakola also amazing for hypoacidity. That works for gas and bloating. Okay.
What about betaine hydrochloride?
No, betaine hydrochlorine. No, I don't. Yeah, it's all more easy and
this is easier.
Yeah, easier too.
Is that not potent and
not imported? It's all locally made. So it's an all affordable rate.
Yes. You're talking about this.
Yeah. This is. I don't.
Is something wrong with betaine, using betaine hydrochloride?
Betaine hydrochlorine, I found more effective. It's more affordable and cheaper, more easy to adopt.
No, that is okay. This is cheap.
Beta. I can work out definitely. Not wrong. Nothing wrong.
Yeah, but use betaine hydrochloride.
Yeah, betaine. I think when you give the beta HCl, the stomach acid increases. Yeah. So H. pylori count
comes down.
Now naturally comes down.
Okay
okay, no problem. It's not a bad thing. Yeah. But I developed it's not possible. We are practicing in a rural area. I cannot prescribe for. Yeah. So I made a common protocol. Yeah. Common and easy protocol, more adoptable, and you don't have to take for a 5 or 25 types of maximum 2 to 4 supplements. That's all. Maximum.
How about allicin and cabbage juice?
Cabbage juice contains sulforaphane, not. It's all in theoretical way. I tried initial days. But many get flare up with the cabbage juice. That sulforine is the major responsible factor for, yeah. Okay.
So, questions on this?
I know, sir.
Those products?
What the same name is this?
Yes. That's all. Yeah.
Salus Nutri?
Yeah, Salus Nutri, everything is there, sir.
Doctor. उसको बोलो इधर आने को.
Hello. Yeah. So this one is the hypocare. What I mentioned, it's in a powder form. Hypoacidity. This protocol. So we can. Next one. Digestin is a digestive enzymes. Digestive enzymes are beneficial for low pancreatic function, bloating, gas, indigestion, eczema, post-gallbladder removal. Yeah. So this is hypoacidity, indigestion, constipation, gas, bloating. The mainly benefit for hypoacidity and gas and bloating. So this is a combination for a. This is after. Yeah, cornies that I will talk after constipation only.
Achha, so then in the end, should we do?
Yeah, I think better. I did not cover all the disease now, sir. Okay. Yeah, that's
okay.
one. Yeah. Yeah.
So then, if you don't want to break for lunch, we'll go for ozone later. Food ready. It's already there in that group, YouTube link. It will be always there.
Out of, sir.
So see, there is Jignasha saying food. So ozone therapy in gut health. So, you know, of course we have beautiful products by Dr. Sanjay's brand, and Dr. Praveen is teaching very well. But since we are already all practicing ozone therapy, how can we improve gut health with ozone therapy? Okay, so that is what I will just quickly, as we know, Ozone Forum of India, we run with a philosophy that we want to use ozone therapy to improve the human life, betterment of human life, and energize your life with active oxygen. Effects of oxygen deficiency are key to understand where you want to apply ozone therapy. Okay? Many a times when the patient comes to you and says that I don't need ozone therapy, or why should I do ozone therapy? Okay, so there are few symptoms which you can enlist or you can ask them, which you can in turn tell them that these can be the referral symptoms of showing cellular hypoxia. So what are these? Stomach hyperacid, you feel acidic, to constipation, to cramps, to depression, to have frequently catching cough and cold, muscle ache, body pain, depression, chronic fatigue. These are all effects of cellular hypoxia, and why this cellular hypoxia happens, and this is the slide which you must remember. Okay? So there is a phenomena called decreased oxygen utilization by the mitochondria. This decreased oxygen utilization leads to mitochondrial dysfunction, leads to DNA damage, leads to inflammation and aging. Okay? Now what are the main reasons for decreased oxygen utilization? So I would say environmental toxins, sedentary lifestyle, lipid metabolism, so what we were talking about, visceral fat. Okay? To that, infection, chronic infection, H. pylori, or any Lyme disease, or any disease, infectious disease which you are encountering, all these leads to one single thing, that is increased ROS. This increased ROS, okay, are making you utilize your oxygen in an inefficient way. At the same time, the cellular uptake will be low. So the reduced oxygen levels will lead to more ROS. These ROS go and function or go and attack the mitochondrial core, and that leads to decreased ATP production, decreased membrane potential, and increased ROS. So this is the main reason for mitochondrial dysfunction. That leads to DNA damage, that leads to increased ROS. So something called inflammation. Okay, inflammation leading to aging, and where you can fit in is to you can change the cellular hypoxia and you can improve oxygen utilization. So the key pathways here you must remember, and I think what Dr. Praveen was showing, all the inflammation pathways had all these core pathways. One, it is cellular hypoxia, mitochondrial dysfunction, environmental toxins leading to metal toxicity, ROS production, and that leads to accelerated aging. So this is the slide which can be a core to any inflammation, and this inflammation you can change with ozone therapy. So to use ozone effectively, you need a shift in thinking. So from the disease literacy, you have to go to healing literacy, and to that you have to understand the patient as whole. So the icons here are the principles for holistic lifestyle. Meditation, good sleep, good diet, good exercise, good cardiometabolic rate will improve. But somewhere you have to use oxygen utilization, and that's where you can use ozone therapy. Yes, yoga, extremely good. Any other, you know, HBOT, okay, good, because it gives more of oxygenation. But ozone therapy has a wonderful, what I call a narrow strip, where you can use oxygenation and oxidation, both efficiently to your patient's benefit. So ozone therapy always results in oxygenation and oxidation, because 99.5% to 95% is oxygen and 0.5 to 5% is ozone. Oxygen leads to oxygenation, ozone leads to oxidation. So the dosage, which is very important. We all know that you can use ozone in external application, in internal application, but in external application you have to use ozone in a higher concentration. So you need to find a hormetic dose, neither too high nor too low. So when we are using ozone externally, topically you can use ozone from 10 to 80 microgram per ml concentration, and for the systemic application you can go up to 10 to 60 microgram per ml. So this is the low dose, medium dose, and then the high dose. High dose is only used externally, whereas low to medium can be used internally. Okay. Same, all external dosage uses the chemotherapeutic pathway, so it reduces the infection load and reduces the microbial activity. Whereas all internal applications are pharmacotherapeutic, so all internal applications lead to anti-hypoxia, anti-inflammatory, immune modulation and metabolic regulation. So these are the main results which you get. But how do we get that? So this is the biochemical pathway. So when you give ozone, it dissolves in plasmatic water and forms the gradient of H2O2 and LOPs. This H2O2 and LOPs go and improve the KEP1 and NRF2 pathway. So NRF2 pathway and KEP1 are there in the cellular lipid biomembrane. These pathways improve the ATP production and cellular energy by improving immune balancing, improving antioxidant response element. So in total, when you give ozone through ARE and through immune balancing, you get more ATP, more cellular energy, reduce inflammation and increased antioxidant. So this is the basic, easiest pathway to understand what ozone can do, and by and large your results you can get. It improves oxygen delivery with the RBC, it enhances antioxidant response, it enhances healing through the platelets, it improves your metabolism, it improves your immune activation. So in general you get the main 6 biological properties of ozone, and this is the core to any ozone therapy. Pertaining to gut, we will start. So ozone therapy in different diseases we will use, but for the bowel diseases we will use, what can we use? So for SIBO, CFO and small peptic ulcers, you have to use something called ozone water. Okay. For SIBO, CFO, you can use ozonated oil capsules. Now what will it do? It will donate more oxygen to the hydrogen which is there, and that can bind and flush the toxins, and also if there is direct any microorganism, it can reduce the infection load. So if you want to address bloating, if you want to address gas or gastritis, you can give 200 ml of ozone water to the patient. Okay? If you want to address ulcerative colitis, Crohn's disease or intestinal malabsorption, you have to go to rectal insufflation and you have to go to minor auto hemotherapy, because those are autoimmune inflammatory conditions. Okay? If you want to use for locally reducing the infection and inflammation load, use water and use ozonated oil capsules. But if you want to use systemic inflammation and if you want to use it for autoimmune inflammation, then you have to use rectal and minor auto. These are the difference between what you, so for bloating, if you keep doing rectal and don't give water, no result, or it will get result, not that, but it will be low result. But if you add 200 ml of water to it, you will get very good results. Just make sure half an hour before and after they don't eat anything. Okay? Intramuscular injection, local injection can be given for patients of colitis, patients who have low back pain. So I have so many patients who have constipation, they all have low back pain. All constipation patients have back ache is because of the load in the or what you call it, the toxins accumulation. So in that we use paraspinal injection to reduce the pain. Okay. So you all know how rectal insufflation enhances the work. Acidity oil. हाँ किधर है? Ozonated oil capsules for SIBO C4 works very well. So rectal ozone improves the general oxygen supply locally and portal system also. So I have never checked, but I am going to check, sir, pre-rectal visceral fat, post-rectal visceral fat, because today I understood this portal way of visceral fat. Let's check. I already took the machine card details to, you know, from where to find this visceral fat. Okay? We can show pre and post and we'll be happy to prove that ozone can reduce visceral fat. Yeah? It will, I mean, according to me, in principle, in practical way, it will. But if somebody wants the proof, we can show it, that it will help. So ozone rectal acts locally, but gives you systemic result. Why? Because the absorption of oxygen and ozone happens from the mesenteric vein. So it acts there, but it works on the portal venous system and improves your whole system. Okay, so as you know, this is our training slide only, one of the very important slide, that after rectal insufflation, we had measured, so the research was shown that the portal vein had more oxygenation and more ozone lipids than the jugular vein, because portal vein ozone gets absorbed from the mesenteric vein straight in the portal venous system. And the biological effect of rectal is that we are upgrading enzymatic antioxidant defense system in liver and kidney. Bactericidal to large population of rectal anaerobic bacteria, which induces cytokine causing immune stimulation. Activation of intrahepatic lymphocytes, ito cells and Kupffer cells. Galt activation resulting to total lymphatic system activation. So, and the second thing is, you can also, or we all know that gut or the, you know, intestine is your second brain. And if you keep your tummy happy, your mind also remains happy. So when you are using rectal insufflation, you can have better neurosecretory, you know, the enzymes, and which can uninfluence any IBS or any depression. So I have seen this in umpteen number of patients. People who have borderline depression become better after rectal insufflation, and we have treated many patients. So patients, I don't know whether you know, there's this psychiatrist, Dr. Aarti Meeda. Her few patients come from Jaipur. She is a functional psychiatrist, uses ozone, vitamin C and all nutrition along with her psychiatry treatment. And her patients come to our center to take rectal and ozone water regularly, because we are addressing the mold infection, we are addressing the galt activation. Okay. So oxygen, So oxygen for our cells and microbiota balance. It targets the pathogenic microorganism without producing harmful effect on the intestinal microflora, thus contributing microbial balance. Now, many a times people ask, I will show you the research on it, that if ozone is working as an antimicrobial, what will happen to your good bacteria? Okay? Now, when you are giving ozone, oxygen mixture in the rectum, ozone dissolves immediately in the luminous water and gets absorbed in the mesenteric vein. What remains inside is oxygen, which is beneficial for your good microbiome. So there is no decrease in your good microbiome. And second, oxygen is the only thing which reaches up to the, so where you deliver ozone and oxygen in the rectum. Then there is descending colon, transverse colon and ascending colon, and your good microbiome is somewhere in small intestine. Okay, ये बहुत लंबा सफर करना है उसको. So when you are giving ozone, the oxygen only reaches up, and that is good for your good microbiome. Okay, so don't think that ozone rectal will reduce your good microbiome. Many patients के मेरा सब कुछ निकल जाएगा, you know, all some people can have that effect, which is not actual, and you must tell them that it does not strip you out from your good microbiome. It enhances your good microbiome with oxygen. Okay. So it can be used in candidiasis, in inflammatory bowel disease. It can be also used in liver problem and constipation, hemorrhoids and fistula. So the use of ozonated water and rectal insufflation in patients with intestinal dysbiosis, and this research was done in Italy. I think I have not, okay, they had this bars, ozone, you can take the DOI number, the digital number, and you can Google this, and you will see that when this ozone water and rectal was given, they had the fungicutes were reduced, the normal other bacteroids were increased, so the microbial plethora had enhanced, and we got a very good result in these patients with intestinal dysbiosis. So today, as we say, ozone is holistic, affordable, natural. It is drugless, no chemical, sustainable lifestyle. It has faster recovery, very well in principle with naturopathy, and very cost effective. So whoever uses ozone, of course, they know it is cost effective. Okay, so we can use it from diabetes, infection, lifestyle disorder, cancer, pain management, and autoimmune conditions. And we have published our own research papers. There are a lot of international research papers and so on. So thank you. This was in short gut healing with ozone. Thank you. Okay. Over to Dr. Sanjay. He will be talking on thoughts and your gut. Okay. I'll just put on the slides. I hope you don't have questions, and you better don't have questions. Otherwise, April में training वापस करना पड़ेगा अगर questions आए तो.
You won't admit them to the advanced course then. If they Hello? Yeah. I'll just use this. Yeah. Thank you, Dr. Millie. I'm sure everybody is a little tired and exhausted mentally after lunch. we all get brain fog. So, what does our mind and our thoughts have to do with our gut? It's an interesting subject. I was actually doing some research on my last book on cognitive longevity, and when I was studying about the mind, I understood how various thoughts that are generated from our mind, how do they impact different organs of the body. And I call Dr. Jignasha and Dr. Millie the Mahatma Gandhi of wellness, because they do everything without any expectation of any return, and they are only sacrificing and sacrificing. So this facilitation of today's seminar was done by them for no attraction of any sort, of no gain. They are just giving. That's what Dr. Jignasha does. So your thoughts are actually digesting your life. That's an interesting line I read on the internet somewhere. It's not my line, but in a way it's true that your thoughts are actually digesting everything that's happening around your life. But a lot of us have nervousness when we have to make a presentation, we have to go out for an important meeting, we get butterflies in our stomach, we get loose motions before, kids get loose motions before exams, they get nervous. And after you have a very heated argument, often people complain of acidity. And what does this have to do with it? So we've heard from Dr. Praveen a lot of the scientific logic behind why IBS happens, why IBD happens, why acidity, hyper acidity happens, and how to measure it. But if you look beyond the physical aspects of that, we ate a lot of food, or we ate wrong food, or we ate spicy food, or we did not chew properly. If you look at beyond the physicality of the causes for gut issues and gut dysbiosis, you will come to the fact that your gut is listening to every thought that you think. Everything that you think in your mind will generate a signal. In fact, I had made my presentation, and this morning, yesterday in the flight, I was reading a book which I recommend to all of us. It's called We Are Electric. And this book taught me 7 slides which I added to this last night, because it taught us about our bodies actually being electrical human beings. We are made up of cells which are vibrating at a current, and every thought is generating a 0.4 volts to 0.7 volts of current. Our body carries 12 watts of electricity, which is enough to light up an electric bulb. And all our vibrations are reacting with each other when we are close to each other like this. Our vibrations are hitting your vibrations, and electrically we are connected. So therefore the thought is, this is what led the scientific community to start believing in called the gut-brain axis. Till about 20 years ago, we never had a connection established between the gut-brain axis. And this is actually a communication that happens between the gut and brain. But what causes this bidirectional communication in overall health? How does it impact what our gut is communicating to the brain? Imagine if we are suffering from a depression or anxiety or something, we normally typically go to a psychiatrist or a mental well-being doctor. They will usually prescribe a medicine, and you eat that medicine, the medicine goes into your gut, right? And from the gut, the signal goes to the brain, stay happy or be calm. And that's how we either sleep or we get relaxed, but the signal goes from the gut. So if that signal can go from the gut to the brain, what else can go from the gut to the brain? 90% serotonin is produced in the gut, we all know that. But what is it that activates those serotonin receptors in the gut? What is it that activates that? Microbiome, of course, is impacted, but impact of anxiety and depression is huge, because all anxiety and depression, which we think is either there is a depression which happens because of situations. So let's say somebody, one of us, our close friends, got killed in the Pahalgam attack. It's a situational crisis, and we go into a depression. It's a situation that happens. We lost a loved one in our life. It's a situational crisis, and that can cause a depression. But most of the depression that people come to me with, which is about 60% of my patients, are not happy. I would not call them depressed, but they're not happy. They're not excited about life. A lot of times it is to do with the gut and the thoughts that you're generating. This negative emotion can lead to IBS, ulcers, and heartburn. These are more common causes rather than other causes. We should look always beyond the surface. So stress, fear, anger, calmness and joy, all these emotions will release a counter action into the gut. Acid reflux, IBS flare up, reduced enzyme secretion, gut inflammation, or joy and calmness will lead to better motility. Now, stress will reduce also lactobacillus and bifidobacteria. In 2022, this was published that these two probiotics, or we call them happy biotics, increase, if you are stressed from your mind, you will have increased cortisol, increased sympathetic activity, worse gut mobility, permeability of the intestine, which will lead to leaky gut ultimately. All of them are caused because it impacts the gut-brain axis. So your microbes actually listening to your mood, which is the two-way communication we talked about. Emotional patterns will disrupt all the signals that are going from our mind into the gut. Chronic fear, suppressed anger. A new thing which was added last year only was perfectionism. I have a patient in Bombay who comes to me from Delhi, Dr. Millie knows him, and he is a total perfectionist, type A alpha personality, CEO of a large company. He owns a bank in Bombay, and he is totally perfectionist. He will not even tolerate a bottle lying like this. He's not just got OCD, he's also a perfectionist. That adds a different type of a stress, and that leads to, and his gut is always out of order. So no matter what, he went to all the gastroenterologists in the world, but not realizing that perfectionism is one of the things that he needs to correct. I mean, I'm not saying you should not be perfectionist, but to take it to that extent that it impacts your health is a bit too much. Lack of self-worth and guilt are other emotions which have been added to the list now. So if you want to heal your gut, don't just ask what you're eating. Of course, what you're eating is important, very, very important, but what are you thinking has a big role to play in your gut. So your thoughts will also influence your gene expression. We just talked to a genetic scientist who just called us actually to Bhubaneswar. He talks about chronic stress activating inflammatory genes. So we are not just treating acidity, we're actually treating stored emotional memory, because our emotions are stored, and when they are stored, recall of those emotions is very easy. Whenever we see a situation or we think about that past situation that has happened in our life, that emotion will trigger a same response in the gut which it triggered at that time when that incident happened in our life. So the more you go back into the past and keep thinking about stored emotional traumas, they will alter your gut. The gut always remembers. Sometimes your mind is trying to forget. You say, okay, I don't want to think about it. It was a bad incident in my life or a bad history that I had of certain things, but the gut will remember. Serotonin is obviously, as we discussed, is produced in the gut. But there's another pathway that was been discovered again about the last 5 years after the gut microbiome got more and more publicity and the gut microbiome got more researched. It's called the kynurenine pathway. The kynurenine pathway shifts the tryptophan pathway from the serotonin pathway. So the tryptophan pathway is actually shifted from the serotonin pathway, and it goes into a thing called kynurenine metabolites. Most of them are linked to neuroactive and neuroinflammation. So neuroinflammation will increase because of the kynurenine pathway, kynurenine metabolites becoming active. And this is also stress signaling. So stress signaling will cause an emotional trigger, which will cause a neural and hormonal signal, which will impact the vagus nerve and the gut-brain axis, which will impact gut. So there is a thing called CRH pathway. You know about CRH pathway? Gonadotropin hormone. Yeah. The gonadotropin hormone actually is connected with stress hormone. Yeah, corticotropin. Yeah, so don't know how to pronounce it. See, I'm not a doctor, so I've just learned these new terms. So threat appraisal will activate, also called mast cell mediation, because the mast cell activation will also activate the gut-brain axis and will cause IBS flare-up. So according to the meditation masters who teach meditation, every word that I'm speaking or any one of us is speaking is preceded by a thought. We'll first think in our mind, then it will come to our lips. We'll speak that word will lead to action. Action will lead to becoming a habit. Habit will become your destiny, and your destiny will become your biology, and later on will shift everything. So thought will generate a neural signal. The neural signal will generate a hormonal response. In fact, 16 different hormonal responses are secreted from the brain. And immune modulation will happen, and then that will shift the gut microbiome. It's called the TSH model, thought signal healing model. So you can also change your thought to generate a signal to create healing in the body. Just like we discussed how negative thoughts and negative emotions can cause gut dysbiosis. Similarly, the opposite of that is true as well. So the stress alerts the gut microbiome, which reduces the beneficial bacteria, and it increases inflammatory species. Social isolation is another major issue. It's different from loneliness. It's different from silence. I often go into periods of silence when I'm 3 days disconnected. I will go away from Delhi to Rishikesh or someplace and just sit by myself. It does not mean it's loneliness. It's a process called doing nothing, the art of doing nothing. In Sweden, it's called Niksen, Niksen. It's the art of doing nothing. It's important to also disconnect from all digital media that we have, everything else, and just do nothing. You should not be having a diary with you, nothing to write, no notes. Simply doing nothing is important, to disconnect. Sorry? This one. So this is basically about the stressor-induced nervous system and behavioral changes. Basically, we're talking about how social isolation affects the gut through stress-mediated pathways. And that's why the IL-6, CRP, TNF-alpha, the gut barrier function, all of these are impacted with the social isolation. Spirituality. Recently in Haridwar, there was a study that was conducted, and in Mount Abu at the Brahma Kumari Institute. This was also published by an All India Medical Institute study on spirituality and how it produces or it activates your parasympathetic system, which promotes gastric secretion, which will increase intestinal motility and nutrient absorption. Spirituality has nothing to do with religion, as you know. I mean, we all know. Anybody who's here can tell me the difference between prayer and meditation? Who can tell me the difference between prayer and meditation?
Prayer, you are constantly thinking, asking for something, whereas meditation is you are silencing all the thoughts.
Self-introspection.
Yes.
No, it is not even introspection. You are just witnessing, and from that witnessing, you go to silence, a pure silence.
Yes, it's correct. Yes, sir. Yes, sir.
In prayer, you are talking to the supreme consciousness. In meditation, you are listening to.
Absolutely correct. That's the right answer, actually. So in prayer, you are either talking or thanking or expressing gratitude. But meditation is when you are listening, and you can only listen when you are in silence. You can only listen when your mind is completely silent. And that's when the thought generation is happening, which makes the body calm and safe. Psychological safety activates a vagal tone. Now, vagal, I've just bought a device from Dubai at a biohacking conference last month, which is called the vagus nerve stimulator. So you put it on this, and you put it on with your cell phone. You can activate the device, and it stimulates the vagus nerve. But there are 100 and 1,000 ways of activating vagus nerve written in our old books of healing, which can be simply feeling of safety and trust and calm can also activate vagal pathways. Meditation, prayer, chanting, slow breathing, of course, are spiritual practices which regulate our stress mechanisms. Mindful eating, very important. 90% of us are not even eating mindfully. We are either talking or we are drinking with it. Drinking means not alcohol, but we are drinking some soft drink or water, or we are in company, we are chatting, we are not chewing food properly, or we are watching a movie or watching TV and having mindlessly popcorn or whatever else is in our plate. My wife used to have dinner while watching TV. So, I mean, and it affected all the gut metabolites. Salivary enzyme activation, vagal stimulation, and proper gastric signal only happen with mindful eating. Eat as if, they say, eat your water and drink your food. So chew your food until it's liquid. Eat it like in a gurdwara, you are sitting and having langar. So you're sitting on the floor, cross-legged, and you're just focused on food. You're not talking to the next person. Only food is what is important. It's like a prayer, like the Japanese tea ceremony, like a prayer. Then, of course, meditation and breath practices will reduce cortisol, increase vagal tone and improve heart rate variability. I tried the breath practices with my Gabbett ring, which was launched at Dr. Milli's last Ozone conference, and I've been using this to measure heart rate variability with meditation practices and breathing practices. I have also got a legal patent on activation of the soleus activation with humming. So when you activate your soleus muscles with humming, I have applied for a patent and I've just received it. So you are doing this and you're humming. So doing this constantly for 21 times, you can see the oxygenation on your SpO2 go up to 100 from 90. Normally we get 98, 99. This will go up to 100. Try it 21 times. It stimulates the heart rate variability at a different level. Of course, having meaning in life, having a purpose also has a big impact in terms of your thoughts. Positive emotional states such as gratitude and emotional regulation impact every thought in your mind. I'm grateful the moment I see food or anything to drink in front of me, I will change the molecules of food by the emotional regulation of thoughts in front of the food. So all my water bottles have got a red heart on the bottle with the word coherence and love written on it. If Mirabai could change the molecules of water and make Zahar into Amrit, then you can imagine how much power thoughts have just to change molecule structure of water. And 75% of our body is water. So all those water molecules can be impacted by our thoughts. How powerful are they? Thought will release an electrical signal, as I said, 0.7 millivolts, and they influence the brain because the brain contains 86 billion neurons. Each neuron is communicating through an action potential, 70 million millivolts to 100 millivolts of current. A single neuron can fire up to 50 times per second. That's how powerful in electrical current it is generating. That's what I was reading in this book, and these slides were added yesterday. So when you have billions of neurons firing together, you have measurable electrical fields through EEG. Now you have different levels of brain waves that can be measured, and they can be, so if you see an ECG or if you see an EEG, it's got these electrical signals going up and down. What does that mean? That means that this is firing going on at a certain millivolt of current, which is impacting our brain waves, and all those brain waves can electrically pass on signals to your gut to either stimulate digestion or make it worse. We are living antennas tuning to the Earth's rising sun. This is a line from Deepak Chopra's book. It's not my line, but it's a very interesting line. So we move towards the rhythm of awakening. Flow does not need certainty, it needs coherence. So you be unconscious because only unconsciousness leads to consciousness. And that's how you will start to shift your thoughts. Thoughts will create chemistry, we discussed that. Emotions will create energy, and belief and purpose will direct that energy. So you can redirect those thoughts towards the diseased organ of the body to stimulate those cytokines and those cell activities to make that part well. So basically, the power of the mind can help you to create signaling from every cell of the body to heal itself. You can manifest anything with the power of your mind, basically. So now, what is the final takeaway on this? 5 steps. Mindfulness, you practice 5 minutes. Gratitude, everything that you do is expression of gratitude. Everything that you do. You start your day not expressing but feeling, living in gratitude all the time. Constant state of thankfulness. Deep breathing, you all know this. Positive self-talk. I have a golfer friend of mine who, whenever he's playing, he's always, he has this club in his hand, he says, Ravi, you're the best. You're going to show the best shot. He's constantly saying it to himself loudly, and he says, please keep quiet. let it concentrate. And he's always saying this to himself. And he's improved his game just with this one change in his life. Yeah. This was the same slide that it's captured in the next slide in terms of how stress, fear, anxiety, and calm gratitude can help change your thoughts. So your thoughts can actually shape your microbiome. Essentially, we are trying to create diversity in microbiome, and those thoughts will help create diversity. You heard from Dr. Jacob about that tribe that has more than 1,000 species of, 2,000 species of gut microbiome, and normal modern people have only 300 to 400 types of species. So thoughts will generate more microbiome diversity. This is about little bit about what we do in Delhi, and of course these are some of my books which I wrote. These are available on Amazon. Cognitive longevity is what encouraged me to do this research on thought and gut. This is what I'm now writing. I'm working on this book now. Thank you so much.
Very interesting.
I'll call Dr. Jacob in a bit, because he has got specific protocols now to share with regards to different disease conditions. Those are the more practical parts. I've requested him to go away from theory now to more takeaways.
Yeah, Dr. Sanjay.
So each of the things which Dr. Jacob spoke about, as he said that I have purchased land with him in Kerala, so we are growing most of our herbs ourselves. Some of them like Akkermansia, L. reuteri, etc. we are importing from China or America. The objective is to treat as low price as possible. So we don't sell on Amazon. Products are not available except for trained doctors who are trained in the protocols, because the protocols are very important. And as you've seen from Dr. Jacob, protocols are not just product, it is also diet, it is also avoiding skipping meals, fasting. Protocols have been explained by Dr. Jacob. So the products are a very small part of the whole healing process. It is also the diet, food, and the no diet, that means the fasting part. So fasting, food, and the product, that's how it works. Dr. Jacob will explain more about the products. You were here, sir? Were you here on this slide?
Yeah. Yeah. So how to distinguish gas, bloating, hypoacidity from SIBO mediated? And you don't require any expensive investigation. A simple question, $1 million question. Ask a question: have you ever taken any antibiotics? And particularly rifagat. Rifaximin is the major class of antibiotic targeting small intestinal bacterial overgrowth. And if the patient says improvement with the rifagat, which means it is SIBO. Okay, got it. It is 100%. If patient says there is an improvement of constipation by antibiotic, it could be methanogenic bacteria or SIBO bacteria. That's why you can figure it out. And if says I had taken multiple times antibiotics, never got any prognosis, then you suspect about hypoacidity. This is the two potential contributing factor of gas and bloating. And burping immediately after food, burping 1 to 2 hours after food, lack of appetite, SIBO appetite is moderate to good, non-veg protein diet is intolerable, fruit and sugar is intolerable for SIBO, because SIBO microbes are the category of anaerobic microbes. They utilize fructose and glucose as the major fuel. That's why they feel more aggravated by fruit and sugar. FODMAP diet if improves, that is SIBO. If non-veg protein diet is intolerable, that could be associated with the and nausea, giddiness, non-association. And third one, parasite mediated deworming is the protocol. Excess appetite, anal itching, increased eosinophil, weight loss despite of adequate food intake, skin rashes, dry throat, excess appetite, because parasite is stealing all the nutrients from the digestive tract, That's how they feel, yeah. So this is the 3 factors mainly leading to gas, bloating. The main contributing factor is hypo. Second is SIBO. Third is parasite, yes. So I have explained the protocol. Next, IBS. We are moving to irritable bowel syndrome. 2 category, diarrhea dominant and constipation dominant IBS. So this is a classification: hyperacidity mediated, SIBO mediated, parasite mediated and fungal mediated. Yeah. So the main mechanism of SIBO, first I will start with the mechanism of SIBO. How SIBO associated with the increased gastric motility. That is the fundamental cause of diarrhea dominant IBS. Okay, the gastric motility is significantly increased. Yeah. So the see, as I told you, the main mechanism, the SIBO microbes, the anaerobic microbes from the large intestine dislocate to duodenum and replacing the microbes in aerobic bacteria and manifesting as small intestinal bacterial overgrowths. So this has some of the, because the major metabolites of colon microbes are short chain fatty acid and secondary bile acids. Okay, colon microbes. The intestinal microbes produce neurotransmitters, serotonin. We have seen serotonin is synthesized by microbes in the, so neurotransmitters, there are antimicrobial peptides, yeah, so IgA, which all are produced in intestine. That's the major metabolites of duodenal microbes, like intestinal microbes. The major metabolites byproduct of colon microbes are SCFA, short chain fatty acid and secondary bile acids. That's the major metabolites generated from. So alteration of this metabolic pathway leads to the like a major pathogenesis of IBS dominant IBS like here. So similarly, I pointed out intestinal motility regulated by serotonin. Colonic motility is controlled by secondary bile acids. That's why Ayurveda promote ghee and fat, like ghee, 2 tablespoons of snehapanas, 2 tablespoons of before dinner, sorry, so after dinner, before sleeps, prior to sleep, they advise 2 tablespoons of ghee. Ghee increase the secretion of bile acid. Bile acid goes to colon, it converts into secondary bile acid, peristaltic movement is activated and constipation is relieved. This is the one packet. So this 2 molecule has an important impact on the progression of IBS. Yeah. So SIBO alter serotonin metabolism and bile acid metabolism, DIBS. And secondary bile acid is generated in, where does it is generated? Secondary bile acid? Colon. And that increase the colonic microbes produce secondary bile acid. Okay. So what happens if the colonic microbes moves to intestine? The secondary bile acid start producing in intestine. So the peristaltic movement is activated and diarrhea dominant. Hope you got the mechanism. Is clear? So when the secondary bile acid is supposed to generated in, it's confined to colon, not in. So when these microbes, anaerobic microbes move to intestine, the bile start converting to secondary bile acid in intestine rather than producing in colon, and it trigger the peristaltic movement. That is one mechanism. Second, serotonin. Serotonin is the major neurotransmitter for peristaltic movement. Okay, serotonin bind to the smooth muscles around the digestive tract. Smooth muscles contract and peristaltic movement is inducted. So what happens? Because of SIBO, the serotonin reuptaking proteins, the carrier proteins production is reduced. So serotonin accumulate. That also increase the peristaltic movement. So this is the 2 mechanism by which SIBO leads to IBS, diarrhea dominant IBS. Yeah. So small intestinal bacterial overgrowth in irritable bowel syndrome. You have Analysis of the link between IBS and SIBO. Role of serotonin in the pathophysiology of irritable bowel syndrome. Bile acid and gut microbiota in irritable bowel syndrome. Yeah, so the serotonin, 5-hydroxytryptophan, constrict the intestinal smooth muscles. Yeah, okay. Serotonin in the gastrointestinal tract. Yeah, this is where depression starts because serotonin is not adequately delivered to brain cells. The transport is impaired, so it's accumulate. So both are associated each other. Like depression always accompanied by diarrhea dominant. So constipation dominant IBS patient may not suffer from depression. That's a typical feature of even hypoacidity mediated IBS. They don't have depression and anxiety. Depression and anxiety combined with the severe weight loss indicates SIBO bacteria. Okay. Yeah. So let me talk about the bile acid metabolism. Bile is generated from cholesterol. Cholesterol convert into primary bile acids called as cholic acid and chenodeoxycholic acids. And but cholesterol is a lipid, isn't it? All type of fats are lipids. Triglycerides, fats. The lipids can convert into energy. Am I right? It can convert into ATP. 1 gram of fat molecule yield 120 ATP. 1 gram of carbohydrate, glucose yield 32 ATP. That's why we say fat is more caloric rich because it give you more ATPs, like approximately 100 to 120 ATPs are generated from yeah. So example, 1 acetylcholine convert into 12 ATP, 10 to 12 ATP. Okay. So what is acetylcholine? It is a tiny glucose, which is a 2-carbon molecule. Acetylcholine. Glucose is 6. So 6 carbon glucose split into 3 acetylcholine. Only acetylcholine can enter into Krebs cycle. Glucose directly cannot. So what happened? First step is the glucose split into 3 and the acetylcholine enter into Krebs cycle, or it can convert into lipids again. It will along. So all the triglycerides are contained 18 carbon or 16 palmitic acid or stearic acid. Stearic acid, how many carbon? Or oleic acid, 18 carbon. Most of the lipids consist of 18 carbon. So how many acetylcholine can be generated from fat? 18 into 2, 9. Okay, glucose. Hope you understood the mechanism now. That's why the fat yield more ATP. But the problem with the cholesterol is composed of 27 carbon, aromatic chains, 27, but it cannot convert into acetylcholine. So the cholesterol cannot be burned in our body. You run or jump or jogging, fat will melt, glucose will melt, glycogen will melt. But cholesterol, what is the destiny? How to remove the cholesterol then? It cannot burn in your body, cannot convert into energy. Small fraction of cholesterol convert into cortisol, aldosterone, testosterone, estrogen. Yeah, very small fraction, maybe less than 5%. Around 5 to 10% goes to brain cell membrane. Cell membrane is also made up of cholesterol and triglycerides. Okay, triglycerides and cholesterol. Because triglycerides, why we have so much cholesterol in the brain? Yeah, because you see, no. It's like this is a fat. Saturated fat is straight, no double bond. Where double bond comes, there but small bend comes. Okay. So the cholesterol has 6 bends. So once the cholesterol is attached, there is a big gap. Space is So this gap allow transmission of impulses very rapidly. That's why the more cholesterol, more gap in the cell membrane. More saturated fat you don't have. Yeah, so brain cells are mainly extremely rich in cholesterol and lipids, triglycerides and lipids. But the cholesterol, the problem that, example, billions of cells die every day, apoptosis. billions of cells take birth from the stem cells. That's the homeostasis, okay. So what happens when billions of cells die? So much of cholesterol is released. Where to go it? It cannot convert into energy. Only one way to flush it out, it converts into bile salt. And bile salt goes to, when you consume high fat diet, bile salt is secreted to intestine and it eliminated through feces. So anal route is the only one way to remove cholesterol. There is no other alternative way to flush out the cholesterol from body. Okay, this pathway. So what happened? The cholesterol, 80% of cholesterol and 90% of cholesterol is synthesized in liver from acetyl, 2-carbon acetylcholine, elongate to 26-carbon cholesterol molecule. The fourth step is malevolent to that pathway. Fourth step, HMG coenzyme inhibitor. The statin block the fourth step of conversion of glucose to acetylcoenzyme to the cholesterol. The fourth step is inhibited by HMG coenzyme reductase inhibitor. Okay, so that's why even the fatty liver medicines, all the fatty liver medicines are targeting this pathway, acetylcoenzyme to triglyceride pathway. Fatty liver triglyceride medications. Even triglyceride medications are blocking this pathway, conversion of acetylcoenzyme to the fatty acids or cholesterol. So the cholesterol converts into bile salt. Bile salt is secreted to intestine and it goes to colon where it is converted into secondary bile acid. So I will explain this path, very, very crucial too. Yeah. Not all the bile salt goes to feces. 98% enterohepatic circulation. It reabsorbs to enterohepatic circulation. 5% goes to colon. 95% reabsorbs. So the body, 1 gram of cholesterol, every day 1 gram of cholesterol is converted to 1 gram of bile salt. And 1 gram of bile goes in the feces. So the balance is maintained. So that means if you can prevent the reabsorption, slow down the reabsorption, we can increase fecal excretion of the bile salt. Soluble, this is where soluble fiber works. Gel forming soluble fiber, which is that isabgol or gel forming soluble fibers that trap the bile salt, prevent the reabsorption. So you can increase the fecal excretion of bile salt, the plasma cholesterol. So the plasma cholesterol convert into bile salts. You know, this is the only one way to reduce the cholesterol. There is not by running or jogging. When fasting may not help you to reduce the cholesterol. 10% of total plasma cholesterol can be reduced by isabgol. Not more than 10%. Suppose if you have 150 LDL cholesterol, maximum you can reach to 130 by lifestyle modification. Beyond 130, but triglycerides are result of insulin resistant visceral fat. If it is 500, you can reduce to 100 in a span of 2 months if you reduce the visceral fat. But cholesterol, very tough too. Okay, someone has LDL cholesterol of 200, no matter how much exercise or dietary modification, maximum 10 to 15% reduction. And the most potent agent is soluble, gel forming soluble fiber called as isabgol. Okay. With the food, along with the food, just before the food, yes. Or chia seeds can be taken, chia seeds as gel forming, flax seeds also mild property. Chia seeds or gorgum, small quantity that will trap the bile salt. And see, the another important benefit is not lowering the cholesterol. Not only lowering, it also helps to prevent colon cancer because the bile salt which escape to colon are processed by a bacteria, and the bacteria convert into secondary bile acids, and secondary bile acids are major trigger for colon cancer. So this is the mechanism. Okay, 95% of bile salt reabsorb, 5% goes to colon where bile acid converted into secondary bile acid, and colonic motility and colonic activities are increased. Yeah, so Now the secondary bile acids, which has the deoxycholic acid and lithocholic acids. So when you have IBS, what happens? The anaerobic microbes, they escape to intestine, small intestine, and usually the secondary bile is generated in colon. When these microbes dislocate to intestinal tract, the secondary bile acids are produced in intestine before delivering to colon. Okay, and peristaltic movement is increased. And second, the SIBO microbes, the anaerobic bacteria, small intestine, increase secondary bile acids. Okay. Yeah, this is. So the pathophysiology of bile acid diarrhea, difference in colonic bile acid deficiency in a subgroup of patients with irritable bowel syndrome. Yeah. Secondary bile. An under-recognized cause of colon cancer. Bile acid modified by the intestinal microbiota promote colorectal cancer growth by suppressing. So main cause for colorectal cancer is secondary bile acids. That's where you see the most of the sweets and the bakery fruits are rich in fat. You know, gulab jamun or halwa, let it be anything. It's mainly made up of fat and sugar combination. What happened without fiber? So it triggers the production of bile acid. And when the bile is trapped in soluble fiber, it may not convert into secondary bile acids. Okay. So what happened? And that is only one side effect of keto diet. Excess production of secondary bile acids. That's why whenever we follow keto diet, make sure that chia seeds or soluble fiber is added or flaxseed is added. So we can balance this, negate this one.
How much maximum time? I think 3 months is enough for keto diet. Then
Yeah.
it works against your kidney.
No.
I've seen so many patients.
That's what problem here, no? They will have a unscientific, the protein, when you talk about keto diet, I'm talking about the fat.
Yes.
People.
Fat, so they eat cheese, paneer, butter, high amount of, but then after three patients.
Okay.
Now, I know them, they are not my patients. But
Okay.
They get, one has got kidney, her
creatine level fluctuations. Okay. No, that's what we need to, first we have to monitor.
One had alkaline phosphatase increased.
Alkaline phosphatase increased.
So she had severe weakness.
Yeah. So we had to monitor the kidney function after 1 month. Yeah, and liver function. Every month we need to monitor it. Okay. If there is no fluctuation, they can continue. And before starting, it's very mandatory to, record all these parameters like renal RFT. The problem with the diabetic patient or hypertension patient, they may not be knowing the kidney damage might have started long ago. And when you keto diet, the slightly symptom will flare up and they start accusing because of keto diet. And you see in kidney damage, for instance, my panchayat, it's a small rural panchayat in Kerala, 15,000 total population. And my father passed away from kidney complication, I don't know, diabetic. So second death anniversary, my mother told to visit a dialysis patient. And myself, my family went to, there is a support group in Kerala for cancer support group and kidney, I was really shocked to see 1,200 patients of 15,000 population are undergoing dialysis.
Oh my God.
It is almost 8% of total. I'm not exaggerating. And of this 1,200, maybe 98% had uncontrolled diabetes and uncontrolled hypertension, which is not detected from longer period of time. You see the American statistics. In 1960, the cardiovascular death in USA was 850 death in 1 lakh population. 850 death. American President Eisenhower had a massive cardiac arrest in 1955. And that's where the people started thinking about, it was never known to the world, okay, there was a massive, so then American government deputed a committee, they did a national hypertension screening program. It's a massive screening. They found the hypertension patient and they controlled the blood pressure of those patients, and the tobacco tax was increased by 10x. The blood pressure was controlled for most of the American. You know that today the prevalence of cardiovascular death, 250 death in 1 lakh population. 1960, just you can study about the death rate from 850 to 250. So the blood pressure is the main cause for kidney damage. And so what happens, the keto diet who are following, they might not be aware about their blood pressure, okay. So what happens? Already their kidney might have damaged by hypertension, and when you start keto diet, the creatine goes up and accusation comes to you know. So very, very crucial. You should, if they are hypertension patient or diabetic patient, should be very careful to handle. It is not the keto diet damage the kidney. The diabetes, excess sugar damage the kidney, and this, you know, coincidentally when you give the keto diet. So this is only one factor you have to take care. Like if they are not hypertensive, and 5% of kidney damage are autoimmune. Not all kidney damage are chronic kidney disease are related to hypertension or uncontrolled diabetes. 5% belongs to IgG nephropathy, IgA nephropathy, and SLE patient, like you know, they're more likely to. So it's very rare cases. So figure out all these risk factors, and you can proceed with the keto diet and make sure that adequate amount of. So this is a protocol for herbs and berberine. Yeah. So this is the probiotic, fructose-free diet and glucose-free diet. Okay, main step for SIBO. If it is SIBO, nickel-free diet for H. pylori, SIBO, fructose and why fructose-free, glucose-free diet? SIBO microbes are anaerobic bacteria. Yeah, they require glucose. The major policy here, starving and killing for SIBO microbe, you know. So you for SIBO, not for parasite, you know, for fructose-free diet and glucose-free. There are some strains of probiotics and herb cell combinations. It's a triple therapy. Again, one more triple therapy consists of probiotics, herbs, and fructose-free, glucose-free diet. Yeah, there is a ACV relieved by antibiotic, burping immediately after food, lack of appetite. These are the questionnaire for you know, ruling out the DVM. So this is the all about protocol of IBS diarrhea. Maybe 10% could be hypoacidity, gastrivox, optiflora, hypocare, and acnify. This is the protocol for and SIBO mediated. The spore flora. Spore flora is spore-based microbes. Have you heard about Saccharomyces boulardii, which is a great way of killing the, eradicating the, you know, the SIBO bacteria, and additionally spore-based microbes like Bacillus group, Bacillus coagulans, Subtilis. This all are has a great potential to counter the growth of SIBO bacteria. And Indestora is a rich source of herbal, natural herbs, antibiotic for SIBO. And fructose and glucose-free diet. This is the combination consists of targeting SIBO bacteria, and the Bristol stool shape is very important. And shape, the same, you know, Bristol stool, the chart start from 1 to 7. 7 is watery diarrhea. Usually SIBO diarrhea, the stool consistency is similar to 7, watery diarrhea. But in hypoacidity and parasite, it is like a amoebic dysentery, a type of not very watery type of, it falls into Bristol stool 6, category 6 for. So hypoacidity, SIBO, then we need to rule out parasite also. If you don't get any result for SIBO and hypoacidity, just you the possible causes, potential cause could be parasite overgrowth mediated. In parasite, anal itching, eosinophil count goes up with the anal itching, and excess appetite, that indicates parasite, and fungus mediated. And fungus, the coating of the tanks, like you know, fungal growth in groins. Yeah, this is the spore flora. So this is a protocol for again the fungus also use fructose and glucose as the main fuel. They cannot utilize amino acids and fatty acids. So they use lots of glucose and fructose. So hypoacidity mediated, ACV test, hydrogen breath test, stool mapping, parasite, and stool mapping. next we are moving to constipation, IBS-C, with the gas bloating, without gas bloating. Leaky gut marker like sonulin, akkermansia. So in constipation, the major problem with the methanogenic bacteria, I have briefed the mechanism as well. The methyl gas generated by methanogenic bacteria block the serotonin receptors. So serotonin cannot effectively, bind to the, so the contraction of smooth muscles are reduced, leading to constipation. Yeah, this is the normal. The serotonin is the key. It should unlock the, it should turn on the key lock, no? But what happens, the methyl gas enter to the keyhole. So serotonin cannot enter, yeah. So this block the serotonin, methanogenic bacteria. So this is the one category of constipation. You get permanent cure. Then you not depends on, if you remove the methanogenic bacteria, they don't suffer from constipation thereafter. Yeah, probiotics and short chain large intestine. So this is a protocol. This is where the prebiotics works. For constipation, prebiotics are beneficial. For digestive, upper digestive tract, SIBO, fungus or H. pylori, probiotics are beneficial. In colon mediated ailments, the probiotics may not be a solution, because why probiotics are helpless here? The number of microbes are huge in colon, trillion, 99 trillion. So feeding the probiotics are adding water to, putting the one drop of water to ocean. That might not be highly beneficial. Prebiotics are remarkable, the best natural strategy over here.
Why don't you add other indica in that Ayurvedic?
Yeah, sir. I'm not added all herbs, sir.
Azaricta indica.
Yes, sir. Azaricta indica also I have added to in this.
In Ayurveda, the most useful antibiotic or antibacterial is the Nimba.
Nimba, okay, sir. Yes.
Also recommended in this.
SIBO, okay. No, I have added a small quantity.
So there is a Krumi chapter.
Okay.
Special chapter.
Okay.
There are many types of Krumi. The same. And they have recommended the
Vidanga. Okay. Gudichi, yes. No, I have added everything, so I could not mention all the ingredients in there. That's why. Okay.
The previous slide. So large intestine also it's mentioned probiotics.
Prebiotics. Sorry. That's a prebiotic and short chain fatty acids. I'll modify it. Yeah. Probiotics are okay. You can use it. I'm not saying not as effective as prebiotic fiber here, because prebiotic. So the colon dysbiosis, dysbiosis or dysregulation of colon microbes are fixed by a magic molecule called as short chain fatty acid, SCFA, short chain fatty acids. Yeah. So the long term, the constipation with the gas bloating, and I used a Puricolis porflora, and without gas, prebiotic also can be added, okay, because for minority people, the prebiotic fiber flare up the gas production. So they get some discomfort, So if they complain with the gas and don't give any prebiotic fiber, so once the gas production is reduced, later on we can add the fiber. Puricolis, this is the conis and back fiber. So second and third month, conis is a herb, fiber is a prebiotic fiber. This is what you require maximum prebiotic fiber in long run to generate short chain fatty acids. And this is the best molecule to fix allergic. I had a patient, so the DVSP of Sirsi, local taluk, and we are close friends since 2016, okay. And he's also like he has a scientific background. And he started using prebiotic fiber from 2018. And during COVID time, he's deputed to rural Karnataka. And he has isolated for a longer time. There is nothing else. He had a celiac is like gluten allergy and dairy allergy from longer time, from since childhood. So then one day he called up me during COVID time, doctor, you know one fact, I ate chapati today without any problem. Now from the past 5 years, after prebiotic fiber, because you know what is the allergic response, gluten allergy or food allergy, it is mediated by TREG cells, T regulatory cells in digestive tracts, okay. So their response to the food allergens. So this TREG cells are suppressed by prebiotic fiber, short chain fatty acids. So I seen 98% of my patient who had prawns allergy, fish allergy, or allergy to different sorts of food items, they became tolerable to. So it is not the genetic issue. We are inheriting allergy. The gut microbes determine whether the food should be accepted or rejected by the body. The example, the milk. If you add the starter previous day, buttermilk, what's calling, we call in curd on previous day, and if you add a good microbes from the curd, the milk convert into yogurt. If you don't add the starter bacteria, what happens? It get spoiled. So similarly, the bacteria determines whether the food should be turns to poison or turns into nourishment. It's not the, so if you restore the gut microbial colonies, if you improve the healthy microbes, even the waste food can be eaten by, they don't have to depend, so, you know. So this is something, in long run, it repair your gut lining. Inflammation can be significantly controlled by prebiotic fiber. And protocol for normal constipation, same like fiber. And later on, you can stop all these medications, okay. So major medicines to fix the soluble fiber. And why the prebiotic fibers are very crucial to address the gut dysbiosis, particularly colon dysbiosis, because prebiotic fiber convert into a elixir of health called as short chain. So if someone asks me which is superfood, I have only one answer, that is prebiotic fiber. And second to mother breast milk, the best food is the prebiotic fiber, you know. So amazing properties, and I can talk over 5 hours regarding short chain fatty acid derived from prebiotic fiber. There is the 4 category of fiber: short chain, medium chain, long chain, and very long chain. Very long chain is EPA DHA. The carbon number beyond 18 is called as very long chain. Carbon chain ranging from 14 to 18 is called as long chain fatty acid. Medium chain consists of 6 to 12. And short chain is composed of 2,3 acetic acid, propionic acid, and butyric acid. And the short chain fatty acid neither produced by animals nor produced by plants. It's a byproduct of bacterial fermentation, similar to alcohol. You don't get alcohol from plant or animals. It's produced by microbes. Similarly, the short chain fatty acid are the byproduct of bacterial metabolism, fermentation. So how these short chain fatty acids are beneficial? This slide will explain the pH of water. For instance, 7. When you store the carrot, decompose, it rotten within 2 or 3 days. And if you add, on other hand, if you add vinegar and reduce the pH to 3, the carrot get preserved for very longer time. And similarly, and you can imagine the colon is similar to the fermentable, barani we call in local language. The pickles are fermented. What do you call that? Barani we call it. So whenever you think about colon dysbiosis, think about barani. Where what process should happen? Fermentation should happen by short chain fatty acids. In barani, if you don't add vinegar or if you don't add salt, what? This gets spoiled. Similarly, this is what we require to fix the gut dysbiosis. Short chain fatty acid, which has same property of vinegar. It reduces the pH of colon, so harmful bacteria cannot reproduce. Harmful bacteria. So how to get the short chain fatty acid? The fermentable soluble fiber. 2 category of fiber. soluble fiber and insoluble, soluble fiber and insoluble fiber, two category of fiber. Insoluble fibers are predominantly found in grains. All the grains are rich source of and vegetables cellulose. They don't have any action on colon microbes. They goes to colon, incorporate to stool and come out from the body. That's all. They don't have beyond any benefit beyond that. But on other hand, the soluble fiber, two category, fermentable soluble and fermentable soluble fiber, non-fermentable soluble fiber. Non-fermentable soluble fiber is isabgol. Isabgol form a stool. But the fermentable soluble fiber, two category, gel forming fermentable, non-gel forming, like inulin, fructooligosaccharides. They are non-gel forming soluble fiber. They goes to colon, quickly convert into short chain, SCFA, short chain fatty acids. The colon pH slightly comes down. The colon inflammation is counted, and harmful bacteria, the growth of harmful bacteria can be mitigated. This is an amazing pathway. Like my sister was suffering from UTI for very long. She stays in USA from maybe antibiotic resistance E. coli UTI. And I suggested her prebiotic fiber of high dosage, Within 10 days, she got complete recovery. Because E. coli bacteria, what happens, the colon pH, when my sister consumed the prebiotic fiber, is converted into short chain. The pH comes down. So E. coli bacteria cannot reproduce over there, it cannot multiply. That's a simple trick of controlling the colonic inflammation by different, even autism. Short chain fatty acids are highly beneficial for autistic kids. Same property is applicable because autistic kids produce lots of toxins from colon. And when scientists compared the stool of parents, siblings, and autistic kids, scientists found isolated 3 extra bacteria from the colon of autistic kids belongs to Clostridium category, and all this Clostridium bacteria known to produce neurotoxins. Got it here. So the short chain fatty acid counter the growth of Clostridium bacteria. That's why this is helpful for autistic kids. So anything related to colonic inflammation, UTI, autism, and I'll list out the disease benefited from short chain fatty acids. Okay. So these are the food rich in soluble fiber, flax seeds.
Gel forming urinary. This is not gel forming.
See, gel forming is mainly isabgol. Non-fermentable gel forming. Infermentable, this all comes under this categories, Inulin, fructooligosaccharides, isabgol, not isabgol, pectin, mucilage type of fiber, gorgums also, gel forming fermentable. Yeah, pardon? Yeah, banana contain resistant. Not only this one, not only the prebiotic fiber, soluble fiber, resistant starch also convert into short chain fatty acid. That's why I told you when you cool down the rice, you are increasing the resistant starch that goes to colon, and that's also taken by microbial colony and quickly converted into short chain fatty acids. Okay.
Resistant starch comes under gel forming.
No, they're different category. See, in soluble fiber, 2 category. Prebiotic fiber and resistant starch is different category. They are not under the fiber care. So resistant starch eventually converting to prebiotic. It has a prebiotic property. Yeah. Mustard seeds also might be having fiber. I don't know exactly.
Don't have it. It promotes the fermentation. When they make the kanjis and all, fermented liquids for the solutions for summers.
Okay.
Mustard seeds in beetroot and all that.
Okay. Might be. I'll check into.
Yeah. Prebiotic solution.
Okay, I'll look into that aspect also. Okay. Yes, sir. So this is all the very rich source of soluble fiber, and soluble fiber, short chain fatty acid, lower the pH, favor the bifidobacteria, produce lactic acid, pathogenic bacteria cannot survive. Yeah. So let me, list out the benefit of short chain fatty, the role of short chain fatty acid in cancer prevention and cancer treatment. Anti-proliferate effect of short chain fatty acid on human colorectal cancer cells through gene expression inhibition. Short chain fatty acids colorectal cancer cell to activate auto anti-tumor immunity, anti-tumor. And you see every doctors globally, they accuse red meat for colon cancer. But I'm talking red meat definitely because of excess iron content. That is it's a minor factor. But the major factor is secondary bile acids. You see in Karnataka, I stay in coastal Karnataka, where highest colorectal cancer is found for Havyaka Brahmins. My friend belongs to Havyaka Brahmin community. And there is a statistical studies I found that this coastal Karnataka Brahmin community have more prevalence of colon cancer than any other community in Karnataka.
They eat more sweets or non-veg.
They never consume non-veg, they never consume non-veg.
Sweets, because whenever they go for
Yes, the problem that you see, the major problem today in Brahmin community, they were all in Karnataka, they had a huge farmhouse before. Now all kids are well educated. They are into they are doing the most affluent people of Karnataka. So they migrated to Bangalore, and their the food habits are completely, and butter. The name of butter came from short chain fatty acid. The name of butter came from short chain fat, butyric acid. The 2 carbon molecule is butyric acid. Butter derived from butter contain lots of butyric acid. That's why Ayurveda, all the gut medicines are made up of the basis. They never choose any other lipids for fat. Okay, because it's contained butyric acid. How the butyric acid generated? Similarly, the soluble fiber in grass goes to the colon of cow, and it converts into butyric acid and enter to bloodstream, and it comes out in the fat. You got the mechanism. So if the cow eat grass, only then you will get butyric acid. If you give the feeds, you don't get you may not get the. So this is an amazing molecule. It reduces the risk of colon cancer by 90%. And you see, make sure that whenever you eat sweets or hotel foods, carry little chia seeds. Yeah, keep in a small cup of water, drink it along with that, so that will negate the side effect of bile salts will be absorbed by chia seeds. It reduces the production of secondary bile acid. A simple step can prevent, and I think around 3 lakh of colon cancers are detected every year in India today. And this is a simple, the most powerful and single most effective way to control the colon cancer. At this concentration, short chain fatty acid induce 8 to 11-fold increase in serotonin. And so it's good for anxiety. It increases serotonin and beneficial for constipation as well. Because serotonin improves the peristaltic movement. So there is a multiple benefit of serotonin, butyric acid in the functional constipation. Anaerobic bacteria is a novel probiotic treatment approach for inflammatory bowel disease. Short chain fatty acid in colonic inflammation, carcinogenesis and mucosal protection and healing. Butyrate induced apoptosis in colorectal cancer cells in induce induction of a cell stress response. So we know that today the defect in apoptosis is the main cause for the cancer major mechanism. What do we mean by apoptosis? That is derived from a Greek word. No, this basically it came from the apoptosis. It derived from a Greek word, apoptosis. That means falling the leaf. The dry leaf fall off. Okay, dry leaf fall off. Falling the leaf is called as apoptosis. So this has an application. So why they kept this name? Because the dry leaf fall off and fresh leaf appears. Okay, but that's a normal balance. So just imagine if the dry falls, never falls. It accumulates. That is cancer. Yeah, so defect in apoptosis. So they use this word to illustrate apoptosis, So the poor cell death. The old cells are billions of cells take birth every day, billions of cells die. So that dead cells to removed, So that process is apoptosis is activated by short chain fatty acids in colonal mucosa. effect of oligofactor enriched inulin supplementation on gut microbiota, nutritional status, and gastrointestinal symptoms in pediatric celiac disease patients on gluten-free diet. Study protocol. Allergic airway. Yes, so short chain fatty acid has a receptors on multiple cells. It's not only in colon. So we spoke about properties of short chain fatty acid in colon mucous membrane. It is not just confined in colon alone. From the colon, the short chain fatty acid enters to bloodstream. And this started binding to receptors on every cells in human body has receptors for short chain fatty acid, including nucleus, So the inflammatory genes can be turned on by anti-inflammatory genes can be turned on by short chain fatty acid because short chain fatty acid has receptor on inside nucleus. They have a receptors on white adipose tissue, brown adipose tissue, and they have a receptors on blood vessels like renal artery. The receptor is called as olfactory receptor 78. This is a receptor for short chain fatty acid found in renal artery. We know, and renal artery control blood pressure. So if the short chain fatty acid bind to olfactory receptor in the renal artery, it leads to vasodilation. And you see this is a magic molecule. If the short chain fatty acid bind to the osteoblast and adipocytes, the mother cells of osteoblast and mother cells are same. So bone cells and fat cells both are generated from same mother cells, mesenchymal stem cells that can differentiate into muscles or so if short chain fatty acid bind to the mother cells, mesenchymal stem cells, the mesenchymal cells transform into osteoblast rather than, so that means the fat mass can convert into bone mass by short chain fatty acids. So that's what, it's a wonder molecule, most underestimated in medical practice, short chain fatty acid. That's why I called initially, there is only one superfood if someone asks me, that is short chain. It can fuel the gut bacteria and additionally human multiple receptors to control the homeostasis of human body. The short chain fatty acid receptors regulate bone mass by promoting adipogenic differentiation of mesenchymal stem cells. You see, this is study. Short chain fatty acid regulates systemic bone mass and protect from pathological bone loss. It increases the calcium receptors on digestive tract, so the absorption is facilitated. It increases the iron receptors on epithelial digestive tract, so the iron absorption is promoted. The role of short chain fatty acid in appetite regulation and energy. So this suppresses the ghrelin secretion and increase the appetite suppressing hormone. Gene expression, the histone acetylation of short chain fatty acids, histone deacetylation and histone methylation. This is a major underlying mechanism of gene expression, can be regulated by short chain fatty acid. So type 2 diabetes. Diabetes is called as diabesity. So this is the answer for diabesity also, short chain fatty acids. Yeah, so this is the highest sources of sesame seeds, flax seeds, chia seeds, fenugreek seeds, cumin seeds. So I will ask my patient to blend 100 gram of flax seeds, fenugreek and sesame seeds, mix it together and grind. I recommend 2 tablespoons thrice daily because this is a rich source of so I have lots of rural patients, they don't very lower economic classes, so I recommend this prebiotic fiber for the regular usage.
So you blend this in 2 tablespoons every day?
Yeah, powder and keep in a tumbler and give 2 tablespoons every day. And ask them if
smoothie also.
Pardon? Smoothies or it's good for everyone, from a small child to Pardon? This is a missing nutrient. This is not a supplement. The prebiotic fibers are, when we started adopting agriculture about 12,000 years ago, human beings started adopting to agriculture, So that's the moment the prebiotic fiber disappeared from food chain. Because the grains are rich source of insoluble fiber.
Which is not prebiotic.
Prebiotic fiber. That's where all the gut issues started. That's when it's like 12,000 years ago. This transition had a profound impact on gut microbes. So I suspect that we started losing our gut bacterial colonies 12,000 years ago. Soon after, we have switched over to a grain-based, agriculture-based diet. So the prebiotic fibers are extremely low. This is the exact reason I did extensive studies on human breast milk nutrition, and really astonished to see the macronutrient profile of human breast milk. The first one, the fat. We've seen the fat around 40%, carb around 4%. Protein is 0.8% in human breast milk, consists of 0.8% of protein. The third major macronutrient of breast milk is prebiotic fiber, 2%. 2% of prebiotic fibers are naturally found in human. It's called as human breast milk derived oligosaccharides. Okay, they are designed to feed our gut bacteria. Mother Nature know that we have two types of cells. Not only human cells, we have bacteria cells, residing inside our gut. So to feed the gut microbes, the breast milk of human being contain 2% of prebiotic fiber naturally. That is a significance. So there are guava fruit, all this mucilage type of vegetables are rich source of prebiotic fiber. Dragon fruit, lychee, passion fruit, the Bisleri suppu we call in Kannada language. These all are natural source of prebiotic fiber. List of disease benefit with the short chain fatty acid, ulcerative colitis, Crohn's disease, rheumatoid arthritis, colon cancer, non-alcoholic fatty liver disease, ankylosing spondylitis, constipation, hemorrhoids, hypertension, anxiety. This is all very highly beneficial to handle. So autoimmune disorders, if it is gut related, the main magic elixir is short chain fatty acids, not the probiotic fibers. Okay. Rheumatoid arthritis, I have mentioned that gut related and non-gut related. Gut related seropositive rheumatoid arthritis patient is found to be very effective. That reduce the symptoms, and maybe even it can induce remission also. Because the RA positive patients, the stool, the scientists isolated excess growth of a bacteria called as P. copri bacteria. Impact of Porphyromonas gingivalis periodontitis. So, two microbes. One is colon bacteria called as the Provotella copri, and the oral bacteria, Porphyromonas. Both can trigger autoimmunity, anti-rejection. So then, for ankylosing spondylitis, the patient with the AS symptoms, they have abundance of a bacteria in colon called as which bacteria? Klebsiella bacteria. So hypothesis, the time for gut check, HLA-B27 predisposed to ankylosing spondylitis by altering the microbiome. For example, the HLA-B27 is the predisposing. 100% of AS patient, they have HLA. But the mystery is that not everyone develops symptom. Only 2% develop symptom. 98% of HLA-B27 patients are asymptomatic for lifelong. Only 2%. So scientists want to figure out the underlying, they want to conclude what could be the underlying cause. Then they have genetically modified rats with HLA-B27. So today we have 5 patients with HLA-B27 and 5 rats with the HLA-B27. They all are asymptomatic. Only one individual is symptomatic. Okay. B27. It's like the seeds, if you store in a container, never get germination. If you throw to So environmental factor is required for activation of the. Similarly, HLA-B27 is activated by some environmental factor from the stools. And finally, they lead to conclusion that the Klebsiella produces a toxin, and only the symptomatic patient has excess of Klebsiella. So it is HLA-B27 is not the criteria to ankylosing spondylitis. It is the whether you have this particular bacteria, which is called as Klebsiella bacteria, that produces toxins and that activate HLA-B27 and inflammation, leading to ankylosing spondylitis. Okay. So this signifies the important role of gut microbes on. It's a mystery actually. Even I cannot.
Sorry, can I ask you one question? In celiac disease, is there any particular bacteria that aggravates it?
Yeah, I'll tell you. The celiac disease, there is oral bacteria in pre-digest the gluten. Okay. It's only this. It does.
Change the cells, sir?
Yeah. So see, celiac disease, undigested gluten. I was mentioning about protein, long proteins, So gluten is the major problem of gluten, that I think it consists of 3000 amino acids. So it's very longer and complex to digest. Okay. So when you chew properly longer time, the gluten break into small pieces. That will not cause celiac. And there is a receptor for the gliadin or gliadin actually. I forgot this pathway actually. And that bind to that receptor. So you can minimize this symptom by either by short chain prebiotic fiber, if you feed prebiotic fiber for 6 months to 1 year, and you can, this receptors can be suppressed, like you see, the receptors for.
In celiac, there's actually DQ, there is
DQ8.
DQ8, yeah, in
And 2.5.
Yes.
Hello? Which is HLA?
The genetic marker that is predisposed for celiac. So any bacteria, that can be aggravating it.
Yeah. You see, the celiac disease, for instance, the wheat is consumed by the first domesticated by Europeans. The Europeans, they have exposure to wheat for very longer time of periods of, maybe you can say 8,000 years of exposure to wheat. South Indian diet, the wheat came very recently. So who should have tolerability to wheat? Why? Because they accustomed to wheat for very longer time. But the South Indian have extremely low risk of gluten allergy compared with the European population. What's the difference here? The gut bacteria, like my sister, my sister Lisa, my mother's family, my mother has 7 siblings. All of them are settled down in USA. I think, except few of my sister, myself, and one more cousin born in India. Rest of them are born in USA. So we have a family group today, Platottam, my mother group, very huge family spread out all over Kerala. And Lisa, my cousin, she was flying from US to Sweden and bit a piece of biscuit contained cashew. She had an anaphylactic reaction and almost she died on the flight. Okay. And there is a critical food allergy for my cousins. None of the cousins in India has this problem. Got it here. We are born in a village, exposed to, we had lots of cows in my home. Actually, I was a villager. I born and brought up in a village. I used to graze the cows for up to my 10th standard, and we had a cocoa plantation. So we had a very good exposure to microbes. So our microbial colonies are very stronger. They are born in an apartment or the sterile house. So this determines it's not the gluten or. Yeah, this is controlled by the type of bacteria in your gut, That's why you see the South Indian, although we have a lower, but I think the next generation may develop gluten allergy because of their food habits are extremely dangerous today, young generation. They eat lots of junk foods. Prebiotic fibers are almost zero in their diet,
South you consume a lot of green banana.
And you see, we have a better, that could be, So that's why you see, I was really astonished. None of my cousins in India have any food allergy. But they cannot eat prawns, so many food allergies, That says that it's not the genetics. the genetics of gut microbe determine how final outcome. Okay. So increase urinary excretion of metabolites in gastrointestinal tract in urine sample from patient with autism. So fine, madam.
No, they are not getting to you properly. Hello, IT.
Yeah. So we have seen Klebsiella for ankylosing spondylitis, the overgrowth of colonic bacteria. Okay. Next we have seen P. copri for rheumatoid arthritis seropositive. Likewise for schizophrenia and autistic patients, they found a strain of bacteria which produce this toxic materials like they all are neurotoxins. You know, from the colon they can enter to bloodstream and reach to brain cells and activating. You know, yeah. So this is a Clostridium bacteria. So the mantra to treat gut-related autoimmune disorders, short chain fatty acid derived from prebiotic fiber that goes to colon and convert into short chain fatty acids, and you know it slow down the growth of P. copri bacteria, which is associated with the seropositive arthritis, Klebsiella bacteria associated with the autism, Clostridium bacteria associated with the autism, methanogenic bacteria related to constipation, E. coli bacteria linked to urinary tract infection. Even for SLE, that's a major the protocol to handle autoimmune disorder related to colonic dysbiosis. Okay.
So for SLE, which bacteria?
Huh?
SLE, which bacteria?
SLE, I forgot, madam. Just like okay. So the short chain fatty acid convert into back fiber and inulin. Psoriasis, colonic inflammation can be counted, and this is a skin disease protocol. Psoriasis, eczema, dermatitis, urticaria, seborrheic dermatitis, and gut toxicity, and we need to figure out two factors for skin disease: liver toxicity and gut toxicity. And how to identify whether it is gut or not? The major protocol is something called as virejana. When the virejana reduce symptoms, the virejana, usually I recommend my patient 30 ml of castor oil, blend with 1 teaspoon of lemon juice and 1 teaspoon of ginger juice. Dry ginger also. Okay. 30 ml of castor oil. Okay, 30 ml of castor oil, 1 teaspoon of ginger juice, 1 teaspoon of lemon juice. Mix it and with the mild hot water, lukewarm water. Yeah, gulp down morning. And they need to repeat, every half an hour.
Works well.
Yeah, so they goes to multiple times to the toilet. It induces a purgation, and patients, if they report
How many days?
little bit of hot water after morning empty stomach. This procedure should be
Do it
done.
for how many days?
Pardon?
How many days?
One time. It's for investigation. Yeah, first day, then they goes to toilet of multiple times. Okay. So they says that the patient report reduction of itching and symptoms gut related. If there is no changes, non-gut related. Don't go for a gut protocol. This is how. Yeah. So virejana to figure out gut or non-gut related. Okay. And first step, 30 ml of castor oil, 1 teaspoon of lemon juice, 1 teaspoon of ginger juice. Mix it. Add little hot lukewarm water. Drink it quickly, and every half an hour start drinking hot water. After 2 or 3 hours, around 8 o'clock or 9 o'clock, they start going to the bowel movement. Purgation will be induced 5 to 6 times. After the purgation, if the symptom reduce, itching reduce, symptom reduce, gut related. There is no symptomatic reduction, non-gut related. This is a simple test. I don't require any expensive stool mapping. This is a simple test. Very successfully we have.
So, how many times every half an hour you need to take?
No.
First is take this and then.
Only once. Only once. Yes, once. Yeah.
This
percentage of bacterial load, regardless of good or bad. The 50% of total bacteria eliminated from body by viragina. Psoriasis, eczema, dermatitis, urticaria, seborrheic dermatitis. The origin could be gut or liver. This is an oxidative stress. And additionally, beside that, in gut-related skin disorders, Ig positive, mostly Ig will be, Ig antibody will be positive. Non-gut related, Ig antibody will be negative. And you see the extensive type of plaque buildup, like psoriasis and redness indicates the gut-related. Uh-huh. No. It's only for
Yes, psoriasis.
Huh?
Psoriasis and what you said, gut related.
So gut.
Psoriasis, gut related extensive redness.
Yeah. See the eczema, the redness, extensive plaque buildup from the head to the toes, And in liver toxicity or oxidative stress, the patches are scattered like a small type of, very difficult to treat. Okay. And another important thing, they're sensitive to some type of protein-rich foods. The gut-related psoriasis, if they consume the proteins like eggs or sometimes dairy products, most important, this is a probiotic, Histacler is formulation which is developed by, amazing result for Ig mediated psoriasis. It's a herbal formulation and leaky gut formula for 2-3 months. So this is a combination. So 2 Panchatantra protocol for autoimmune disorders. One is liver related and then this is a skin disorders. Then other autoimmune disorder, I will explain this protocol. Scalp psoriasis, local nutrition deficiency, multivitamin, derma, follicare, omega-3, nalpam, the medicated oil, gut-related 80%. And for another, you have to repeat viragina for 6 months, okay? For gut-related skin disease, 6 months to 1 year. Once in a month, recommend viragina. That's how we can remove the harmful bacteria and simultaneously restoring good bacteria by prebiotic fiber for long run. So after remission, don't stop prebiotic fiber. Even you can continue with the leaky gut formula also. That reduce the gut inflammation in long run. So thyla, this is a viragina with Aranda thyla or castor oil. Maybe you can use Aranda castor oil. Then spore flora, avipatti churna, continue for a long time because constipation should be addressed. Okay, if you want to cure the skin disease by root cause, constipation should be So I will keep them a long-term mild laxatives like avipatti churna, soluble fiber, leaky gut formula, multivitamin. This is for gut-mediated psoriasis, liver-mediated, very extremely rare, choline, oxyguard and avipatti churna for liver meal. So this is a scalp psoriasis addressed. So constipation 3 steps, high fat diet, increase bile salt, convert into secondary bile, soluble fiber convert into short chain fatty acid, improves the serotonin, soluble fiber and herbs address methyl bacteria and colonic peristaltic movement is controlled.
What about pemphigus, pemphigoid? Pemphigus, pemphigoid, blistering.
Blistering, you know. So 2-3 patients I treated, that's all so far, and result was not very promising, I think, yeah. Because the autoimmunity could be the trigger from viral origin, like rheumatoid arthritis patient of seronegative origin, no? They have EBV virus positive, So cytomegalovirus can be a trigger for SLE. Multiple sclerosis strongly related to viral origin. GB syndrome strongly related to. So there are multiple factors for trigger can come from multiple, from the mucous membrane of colon, mucous membrane of intestine. Ig antibodies are generated from mucous membrane of intestine. Okay. That's why it is little bit of difficult. But if Ig is positive, Viragina is positive. The best result for autoimmunity, you can handle by Crohn's disease, ulcerative colitis, and urticaria, psoriasis. Amazing this, and Hashimoto thyroiditis. You know, these are the autoimmune disorder. Almost 100% success rate.
Sir, even it's useful for Alzheimer's also.
Short chain fatty acids.
Yeah.
So the treatment protocol Panchatantra, prebiotic, probiotic, digestive, and same herbal antibiotic and diet. Diet is mainly grain-free, salads, soup, butter, coconut milk. Why I am emphasizing on butter?
Which butter you use? Normal Amul?
We get a high quality.
Is white butter from grass-fed cows?
Yeah, we get a normal. It's a or lumen. The below the lumen is the mucous membrane called as biological barrier. Sorry, this is a lumen, microbial layer, mucus layer, epithelial layer, immune cells. And you know, this is the 4 layers of gut tract. And mucous membrane, there are trillions of microbes on the biological barrier. Just beneath the microbiological barrier, you have a thick mucous membrane and a bacteria called as AM, Akkermansia mucinifera. That's a bacteria produce mucous membrane. You know, so that is one classical feature of autoimmune disorders: thinning of mucous membrane. Thinning of mucous membrane. So Ayurveda called as Nigdam, lack of mucous membrane. You know, so this is where many autoimmune disorders are kicked out. Like below this one, epithelial cells and immune cells. 70% of immune cells are found in below the digestive tract. You know, 70% of total immune system in human body. Yeah. So this is where the autoimmune disorder originate, activation of immune system. So in leaky gut is a condition where mucosal immunity and trained innate immunity of the gut. Diet, microbiota and mucus layer, the guardian of the guardian of our health is the mucous membrane. Okay. So what happened during leaky gut? Leaky gut, the intestinal epithelial barrier, the therapeutical target, the mucosal immune response to biology, disease, promotion and treatment, interaction of commensal pathogenic microorganism with the intestinal mucosal barrier, exploring the link between leaky gut related markers and metabolic health, gut derived low grade endotoxemia, atherothrombosis and cardiovascular disease, the use of biomarkers associated with leaky gut as a diagnostic tool for early intervention of autism spectrum disorder, leaky gut and immunity. Yeah, so this is what happens in leaky gut. The first, the major characteristics of leaky gut: thinning of the mucous membrane and widening of the epithelial cells. You know, there is a huge gap is generated inside the epithelial cells that leads to a potential exposure of the microbes to immune system, because 70% of immune system located below the monolayer of epithelial cells. What happened when the thinning of mucous membrane leads to exposure of the microbial layer to immune system, that provoke the immune system and leading to autoimmunity. Yeah. This is called as.
So what biomarkers you use for leaky gut?
That's what, you know. So there are some proteins. Can you spot a protein? The each epithelial cells, monolayers, and the serotonin is produced from this monolayer, like endochromaffin cells. There are hundreds of neurotransmitters which all are basically produced from this monolayer of epithelial cells. Okay. So, and next one, the widening of the gap between epithelial cells. So this gap is tightly, the epithelial cells are tightly attached by proteins like sonulin. There's got adhering tight junction proteins. Okay, cadherins. There are different proteins. I forgot E-cadherin, JMs, clodulin, occludin. Likewise, there are numerous proteins. They helps to close the gaps. You know, they will. Yeah.
Which ones are tested? What do you test?
Like sonulin. Sonulin and Akkermansia mucinifila. That is the that's the bacteria in mucus.
That's a stool test.
Yeah, this bacteria produce mucous membrane. Okay, so many autoimmune disorder patients, they have extremely low diversity of Akkermansia mucinifila. That's the responsible for production of mucous membrane. The mucus also generated from epithelial cells, but there are some factors like produced by this bacteria that trigger the production of mucus. That's regulated by this particular bacteria. The sonulin regulation of tight junctions and autoimmune disease. The influence of Akkermansia mucinifila on intestinal barrier function. This decipherating host gut microbiota, communicating immunity and disease, Akkermansia mucinifila and gut immune system. A good friendship that attenuate inflammatory bowel disease, obesity and diabetes. Disruption of intestinal mucosal barrier induced by high fructose diet restrained starch. Stress is regulated by intestinal microbiota and microbiota. Effect of high refined carbohydrate diet on intestinal integrity. So these all are the factors damage the, contribute associated with the leaky gut. Proton pump inhibitor associated with industrial foods, all the additives in industrial foods, packed food, noodles, biscuit, chocolate, this all contribute to dysbiosis, leaky gut. Colonic mucus permeability during antibiotics, non-steroidal anti-inflammatory drugs, proton pump inhibitor. This all can steadily and gradually contribute to leaky gut symptom, leaky gut and the ingredients that helps to treat a review. Akkermansia mucinifila uses, see the prebiotic fiber. So when I tried with the supplement of Akkermansia mucinifila, I did not get much improvement. But when I fed oligofructosaccharide, not fructo-oligosaccharide, galacto-oligosaccharide. This is a prebiotic fiber. Studies found that the Akkermansia AM, the diversity, the number of microbes increased by 100x times by this particular prebiotic fiber. So there are different prebiotic fiber which can nourish the bacteria and they improve the multiplication. Berberine. No, these prebiotic fibers are water soluble and they are more tolerable.
But like any other fibers, like having vegetables or...
No, we should not give for a vegetable will trigger flare up. Vegetables are insoluble fiber, no? So there's a different diet for the gastric diet is fruits, steamed vegetable. Don't give any salads for gastric issues. Yeah, these are the leaky gut protocol. Probiotics, prebiotics, probiotics, spore-based bacteria, Saccharomyces boulardii. Prebiotics like galacto-oligosaccharide, human milk oligosaccharide, colostrum, mucilage fiber, aloe vera-based prebiotics, slippery balm. So this all have added to leaky gut formula. You know, all this prebiotic fiber has been added to that one. Herbs like berberine, triphylla, licorice, amino acids. The most powerful is L-glutamine. So it's 40% of total leaky gut formula consists of L-glutamine and zinc carnosine. This is a mineral. So this is the steps to heal the leaky gut coupled with the foods to be avoided, sweets, all bakery. Sweets, all bakery products, soft drinks, proton pump inhibitors. These are the major driving factors of leaky gut, and grain-free diet. Grain-free diet, berberine, triphylla. So this is what. So you can ask any questions about, madam. You can show the products list. You know, I'll explain the products now. So any questions?
Yes. So viration, you said for leaky gut, when we want to do viration, once in a month for 6 months, we should do one time in a month.
Pardon?
For 6 months, that viration protocol you said now. Lemon juice and ginger juice.
Okay.
So that we should do once in a month for 6 months.
Yeah, once in a month. For 6 months to 1 year, we can follow for skin
Just
disease.
1 day, right?
1 day, not every day. Once in a month. Make sure that this should be followed. And with the prebiotic fiber, so we can, you know, like there's a major problem. You can sustain that remission rate for longer time. You know, that's where the main problem. Yeah. So very crucial too. So the prebiotic fiber with the viragina, best way too. That's for skin, not for all autoimmune disorders. Okay.
Gut related.
Not gut, skin disorders.
Gut related skin.
Not gut. See, in skin disorders are mainly mediated by IgE antibody. So intestinal dysbiosis. But I shown the colon dysbiosis like ankylosing spondylitis, Klebsiella microbe. Which one? Next one? Clostridium. That's related to colon, where viragina will not work out.
Only for small intestine.
Small intestine dysbiosis, there Basti works. So in Ayurveda, few category of autoimmune disorder, Basti does a remarkable job. I hope you understood. So the antibodies and autoimmune trigger can originate from leaky gut. It can originate from mucous membrane of intestine or colon, respiratory tract or oral cavity. So it's a challenging. Yeah, but seropositive rheumatoid arthritis, I shown the list of UTI, seropositive rheumatoid arthritis, ankylosing spondylitis. Next one, rheumatoid arthritis, P. copri. This could be related to colon dysbiosis. So prebiotic fiber works there. Basti may be beneficial for this category of Basti. Pardon? Colon, I am not sure about.
Colon hydrotherapy, where we partially wash the lower.
Lower, no? Rectum might be. So after colon, we need to restore the, replenish with the good microbes, you know. So very important to start with the prebiotic fiber soon after that.
I mean, if somebody is reluctant to take the castor oil and we are not able to give them the viration, so is colon hydrotherapy?
No, but it cannot clean the intestinal skin disease. You don't get any benefit. So viragina is mandatory here. So we need to distinguish the autoimmunity from colon, intestine. Even H. pylori produce a autoantigen leads to vitiligo, urticaria. 20% of urticaria could be related to H. pylori infection. No. See, I have clearly mentioned that there are some list of disease, eczema, dermatitis, where you get improvement with the viragina. You just it's a test. Like if the viragina is positive, patient get a remarkable improvement with the Virajana, that means it is gut related. That's all I'm talking. It's a small intestine mediated. Virajana improves small intestine. So small intestine related autoimmune disorders are predominantly skin disease.
And for stomach related, H. pylori related, we do protease that bread, urease that bread.
Urease test, and it's not related to autoimmunity. Here I'm talking about autoimmune disorder. First I spoke about 3 digestive disorders: stomach, H. pylori, intestine, SIBO, colon, methanogenic bacteria. They are digestive disorder. Then second step, I explained about autoimmune disorder. That could be related to small intestine, it could be related to large intestine. Large intestine, the answer is prebiotic fiber, short chain.
And Basti.
Basti.
And in small intestine.
Yeah, I hope, yeah, yes.
Prebiotic comes in both.
Both should come, yeah. It's a common for all autoimmune disorders.
Okay,
yeah.
and urticaria also we link.
Urticaria, again, you know, there are some 6 categories. Maybe it's time is running out now. I will take a section on, maybe Dr. Vishnu is expert on urticaria. I'll explain about products.
Right now we'll tell Dr. Vishnu to take product online lecture.
Lectures, no? Okay, I will go through very quickly.
Go through this,
Yes.
One lecture on product, let them.
Yes. Soon we'll, maybe within 2 or 3 days, you know.
Yes.
We can.
So that it is not wiped off.
How to scroll down, madam?
Yeah, I'll do.
Yeah. So this is a product for hypocare, mainly used for hypoacidity. Hypoacidity is a result of, hope you remember, H. pylori infection on the corpus region. Fundus gastritis leads to hypoacidity. Yeah, aging. Yes. Diabetes are many factors. I'm telling the general factors for. Next one, madam. Then this is a main, the classical product code has 2 types of fiber, prebiotic fiber. So single fiber consists of mainly gum arabic, the gum arabic powder, and it is less gaseous. It's a bug meal. It's a combination of 5 to 6 prebiotic fibers. Okay, and one small minor issue here: the bug meal, few individual. The Conis is the one laxative, very effective, but it does not, it's just a laxative, it's like a Chyawanprash, but it will not cure the root cause. It is just a temporary relief, okay. So initially you can combine together. In long run, prebiotic fiber is very crucial. Yeah, you know, maybe either you can bug fiber or bug meal, both the fiber, because they convert into short chain fatty acid and they address the root cause of inflammation in the long run.
So this constipation is for just anybody can take without.
Conis is just a laxative, but laxative with a very powerful, without cramping. Yeah.
Any age can take.
Yeah, any age can take. Yes. Next, Intestora, it's a SIBO protocol, the herb for SIBO, small intestinal bacterial overgrowth. That's consists of 5 to 6 type of herbs, mainly used to treat SIBO-related infection. SIBO, 3 protocol, fructose-free, glucose-free diet, herbal formulation like Intestora, and probiotic. Inhalis is it's like a Chyawanprash for. It's very good for. Have you used it? It is very. Rus guard, yeah. It's Inhalis is a Chyawanprash, very effective to treat chronic cough and cough with the flames. Cough with the flames and viral infection, sore throat. Inulin is again soluble fiber. So there are 3 types of soluble fiber. Why I am focusing more on soluble fiber? You know, that's what the most important for gut. You know, so 3 types of soluble fiber. Bug meal. This is a combination of multiple. Then one more is composed of prebiotic fiber. Another one is inulin. Then L-reuteri, probiotic. Optiflora is the probiotic. Optiflora mainly used for H. pylori and stomach issues. Okay. Spore flora, and you see the another important fact to notice here. The most of the probiotic strains goes to colon, they cannot attach to intestine. That's where the probiotic works, the major strains convert into short chain fatty acid. But there are some certain type of bacteria strains like spore-based bacteria, Saccharomyces boulardii, which has great affinity to intestinal epithelial cells. So spore flora mainly designed for it's mainly designed for intestinal dysbiosis like gas bloating, and the spore flora, it immediately stop traveling diarrhea because of S. boulardii. When you travel, always I carry whenever I passes, like all the bloating, gas and difficulties can be quickly controlled by spore flora. But for few people it may create constipation. It reduces the gastric motility rate, S. boulardii.
So sir, what about some people get constipation when they travel? So what can we use for them?
Conies, conies. So this is a leaky gut formula. This is one of the master product to heal the gut and leaky gut. Mainly consists of prebiotic fiber and L-glutamine. This slide, madam. This is a Boswellia, that for pain uses collagen. Collagen is good for skin, aging, and that leaky gut formula, I have also added collagen to that, collagen, yeah. Next one. This is a choline. Choline is a great for, this is a single medicine, single molecule reduce high sensitivity CRP. The one of the main marker for endothelial dysfunction, high sensitive CRP. I've seen amazing result in 1 month of period, and homocysteine. So this is amazing for endothelial dysfunction and dry skin. Two main benefit of choline. Okay, dry skin and choline. Choline is choline. That's like a natural ingredient of our safely for longer period of time. Omega-3, choline, multivitamin. This all we can use for a longer time without. Dosage is mentioned here. So Metatrim. This is a combination. I am doing the trial because I told you got an amazing result for visceral fat. But I tried with a couple of patients, so I'm associated with the university, do a trial. I want to figure it out whether it is causing any liver fluctuation in the liver enzymes, But it is giving promising result. I will launch officially this product after 6 months. After a trial, I need to look into, liver enzymes, like a fluctuation of the liver enzymes, Metatrim. So Metatrim for metabolic syndrome of all sorts of metabolic syndrome, either keto diet or 60-30-10 diet with omega-3, prebiotic fiber, convert into short chain fatty acids, and it can reduce the visceral fat, and the herbal formulation. This is a combination for metabolic syndrome. Next backside, choline. Oxyguard is the, it's a precursor of, Oxyguard is the, I mentioned there is two types of autoimmunity, oxidative stress mediated and, so oxidative stress mediated autoimmunity, Oxyguard is used for treating the disease. That produces the oxidative stress. Next one.
40 immune and symbiotics.
Yeah, this is 40 immune and symbiotics. Okay. Symbiotics is
for allergies.
Yes, allergy. Yeah, allergies, recurrent symbiotics and 40 immune.
Both are for cough and allergy.
Yeah. So 40 immune, it's a omega-3 capsule, composed with vitamin D, Trigadu. Trigadu is Ayurvedic herbs to reduce the allergy. And the frequent allergy, cold cough, for infant and old age population can be great result for this can something taken for longer time for allergic patient. So single tablet, I found great result for a nasal allergy mainly, particularly nasal allergy, not for skin allergy. Nasal allergy is effective. 40 immune and 40 immune. Yes. Next one, madam. GARD3 is the lycopene. Lycopene again good for endothelial dysfunction and oxidative stress. Improves the sperm count. The male infertility. What is the main cause of male infertility? oxidative stress, the sperm, the DNA damaged by reactive oxygen species from mitochondria leak into. That's the root cause of male infertility. Not for female infertility, insulin resistance. Male infertility, oxidative stress. So lycopene is a strong antioxidant. Reduce the, it neutralizes the free radicals, and it's good for skin. And lycopene is an antioxidant basically. With the combined with omega-3 fatty acid, and omega-3 is great for almost. And ROS3 is the ROS3. ROS3, reactive oxygen species 3. ROS3. It's a precursor of, ROS3 is a precursor of glutathione. Glutathione is expensive. Glutathione is made up of 3 amino acids. It's known to everyone, which are those cysteine, lysine, N-acetylcysteine. Okay, so what happens? It's a protein. It goes to intestine, break down into individual amino acid. Later reabsorbed to bloodstream. Again, it's combined to form glutathione in liver cells. So there is no point of feeding glutathione. If you want to get the full benefit of glutathione, only we need to bypass digestive tract, so IV. Or else that's why I have made the precursor has been added to a tablet. So it's a combination of 3 that reduce the 3 amino acids. So 3. ROS is reactive oxygen species is controlled. So the ROS means reactive oxygen species. That's a great supplement for thyroid, because Hashimoto thyroiditis and Graves' disease both are rooted in oxidative stress. It's not related to gut toxicity. It's strongly related to oxidative stress. Next one, madam. Next one. Cifogard is for SIFO. Then thyroid support also made up of all the thyroid like minerals like ferrous bisglycinate. The heme is the major autoimmune thyroiditis. TPO and ATG is there's a fluctuations like thyroperoxidase antibody and anti-thyroglobulin antibody. They are elevated for Hashimoto thyroiditis. Okay. Yeah. So that the main cofactor of TPO, thyroperoxidase enzymes, are heme. The main cofactor for TPO enzymes are heme, and heme contain ferrous. So the low ferritin is the main cause for this antibody oxidative stress here. So the low ferritin, and there are a good Dr. Vishnu can address about. I'm not very well.
So for Hashimoto, sir, you recommend this thyroid support or ROS3?
So both. Vishnu will take a class on this topic. Yeah? So I'm not expert on thyroid issues. Dr. Vishnu is expert in. Next one, sir, madam, backside. Next one. Next one, puricolis.
Puricolis is for constipation.
Sir, the PDF file is available?
Yeah, I will give.
Yeah, 200 gram powder. Yeah, puricolis. This is the actually see 3 herbal formulation I have prepared for. One is for H. pylori, for SIBO intestinal. This particular combination is a herbal powder, blend of a herbal powder designed to address colon inflammation. Yeah, large intestinal issues. So this goes well with constipation. Yeah, pardon, hemorrhoids. Hemorrhoids 100% result with the prebiotic fiber, inulin, the puricolis, and that laxative. This triple combination. Up to even 4th stage bleeding piles, I've seen remarkable improvement without surgery by this particular combination of fissure fistula, hemorrhoids. This combination works for fissure fistula. Then constipation, digestive, ulcerative colitis and Crohn's disease. IBD protocol mainly consists of the major medicine is short chain fatty acids here. So we need to keep on a grain-free diet for 10 to 15 days of maybe preferably soup diet, okay, because there is a massive inflammation is going on in the digestive tract. So maybe soup diet will be little better, and you can start feeding prebiotic fiber and steadily increase the quantity, and that's when you get maximum result. This convert into short chain fatty acids and quickly the inflammation come down, and you can combine with the leaky gut formula and this diet and SBO probiotic. So probiotic, prebiotic and leaky gut formula. Crohn's disease, 95% is success rate. You can handle, I assist you personally also when you get a Crohn's patient, you know. Ulcerative colitis, what I found that 70-30. So patient who has profuse bleeding, they get better result. The mild bleedings are taking longer time. You know, I don't know what is the mystery behind this one, but in my observation, I found that lots of patients with the profuse bleeding got a remarkable.
What about mucus?
Pardon?
Mucus retains to colitis. It will go down or what?
That's the infection. Yeah, that comes down. Yeah, comes down. You know. So the best autoimmune disorder protocol. One is for skin disease, eczema,
yes.
the psoriasis. If it is gut related, 100% result for gut related psoriasis, and eczema we have to figure it out. Eczema, urticaria we have a best protocol. Dr. Vishnu will train you, because I know only 2 mechanisms. Dr. Vishnu is expert in
thyroid also, autoimmune thyroid.
Vishnu will address that. You know, so skin disease. Yeah. Then seropositive rheumatoid arthritis, not the sero negative. Then ankylosing spondylitis, SLE. And the best result for psoriasis, Crohn's disease. And Hashimoto thyroiditis, Graves' disease also, the protocol is working amazing, like, you know. This is not related to gut. So Graves and Hashimoto, non-gut related. So oxidative stress. Seropositive RA, ankylosing spondylitis. Autism, the major problem, we required lots of counseling. The kids are there, small children, no, they don't follow diet.
But homeopathy helps a lot.
Yeah, so you can combine the prebiotic fiber with the, yeah.
Yes.
That's it, okay. Okay, so I think the...
I just have a question. Hashimoto is not related to autoimmune,
gut, yes.
So all the blastosis, hominicus and all, there's so many books on that.
Yeah. But it's an oxidative stress.
It is oxidative.
Oxidative stress, because of, and actually there is one pathway. You know, this iodine is converted into iodide by iodine, the 4 to 2. That's actually the, you know, thyroid hormone carry T1, T2 form of iodine.
So it should be given or not?
Yeah, this conversion,
Iodine should be given or not?
No, in sometimes iodine deficiency also
Causes
oxidative stress, because lack of iodine, antibodies are generated. In some circumstances, iodine may be trigger for here, you know. Okay. So then, but it is carried by him.
By him. So you feel
low ferritin is the one main for trigger for antibody, TPO, ATG. See, there is 2 antibody, ATG and TPO.
Correct.
So TPO could be related to oxidative, ATG could be related to iodine deficiency or excess iodine.
Or excess
iodine, anti-thyroglobulin antibodies are generated. Now, I'm sure that there is no gut relation. No gut relation. I can, say. See, multiple sclerosis, non-gut related. Multiple sclerosis, non-gut related. Okay. Hashimoto, non-gut related. Graves' disease, non-gut related. So then maybe urticaria without any Ig antibodies and skin disorders are not gut related. Yeah. So we need to distinguish gut, or we cannot accuse everything into gut prognosis, you know. But the most common disease is psoriasis.
Yes.
Strongly related to by Virajana you can understand whether it is gut or non-gut related. Yes. Okay.
I've attended 1 or 2 Vishnu's classes. I know Virachan works very well.
Please tell us those 2 diets.
Okay. Madam, I think, yeah.
So we have to leave.
Yes, sir. So
my flight is 7 o'clock.
Yes, madam. Madam, our flight is 6:30. We have to rush to the airport.
Take a webinar.
Yeah. We'll take it later, madam. I'm also tired a little bit, you know. Okay. Yes.
We request Dr. Praveen to organize one webinar on protocols.
Yes.
Okay, we understood theory extremely properly. So now it comes from the practicing. So
Dr. Vishnu will take protocol. Yeah, I will ask him
and
to.
within, say, next week.
Yes,
next
yes,
week,
we'll continue.
You tell him. Online only.
Chairman Apollo Hospital called this morning. They have waited you 20th 3 o'clock.
20th 3 o'clock.
Only confirmed.
Okay, sir. Okay.
I am organizing 3-4 more offline.
Okay, sir. Okay, sir. Okay. My throat is totally gone today.
No, that's why don't talk. Just take work.
Yes,
They can buy whatever is there. Yeah, you can buy also. Hey, though corn is, my mother-in-law wants. Okay, hello, if you buy products, I will share Dr. Vishnu's number, they will guide you how to use them. Okay?
Share on
And Dr. Sanchez, doctors will train them on the, they'll guide anyways. Anyways they'll guide. Agar aap buy karte ho and you get confused how to use it, then you can. Okay, and before let's take one group photo. And you, Sasha, group photo. I will share all both their PPTs on the group. Ozone you don't need, so it's okay. Someone can?
इंट्रोडक्शन से लाइव है कि उसके बाद से लाइव है?
पूरा स्टार्टिंग
इंट्रोडक्शन से जस्ट अपना इंट्रोडक्शन मैंने किसी का सुना था स्लाइड मुझे वो जानना है कि साइड
Okay, come on, let's hello. मावशी इकडे या इकडे एक 3 चेअर लाव इकडे 4 चेअर लाव चलो थोड़ा आगे ले
मैं लपेट लेता हूँ
आप बैठो हाँ थोड़ा उधर है ना क्या आएगा
जूम
Can you turn on those? I don't know how. They're on This is the best. Nothing can do that. You should be sitting here. So this is projector created. मेरा phone and Dr. Praveen. Hello, चार चाहिए जिग्नाशा. जिग्नाशा. हाँ, तू आ. ए भैया, इधर आना भाई. ओ भाई. तू मेरा ऑफिशियल फोटोग्राफर है. I am anyway a lot into discipline.
खींचने और साइड में
क्वालिटी चेक करना पड़ेगा. दिखाओ भाई, डोंट मूव.
That's your side to business. One more. Alright.
एक दो ले लो ना फटाफट
दो तीन ले लो
आई थिंक अब ऊपर लेना मुझे ना इंस्टाग्राम
अच्छे ये तो ग्रुप में ऐसे ही आता है
पोर्ट्रेट